Good morning and welcome to today's New York City Council budget hearing for the Committee on Health, Joint with Mental Health, Disabilities, and Addiction. At this time, we ask that you silence all electronic devices, and at no time is anyone to approach the dais. If you would like to sign up for in-person testimony or have any other questions throughout the hearing, please see one of the Sergeant-at-Arms. Chairs, we're ready to begin.
Good morning, everyone. I am Councilmember Lynn Schulman, Chair of the New York City Council's Committee on Health. Thank all of you for joining us at the fiscal 2026 preliminary budget hearing for the New York City Department of Health and Mental Hygiene. I would like to thank my fellow council member, Chair Linda Lee, for joining me for this hearing. I would also like to thank Acting Commissioner Dr. Michelle Morse and everyone who is with us today, and acknowledge that we have been joined by council members Menon, Nurse, Hanif, and Public Advocate Jumaane Williams. Before we start, I just have something that I would like to do with Chair Lee. So Danielle Heifetz, who has been our finance person for a very long time, is leaving the council, and so we're going to be giving her a certificate. So we're going to do that. We're going to do that now. Come on, get up. Hold it. So, congratulations, Danielle. We wish you a lot of luck in your future endeavors. Okay. Now to the topic at hand. DOHMH's fiscal 2026 budget totals $2.1 billion, which represents approximately 1.8% of the city's budget. This budget includes a little over $1 billion for the city's public health services, which comprises $478 million for personal services and just over $822 million for other than personal services. Funding for public health was reduced by almost $36 million from the fiscal 2025 adopted budget, which includes a decreased funding of approximately $49 million in federal dollars. Currently, the United States has begun the process of leaving the World Health Organization, which is an important resource for accessing healthcare data. Several staffers at the Centers for Disease Control and Prevention who were assigned to work with DOHMH have been let go, effectively cutting off New York City's direct line of communication with this critical public health agency. The federal government's policies have also threatened several existing federal grants provided to the city. And while no programs have been officially cut as of today's hearing, the threat of losing federal funds is still prevalent. It is important that DOHMH assesses all of the rapidly changing developments on the federal level to prepare for both the best and worst case scenarios to ensure that the important Healthy NYC initiative to expand life expectancy can continue to move forward and that New Yorkers stay healthy. While the council is monitoring any potential federal funding reductions, we are also looking to restore other sources of funding that were reduced in DOHMH's budget. Between the fiscal 2023 November plan and the fiscal 2025 adopted plan, there was a reduction of over $100 million due to the program to eliminate the gap and other savings programs. So far, only the HIV and AIDS services funding cut was restored and baselined at $5.4 million. However, multiple programs have not been restored yet. It is important that DOHMH reverses the prior funding reductions to community-based organizations and funds them at their prior funding level in fiscal year 2026. Before we begin, I would like to again thank the finance staff, Danielle Heifetz and Florentine Cabor, for all of their work on this hearing, committee staff Chris Pepe and Sarah Sucher, and Joshua Newman for their support. And finally, I would also like to thank my staff, Jonathan Boucher, Kevin McAleer, and Abigail Zucker. I will now turn it over to Chair Lee for her opening remarks.
Good morning, everyone. Good morning. Oh, I got a response. I love that. I'm Councilmember Linda Lee, Chair of the Committee on Mental Health, Disabilities, and Addictions, and I just want to welcome all of you here, especially our new Acting Commissioner. Thank you so much for you and your team being here. DOHMH's fiscal 2026 budget includes $713.6 million for the city's mental health services, which comprises of $60.3 million for personnel and $653.4 million for OTPS. Drop in the bucket, in my opinion, but yes. Funding for mental health was reduced by $51.2 million in federal funding and $41.5 million in city funding from last year's adopted budget. Between the fiscal 2023 November plan and last year's adopted plan, multiple mental health programs lost funding due to the citywide program to eliminate the gaps. One of the several programs that lost part of its funding was New York City's 988, also known as New York City Well. NYC 988 serves as a mental health, substance use, and suicide prevention hotline that provides services 24 hours a day, 7 days a week, and in 200 languages. NYC's 988's budget was also reduced by 33% in the 2023 November plan, and as well as the other mental health programs that lost their funding must have their funding restored in the executive or adopted budget. And at this hearing today, I would also like to discuss DOHMH's budget for disabilities, which services are the lowest funded area of the mental hygiene budget, even though it provides services to thousands of New Yorkers that rely on it. And I know a lot of our advocates are here in the room today for disability, so thank you all for being here. In addition, I will touch on the city's opioid settlement funding, which has a budget of $48 million citywide starting in FY26. The Committee on Mental Health, Disabilities, and Addictions held a joint hearing with the Committee on Hospitals in January. And while the hearing was very informative, we would still like additional clarity and transparency on how the funds are being spent. Among other issues, we will discuss topics such as the supportive housing program, coordination between DOHMH and other mental health offices, and the council-funded clubhouses contract. I'd like to thank the finance staff, committee staff, and my own staff for their preparation of this hearing. And I would also like to thank, I know I said earlier, Dr. Morse and her team for coming to testify on the budget. And now I will pass it. Oh, yes. And I'd love to recognize our colleagues, Council Members Narcisse, as well as Council Member Lewis. And it is my pleasure now to introduce our public advocate, Jumaane Williams, who will be testifying as well.
Thank you so much, Madam Chair. As was mentioned, my name is Jumaane Williams, Public Advocate for the City of New York. I want to thank Chair Shulman and Lee and the members of the Committees on Health and Mental Health, Disability and Addiction for holding this hearing today and allowing me the opportunity to testify. I just want to make mention I was here a few months ago when there was a hearing on public safety. Unfortunately, then the only discussions was around law enforcement. I just want to make sure that we're clear that these conversations, particularly around mental health, are really important when it comes to public safety, and we have to broaden the scope of what we think public safety is. Recognizing the difficult times the city and the country at large faced with funding cuts at the federal level, I was pleased to see that there was a 3.32% increase in the funding for the Department of Health and Mental Hygiene in the fiscal year 2026 preliminary budget. I do wonder if that is enough. After the steep fiscal cliffs experienced after the expiration of COVID-era programs, I know that there's been a concerted effort to balance the budget and find new revenue streams for a variety of critical programs. So I do want to commend the Office of Management and Budget for their work. Now more than ever, as New York City faces new questions on how to prepare for future public health emergencies without data and resources from the federal government, we need to invest in our public health systems. In any given year, more than 1 in 5 New Yorkers experience psychiatric illness, with low-income people of more color often unable to access any treatment or support. Barriers to effective care include a host of issues related to a lack of adequate insurance, stigma and discrimination, lack of access to stable housing, and others. In his City of the State address, the mayor announced the Bridge to Hope program, which would establish a supportive home-like environment to health and hospitals patients with serious mental illness who are ready for discharge from the hospital but do not have a place to go. This program builds on the extended care units model, which offers inpatient care to patients who have been historically disconnected from health and social services for up to 120 days. The Bridge to Home program could make a vital difference for people with limited resources, and we look forward to seeing it ramp up, expanded, and begin operations. I would like to turn my attention to involuntary transports. In November 2022, the mayor released a mental health involuntary transport protocol outlining the process by which involuntary transport initiated by clinicians and/or police officers would be concluded. Under this protocol, individuals will be transported to a hospital emergency room to be evaluated for admissions to psychiatric treatment. In 2024, there were a total of 7,060 officer-initiated involuntary transports and 660 clinician-initiated transports. The 2023 2024 report from the Mayor's Office of Community Mental Health cites 58% of clinician-initiated transports resulting in admissions at a New York City public hospital, but the reports fails to report on the outcomes of officer-initiated transports. Just this morning, there's an article that shows the program that connects links NYPD with clinicians has about 100 involuntary removals just in the first 6 months, and we still seem to be wanting to change the laws around involuntary hospitalizations when, quite frankly, that tool already exists, and what we should be focusing on is the continuum of care that people receive after the hospitals. It is not about involuntary hospitalization. It is about the continuum of care that's necessary after the hospitals. Programs like Be Heard, launched in 2021 to address mental health crisis calls with non-police responses, cover only about a third of all mental health calls made in the city out of eligible mental health calls. Be Heard teams responded to 14,900 calls, accounting for 73% of all eligible calls in the pilot area during the program's operation hours. This is an improvement from previous years, but I'm curious to hear how we can further support the work of the program, as one of the primary challenges for the teams have been hiring enough social workers and EMS staff as a result of continuous cuts to the program's budget. I also would like to highlight the need for increased funding around overdose prevention. The number of drug overdoses have been increasing over the past decade, and the influx of fentanyl in the drug supply has only exacerbated this issue. In 2024, the New York City Maternal Mortality Review Committee, MMRC, determined that about more than 90% of all pregnancies-associated deaths were preventable, with overdose ranking fourth amongst leading causes. Recent overdose deaths in our subways also highlight the need for collaboration on a number of measures ranging from syringe collection to the distribution of overdose reversal medication. I'm hoping in the testimony today we can hear information about the rate of officer-initiated transports under the Mental Health and Voluntary Transport Protocol, the fiscal needs for programs like Be Heard, and how we can integrate peer support specialists and other mental health infrastructure into their work, and does DOHMH have any program or policy in the pipeline to support overdose prevention, and finally, where the city is in terms of fulfilling the 1515 mandate for supportive housing. Supportive housing is an essential component of responding to the city's mental health crisis, and I'm concerned the city is lagging behind, not only when it comes to constructive or supportive housing units, but also in processing applications for supporting housing. Look forward to hearing from the administration on these matters and working with City Council to address the critical gaps in our system. Right now, I think in the past 7 years, I've seen about 10 surges of police into our subways, including 2 surges of National Guard, and we still have been able to address the mental health issue, which means probably law enforcement by themselves cannot solve this issue, and I really hope we start focusing on some other things. And as I said downstairs, I'm hoping that we can do what we all agree on, including law enforcement, who do not want to be the primary people responding to mental health crisis, which is fund, structuralize other options as well. Thank you so much.
Okay, and I will now pass it on to the committee council to administer the oath.
Thank you, Chair. Good morning. If you can please raise your right hands. Now, in accordance with the rules of the council, I will administer the affirmation to the witnesses from the mayoral administration. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council members' questions?
Yes.
Yes. You may proceed.
Good morning, Chair Schulman, Chair Lee, and members of the committees. I'm Dr. Michelle Morse, Acting Commissioner of the New York City Department of Health and Mental Hygiene. I'm joined today by our Chief Financial Officer, Aaron Anderson, and members of our senior leadership team. Thank you for the opportunity to testify today on the department's preliminary budget for fiscal year 2026. At the Health Department and across New York City government, we have a responsibility to serve all of New York City's residents, regardless of immigration status, race, ethnicity, ability to pay, employment status, or primary language. We're grateful to have a council that's so focused on the health and well-being of all New Yorkers. The Health Department has a 220-year history of serving New York City. Today's hearing falls on World Tuberculosis Day, and TB provides an apt example of our historic impact. In 1850, when the department was in its infancy, tuberculosis was the leading cause of death in New York City. And the average age of death was 20. Since 1904, we've been providing tuberculosis treatment at our clinics. Today, we are the main clinical provider for TB in New York City. We treat nearly half of all TB patients in the city and 75% of multi-drug resistant cases. In recent years, tuberculosis cases have been ticking up again. We've confirmed 839 cases of TB in 2024, the highest rate in the city since 2008. We've contained outbreaks before, and we can do it again. TB is, of course, just one example. The New York City Health Department has been at the forefront of the HIV/AIDS crisis of the 1980s and 90s, the COVID pandemic response, including our historic vaccination campaign, which saved the lives of an estimated 48,000 New Yorkers, and the facilitation of safe and legal abortions for people nationwide who lost their constitutional right to end a pregnancy in 2022. For 220 years, this agency has been a leader in public health, a field that has changed the course of human history. Public health can be a difficult story to tell because our greatest successes are crises averted. For instance, since Congress established the Vaccines for Children program in 1994, the CDC estimates that childhood vaccinations have prevented 504 million illnesses, helped avoid more than 1.1 million deaths, and saved nearly $2.7 trillion in total societal costs just in the United States. Routine childhood vaccinations have effectively eliminated diseases like polio and measles in this country. The recent increase in measles cases in the United States is a sobering reminder of how important it is to continue this life-saving work. There is perhaps no currency more valuable than time. By consistently investing in the health of this city, we've given generations of New Yorkers decades of more life. Over the last 120 years, life expectancy in New York City has increased from the early 40s to the early 80s. However, in a society stratified by race, class, geography, and more, we are facing vast inequities in time that mirror historic inequities in resources. In New York City, life expectancy can vary by more than a decade from one neighborhood to the next. For instance, residents in Soho live to nearly 88 years, while those in Brownsville die almost 12 years younger at age 76. That is unacceptable, and we're working to change it. Ultimately, we're working to give every New Yorker as much time as possible with the people they love. At the Health Department, all of our work ladders up to one principal goal: to equitably raise New Yorkers' life expectancy to its highest level ever, 83 years by 2030. Our Healthy NYC campaign was launched not as a singular health department initiative, but as an overarching framework for how New York City should approach health. And we didn't do it alone. Thank you to Chair Schulman and to this council for unanimously passing legislation last year that codified Healthy NYC into law. This local law holds the health department accountable to extend and improve the lives of New Yorkers for years to come. Our most recent set of data indicates that we're moving in the right direction, but as we gain back some of the time we lost in the pandemic, we've maintained the pre-existing inequities in lifespan. Black and Latino communities die younger than their white and Asian neighbors. Despite citywide gains, Black New Yorkers are dying more than 5 years earlier than white New Yorkers. I want to take a moment to delve into what's driving both the increase in life expectancy and the persistence of racial inequity. First, we can take pride in the fact that we're gaining back years largely because our COVID-related mortality has dropped so dramatically. Our 2024 data shows that COVID deaths have dropped by 96% since 2020, and hospitalizations are down 76%. That drop is in and of itself an enormous victory. But what stands out to me is that overall numbers have declined and the racial inequity in mortality rates has narrowed significantly. That was no accident. When we realized that Black and Latino New Yorkers were getting vaccinated at lower rates, the Health Department created the Public Health Corps, a community health worker-led initiative focused on vaccine outreach in priority neighborhoods. As government, we recognized that we weren't the right messengers. The Public Health Corps ensured that people of color were getting information about and access to vaccines from trusted community members in the language, location, and approach that they wanted. Our COVID recovery trajectory is proof that we can make meaningful, equitable, and rapid change when we have the political will to work across sectors and take a whole-of-government approach, and when we appropriately invest in public health. Unfortunately, extreme racial inequities persist among other causes of death in our city. There's perhaps no starker example than maternal mortality. We recently published our latest 5-year analysis of maternal mortality in New York City. That data found that Black women and Black people who give birth are 6 times more likely to die of pregnancy-related causes than their white counterparts. I'm grateful for the support of this Council on Maternal Health, especially Speaker Adams, who leads the City Council Steering Committee on Maternal Mortality, which I have the honor of serving on. Maternal mortality is among our top strategic priorities because it so clearly highlights the health risks of systemic racism. Another element of our work aims to reach as many people as possible by focusing on chronic diseases, which continue to be the leading cause of death across all racial groups in New York City. Again, that's the #1 killer. We recently released a citywide report that details our existing and proposed new work on chronic disease prevention. It calls attention to the structural and environmental causes of chronic disease and seeks to address them directly. That requires a whole-of-government response with a focus on neighborhoods with the most unjust health outcomes. Our chronic disease plan was a collaboration across 22 city agencies and offices, and we're partnering with several of those agencies, including New York City Public Schools, Health and Hospitals, and New York City Parks, to launch and expand upon programs that recognize that fundamental needs like income, affordable housing, and access to outdoor space directly impact our health. Our neighborhood health action centers, which are located in neighborhoods with the highest rates of premature death in the city, are a critical part of driving our resources to areas with the highest need. I believe wholeheartedly in the potential of this work. That, of course, is the reason we're all here today. Every piece of our work at the Health Department requires sustained funding to be successful. In public health, we often see a boom-bust cycle of funding where money swells during emergencies and dries up in the aftermath. We're no longer in the COVID funding boom. Our pandemic response was bolstered with temporary federal funding, but much of the life-saving work funded by pandemic-era grants that will soon expire remains critical for the health of New Yorkers. Public health risks continue. COVID-19 is no longer our most urgent concern, but chronic disease, avian flu or H5N1, and vaccine-preventable diseases are threats today. We're at risk of losing the funding that equips us to prevent outbreaks, and should they occur, respond immediately. We're entering a public health funding bust while facing unique infectious disease threats and insecurity in our federal funding under the current administration. Now I'll turn explicitly to our preliminary budget. The Health Department has approximately 7,000 employees. 2024 marked the second consecutive year in which hiring outpaced staff departures. We're successfully rebuilding our capacity in the wake of staffing shortages caused by the pandemic. However, we have an operating budget of $2 billion for fiscal year 2026. About $1 billion of our funding is city tax levy. The rest is supported by federal, state, and private funding. Last fall, the city announced additional disbursement of the opioid settlement funds. The Health Department's investments in our harm reduction and treatment programs will total about $24 million annually by fiscal year 2026. Reducing overdose deaths is a major Healthy NYC goal, and we're grateful to have the funds to make meaningful progress. The preliminary budget allows us to begin to execute on our Healthy NYC goals. At the state level, the governor's fiscal year 2026 executive budget for New York proposes significant investments in mental health, maternal health, and the well-being of children and families, all of which align with our Healthy NYC goals. We're glad to see the governor's executive budget increase support for NYC mental health services, facilities, and workforce. The Health Department also supports Governor Hochul's proposed expansion of the child tax credit, guaranteed income program for pregnant people, and safety net hospital fund. We're excited too about the proposed $450 million in capital funding and $100 million in operating support for the SUNY Downstate Medical Center. While we're pleased to see these proposed public health investments, existing state budget proposals fail to address a key issue that undermines the health of New York City in particular, Article 6. Article 6 determines the state's contribution to public health services provided by local health departments. And in 2019, New York City was the only jurisdiction in the state to have its matching funds for Article 6 cut from 36% to 20%. In the years since, we've lost upwards of $90 million a year in state public health funding. We're pushing to have our matching funds restored in this year's budget. I'm grateful to have Commissioner McDonald's support on this issue, and I want to thank Chair Schulman, too, for her advocacy with state colleagues. I'm asking for the support of all council members on this issue. Finally, I'll speak to the federal budget. As is the case for local health departments throughout the United States, a portion of our budget is federally funded. Federal funding makes up about 20% of our budget, which amounts to $600 million. The majority of that funding goes toward emergency preparedness and infectious disease control. Historically, that money has been in place through a collection of grant agreements and contracts that represent commitments the federal government made to New Yorkers. As State Health Commissioner McDonald underscored in his testimony earlier this year, we expect the federal government to honor those commitments. In light of the White House directive to federal agencies asking them to reduce staff and funding, I sent a letter to HHS Secretary Kennedy and Acting CDC Director Monarez. In it, I urge them to preserve national public health infrastructure that has more than proven its worth for decades. The health of local jurisdictions is heavily dependent on a strong CDC. More than 80% of the CDC's domestic budget supports local communities through state and local health departments. We are preparing for what might come next. Health department staff have assessed our federal funding portfolio and are preparing for different scenarios. We're actively planning for how to best maintain core public health services, including infectious outbreak prevention. I'm grateful for the opportunity to testify on the preliminary budget today. The investments we're discussing represent the lifeblood of public health in this city. This money translates to more and better quality years of life for our family, friends, and neighbors. We're part of a field that has transformed and rewritten human history. Childhood vaccinations in the United States have saved more than 1 million lives in the last 30 years alone. We're heading into what promises to be a very challenging period for public health. It is absolutely imperative that the New York City Health Department continues to build on our legacy of leadership in the field. No matter what lies ahead, we're committed to protecting and promoting the health of every New Yorker without exception. Thank you to the staff at the Health Department for their invaluable efforts in pursuit of that goal. Thank you to the Speaker, to Chair Schulman and Lee, and members of the committees for your dedication to the health of our city. I look forward to our continued partnership in advancing our Healthy NYC goals. Thank you again for the opportunity to testify. I'm happy to take your questions.
Thank you, Commissioner. We have a lot of questions for you today.
We're ready.
Okay. In the preliminary plan, DOHMH's federal funding decreased by $123 million in fiscal 2026 compared to last year's adopted budget due to the reduction of $30.5 million. The city primarily received federal funding for HIV services, followed by environmental health and immunization services. With the new federal administration, we are concerned that the city might lose part or even all of its federal dollars for health services. Is the reduced budget due to the federal government's new policies, or is it due to external factors?
Thank you for that question, Chair. I think the numbers that we have are slightly different than those. However, the main difference in the budgets at this time is that some of our grant funding shows up and aligns a little bit differently than the current timeline for the budget numbers you mentioned, and then also that city council designations are also loaded at a different time.
So can you share that with us, the details of that? If not now, if you can send that to us?
We'd be happy to follow up
That would
with
be
that.
very helpful, please. Before I go on, I recognize that we've been joined by council members Bacha and Marmorato. Is the reduced budget due to the federal government's, I'm sorry. What are the major federal grants that DOHMH receives for healthcare in fiscal 2025?
Thank you for that question. This is an area of intensive focus and planning for us right now. We have a total of about $600 million in federal grants in FY25. Of those $600 million in federal grants, the large majority are from the CDC and HRSA. The large majority also is focused on public health surveillance, infectious disease outbreak prevention, and emergency preparedness. So those funds are really core activities of the New York City Public Health Department, and we are very concerned that they may be at risk considering the new federal administration's posture towards public health and what they've said, at least in the media, about CDC funding. However, at this time, we have not been notified of any decreases to our existing federal funds or cuts to our current federal funds.
Excluding any COVID-19 related funding, how much funding do you anticipate that DOHMH will receive from the federal government by adoption?
Thank you for that question. We're expecting it to be similar to the current year, but I'll pass to my Chief Financial Officer to share some more details.
Yeah, thanks, Chair Schulman. Right, I mean, we continually add new federal grants,
Sure.
load it as the year progresses, but as Dr. Moore said, we expect it to be similar. So several $100 million additionally to be added. Yeah.
Thank you. I know you mentioned, Dr. Morse, that in your testimony that you're putting together contingency plans. So what other sources of funding could DOHMH utilize to cover any federal funding gaps?
Thank you for that question as well. At this time, since we haven't had any funding cuts officially happen, we are still in the process, a multi-month intensive process of doing a review of all of our current federal grants and doing some scenario planning about what possible scenarios for federal cuts could occur. However, as you all have seen, it is very difficult to predict the actions of this federal government and the timing of those actions, and therefore it makes it quite challenging to plan for different scenarios. Our ongoing work will be to be in conversation with OMB, the law department, and the mayor's office to continue conversations about different scenarios and make sure that no matter what happens in terms of signals or decisions from the federal government, that we'll be able to keep our core public health services and work going to protect New Yorkers.
Do you anticipate that the changes will be included in the executive budget, or you think it stretches beyond that?
That is a very good question. We are watching very closely announcements about the reduction in workforce exercise that federal agencies are going through. We know that the CDC is going through that exercise. The letter that I sent to HHS Secretary Kennedy and acting CDC Director Dr. Susan Monarez really outlined our concerns about significant reductions in the workforce. But those plans were submitted as far as we know, and there are several more weeks of planning around the White House's directive to agencies to reduce their workforce. So we'll be watching very closely for further announcements, but we expect that those are likely to impact significantly the CDC workforce and potentially CDC funding. The other thing that I'll mention is that it has been widely reported in the media and in the news that one of the areas of potential targeting for CDC funding is CDC's HIV prevention programs. We were concerned to learn of that news because we have seen a 71% reduction in HIV cases in New York City over the past 20 years because of that funding, because of the prevention funding for HIV. So we'll be watching that news very closely as well. But in the coming weeks, we may hear more about that specific reduction. We have about $36 million in CDC HIV prevention funding, and that funding also funds many community-based organizations that do HIV prevention services and care.
Okay. You haven't received a response yet, right, from your letter?
I have not received a response.
Would you be willing to share the response once you receive it with the committee staff?
I'm happy to do so in consultation with our IGA teams at City Hall.
Okay, thank you. Federal grants provided to the city are expected to sunset soon due to a combination of a lower COVID-19 case rate, the end of the state of emergency in May 2023. The fiscal 2026 budget for COVID-19 services is $5.6 million, nearly $50 million less than last year's adopted budget of $55.6 million. When is the exact timeline that COVID-19 funding will completely sunset?
Thank you for that question, Chair Shulman. This is a really great and challenging example of the boom-bust cycle in public health funding that makes it difficult for us to continue core services when funding only really increases during emergencies. We have been working with our federal partners around those funds. They have granted us an extension to use those funds through the next fiscal year, which is helpful. And I'll pass to our Chief Financial Officer to share a few more details on that.
Thanks for the question. Yeah, we have about $200 million budgeted in FY25 and FY26 combined related to the COVID funding. And yeah, as Dr. Moore said, we're very pleased that we've been granted an extension. The two biggest components of that are the Epi and lab capacity funding, which is sunsetting in July 2026, and the vaccination and immunization funding, which is sunsetting in June of 2027.
Oh, okay. That's very good. All right. With the $50 million that DOHMH, okay, wait, sorry. What funding sources would DOHMH use to fill the funding gap down the road?
Thank you for that question. We are in conversation with OMB at this time about ways to ensure that the most critical parts of our services and programs continue for the money related to the COVID emergency funding. And we're having conversations again about how we can make sure our surveillance, vaccination, and testing work continues despite the bust in federal funding for COVID-19. We also specifically have a vaccination program that is ending this fiscal year. It's about $11 million in funding to community-based organizations for COVID-related prevention and management and referral and vaccination services. And this is just yet another example of why we think it's so important that the Article 6 match rate be restored this budget season so that our work can continue.
There are 35 positions budgeted for fiscal 2026, while the fiscal 2025 adopted plan had 29 positions. Which positions were added?
I'll pass this one to our Chief Financial Officer.
Thanks for the question. Yeah, so these are really around surveillance and testing. We can get back to you with the specifics, but incremental increase to reflect shifting of funds from year to year.
Okay. What are the 35 job titles? Do you have those?
We can get back to you on this.
Can you get those to us? Thank you. Why were positions added when so much funding will be lost soon? Or is that just you're talking about the juxtaposition of the?
This is timing. I mean, there's a lot of funding that we haven't, this is around the time of year that we roll a lot of grant funding to FY26, so we do expect that a lot will be rolled, and, again, we're pleased that the funds were extended, and so to the extent that they were, we'll have people working.
So at a hearing held on February 19th jointly with the Subcommittee on COVID and Infectious Diseases, it was revealed that 7 staffers at the U.S. Centers for Disease Control and Prevention, which were assigned to work with DOHMH, were laid off. Did DOHMH have a chance to work with the CDC staffers before they lost their jobs?
Thank you for that question. Those 7 staff are staff with expertise that is incredibly important for us to continue our work at the New York City Health Department. They were working on things like tuberculosis case management, vaccination programs, community engagement. So we value the expertise of those 7 workers extremely highly. We are in ongoing conversations with those 7 workers about places they may be able to work with us in the health department. But however, technically they were reinstated by the CDC.
So are they working for you now?
We can follow up with the details. It's a little bit of a mixed bag.
If you could follow up with the details of that, and then if you're looking for if you're trying to get them placed within DOHMH, can you give us the amount of money that you need to do that? One, do you have the money? 2, if not, can you tell us so that there may be something we can do with that?
Yeah, we would be happy to follow up with the details, but yes, we're working within our current budget to try to make that happen.
Okay. In the preliminary plan, DOHMH's fiscal 2026 budget for health services is $283.1 million, an increase of nearly $5 million from adoption. How much funding do you anticipate DOHMH will receive from the New York State fiscal 2026 enacted budget? Minus the Article 6, which we're hoping for, but
Thank you for that question. Our partners in the state fund us about a third of our budget is funding from the state. About half of that is mental hygiene related state aid. And our expectation is that our funding for the new fiscal year from the state will be similar to this current year. However, our sincerest and strongest hope is that Article 6 match is restored and that we have the money that the state owes us to continue our public health activities in the best way we can.
well, a couple of things. One is I want to acknowledge we've been joined by Councilmember Brewer, Gail Brewer. The other is that I actually am putting together a sign-on letter, just so you know, from me as Chair of the Health Committee with my colleagues. So my colleagues here who have not signed on yet, please sign on. We're going to be sending it to the governor and to Andrew Stewart-Cousins and Carl Hasty.
Thank you for your support.
So advocating for that. And what I was told is that there may have been a little bit of flexibility shown within the governor's staff. So we're really trying to still push on that.
Thank you for your support.
Which programs would receive the most state funding that you have?
Yes, absolutely. So out of all of our state funding, which again is about a third of our overall budget, the majority, about half of it is mental health state aid, so related to mental health, various mental health programs. Early intervention is a significant portion of our our state funding. And then the current Article 6 match, although at a much lower rate than we should receive it at, is also a part of our state health funding at this time.
Can you share an update status to the concerns about any cuts to Medicaid from the state?
We are watching the federal conversations about Medicaid cuts very, very closely. The numbers that have been mentioned in the news are $880 billion in cuts over 10 years. This is certainly of concern to us in New York City. In New York City, half of New York City is on Medicaid, and 60% of our children are on Medicaid. So our expectation is that if those cuts do happen, there will be significant impacts, unfortunately, in New York City for both healthcare as well as social care. So we are very concerned about those potential cuts, although they haven't happened yet. In addition, we do receive some reimbursement funds for the people who seek care in our sexual health clinics, if they are insured by Medicaid, although a very small number of the people we see at our sexual health clinics and other clinics are insured. So that's another area of direct funding for Medicaid for us, as well as early intervention.
How much funding does DOHMH receive from Medicaid?
I'll pass to our Chief Financial Officer.
Thanks for the question. Yeah, as Dr. Morse mentioned, on the direct billing side, it's relatively modest. This is what for the work that happens in the clinics. Our target is a few $1 million. But we do receive about $60 million a year in Medicaid admin funding, and that's across a few different programs, including school health, early intervention, health insurance enrollment.
Can you pull the mic closer to you so we can hear you a little better? Thank you. And just pull it down a little. Thank you. Over the last 2 fiscal years combined, DOHMH's public health budget was reduced by $104.4 million for fiscal 2024 and fiscal 2025. Out of these reductions, $5.4 million was fully restored and baselined at adoption for fiscal 2025 for various HIV and AIDS-related services, yet the remaining cuts have not been restored to date. When we questioned these cuts during our budget hearings last year, you testified that these were mostly OTPS efficiencies, and you assured us that these were not impacting programs. At this point, we still have a total contract reduction of roughly $9 million yet to be restored. How much of the $26.4 million OTPS efficiency reductions in fiscal 2025 targeted specific programs?
Thank you for that question. It is never easy to go through PEG scenarios, and we did go through 2 last year, as you described. We in the health department did our best to make sure that service delivery was not impacted as much as possible, and we also did our best to make sure that, again, any cuts were related to other kinds of efficiencies rather than direct service delivery, but it was a very challenging time.
How many community-based organizations lost their contracts due to the contract reductions in fiscal 2025?
I'll pass to our Chief Financial Officer.
Thanks for the question. I would just add one thing, which is that we're in constant conversation with OMB about all of our resource needs and making sure that we have what we need, and that's an iterative process. There were a number of reductions last year. The vast majority were efficiencies as opposed to sort of contract reductions because it would impact services. I think we've shared that list previously. We're happy to share that again, but
Please.
But the number was pretty minimal. I mean,
Yeah, if you can provide the list of nonprofit organizations that lost funding, broken down by the specific programs they covered and how much they lost. Were they, I assume they were provided notice if there were funding reductions for them?
yes, they would have been provided notice.
What kind of notice were they given? I'm just,
I think we can get back to you on the specific
Okay.
type of notice, but
and
all efforts
also,
were
well,
made
I'm
to
sorry.
minimize services. Sorry, yeah.
No, no, go ahead.
No, I mean, these are tough decisions. I mean, we really made every effort to make sure that services were not impacted. It's inevitable in a.
We can help you push, so that's why it's important to get us that information. And also, when we started our preliminary budget hearings and we met with the OMB, I specifically asked a question of whether or not DOHMH, if the grant-funded programs, if you had to do the 2-for-1 in terms of, and they said no, and Jacques said no. So if that's not the case, then we need to know that. Because that's on record and under oath. Okay. Will DOHMH restore any of the reduced funding to their original budget, especially for community-based organizations? If yes, which contracts will be restored and how much funding will be in it, and which plan will the restoration take place?
We are still in conversations again with OMB about funding priorities for FY26. So we're doing our best to make sure all of the priorities are appropriately funded. And again, this is another area where going back to the Article 6 match rate will certainly help to continue to make sure our service delivery continues.
Now we're going to go to maternal health, one of your favorite topics, Dr. Morse. And ours. DOHMH has several programs for maternal health care which had received funding reductions over the last financial plans. In the fiscal 2025 budget year alone, the Maternity Infant Reproduction Program, Newborn Home Visiting Program, Nurse Family Partnership, and Universal Home Visiting Program lost a combination of $5.5 million for fiscal 2024, $7.2 million for fiscal 2025, and $6.6 million for fiscal 2026. How did DOHMH make the determination to reduce the funding for these programs?
Thank you for that question. We are honored to continue to work with Council to make sure that our crisis in Black maternal mortality is addressed. Our goal is still to reduce Black maternal mortality by 10% by 2030. So we do look forward to working with you all to advance that goal. Our current maternal health, our broad maternal health budget, which covers a number of different divisions, is about $58 million in FY25. And I'm not fully familiar with all of the different cuts that you mentioned, but I do know that some of what you may be referencing, and we would love to follow up with you on the specific numbers, is that some of the funding from City Council is not yet loaded, and some of our federal grants are also not yet loaded. But we would be happy to follow up to get into the specifics, since I think our numbers are a little bit different.
Okay, no, that would be great. Did any nonprofits affiliated with these programs lose any funding?
Thank you for that question. I'll pass to my Chief Financial Officer.
There was one area that I know there was funding reduced to, and that was a vendor named the Power of Two.
Okay.
That was through an intracity relationship with Administration for Children's Services.
Can you provide more details of that?
Sure. Yes, so this was funding that had previously been provided to ACS via an MOU to support a portion of their contract with Power of Two. That activity was eliminated last year as a result of the cost savings exercise that we undertook. Would say that the health department still supports the new family home visiting program. The Power of Two contract did not represent the only vendor and only service provider for that program. The program still offers a range of evidence-based home visiting services via trained healthcare workers. And the program is open to first-time families in Tree neighborhoods who live in night
So there's another provider that's providing that program, those services?
The services continue. They were just one provider of
Okay, all right.
a universe. Yep.
No, thank you for that. In the fiscal 2026 preliminary plan, DOHMH has a budgeted headcount of 4,289 positions. The actual headcount as of January was 4,210. Which programs have the largest vacancy rate?
Thank you for that question. So we do have, unfortunately, the highest vacancy rate is in our mental hygiene division, and the vacancy rate in mental hygiene is about 27%. That represents the fact that it has been challenging to recruit and hire some of our more specialized roles. These include clinical roles and social work roles. So that's part of the challenge with getting our vacancy rate lower for mental hygiene.
Okay, is the hiring freeze rule now lifted for DOHMH?
At this time, the hiring freeze has been lifted, yes.
Okay, great. And remember, as I mentioned earlier, the 2-for-1 hiring, we got that on record, so please circle back with OMB that they're not doing that anymore with you guys. And if they do, then we have to circle back with them.
Thank you.
Healthy NYC. In the calendar year 2020, due to the pandemic, the city's life expectancy, as you know all of this. How effective has Healthy NYC been so far?
We are happy to report that in the 2022 data we released, we are on track to meet our goal of improving life expectancy to 83 years by 2030, on track to meet or exceed it. So we have seen significant progress and a huge reduction in the rate of mortality for COVID. We are still seeing some areas of concern in the rates of overdose for Black and Latino New Yorkers, in our Black maternal mortality rate, and in a few other areas. So we still have work to do.
Are all 7 mortality drivers, other than the one you just mentioned, on track to reach their goals by 2030?
We really look kind of in an aggregate, but what we have seen is that we have seen a great significant reduction in COVID, as I mentioned, COVID-related mortality. We do still have work to do with the rate of overdose. It has plateaued citywide, but the racial inequities in overdose rates have increased for Black and Latino New Yorkers, so that is an area of concern. We've also seen a small increase in Black maternal mortality, and we have work to do again to address that.
Which areas are improving the most so far?
So far, our biggest improvements are in COVID-related mortality and cardiovascular and diabetes-related mortality, and we've seen stable rates of cancer-related mortality.
Okay, do you have the figures you can send us for those?
We would be happy to. We actually just released some of this data on a web page that has interactive ability for the public to look at the ways in which our overall life expectancy and each of the 7 drivers is trending.
What do you attribute the success of some of those areas? Is there anything specific, or?
For COVID-related mortality, we believe strongly that that was related to our extensive vaccination campaign. Right. For our cancer-related mortality, the story is evolving. So we have more data analysis to do. And we also have more data analysis to do really for all the other drivers as well. We've seen suicide stay about stable, but we have more analysis to do and more data to release eventually.
As you're doing the analysis, presuming that at some point there are federal cuts, will you be able to adjust to show that that was because that whatever data you're getting was based on something else that happened, some outside factor?
We do have a number of ways that we're doing surveillance to monitor the impact of some of the federal decisions, and so we are doing that work. I think your question is kind of getting at, with a $600 million federal funding package and portfolio that's, includes CDC, HRSA, HUD, and many other federal agencies, ACF, et cetera. What might the impacts of those potential cuts be on our Healthy NYC goals? And we would love to continue to work with council to make sure that we can still make progress on our Healthy NYC goals, even if there are changes in federal funding. But certainly, any cuts to our federal funding would put a number of goals at risk, including our Healthy NYC goals. And I'll just give one example. Chronic disease, specifically cardiovascular mortality and diabetes-related mortality, is the #1 killer of New Yorkers now that COVID is no longer #1. And so this goes back to the #1 killer that we had pre-COVID. So we have a lot of work to do in that realm. Right now, only about $30 million of our total agency budget is dedicated to chronic disease.
And plus, we have, not here particularly, but an increase in measles across the country and other chronic diseases that we thought were kind of put to bed, and so now have been making a comeback. And then hopefully, and then we have the bird flu, which we'll talk about it as we do the questions, but.
We do have a number of public health threats that are very much of concern, and I would say that 2025, what those threats look like is quite different than 2019, when the Article 6 match rate was cut. So again, I think it makes the case even clearer how important it is for Article 6 match to be restored. And the most clear example of that is how New York City, again, as a global city, is hit first and hardest whenever it comes to a public health threat. In 2024, there were 15 cases of measles in the whole state of New York, and 14 of those cases were in New York City. So we do have much work to do to keep New Yorkers safe.
Are there any budget asks from DOHMH to OMB to improve Healthy NYC's effectiveness?
We are continuing to have conversations with OMB about making sure that we can achieve our Healthy NYC goals. I would also say that, as is elevated in our chronic disease report, it was developed with 22 sister agencies. So we do see our chronic disease work as something that's collaborative and across city government, and have been in conversation with OMB about those goals. We do see some great opportunities to continue current programs, to focus more on diabetes, to focus on neighborhood stress-free zones, and many other initiatives in our chronic disease portfolio, to make sure that we do achieve our Healthy NYC goals and stay on track.
I'm going to ask you, at some point, I'm not going to push you too much today, but I am going to ask you to let us know if there are ways that we can help to supplement what you need in this budget.
Thank you for your partnership.
Have there been discussions with our state or federal partners regarding Healthy NYC?
Thank you for that question. I do speak with Commissioner McDonald quite often. We did share information with him and his team about Healthy NYC. So that has been a great and productive partnership. He also had a chance to take a look at our chronic disease report and found it to be quite on target. And at the federal level, we have not had as many conversations about Healthy NYC.
Okay. The Disease Prevention and Treatment for Immunization Programs has a fiscal 2026 budget of nearly $12 million. What is the total budget for children's vaccines specifically?
Thank you for that question. We have been running the Vaccine for Children program for the city since it started in the 1990s. Overall, we partner with healthcare delivery organizations to distribute about 2.7 million vaccines per year through the Vaccine for Children program. Our overall vaccination budget is about $40 million or so per year. And that funding, of course, helps us to do both the vaccination work as well as community engagement and education, communications campaigns, and other work as well.
Can you provide a breakdown of the budget by each type of vaccination?
We would be happy to follow up with
Please.
you on that.
Yeah.
Our COVID immunization supplemental grant from the federal government is ending, so some of these numbers and investments are in flux, but we'd be happy to follow up with
please.
specifics.
The PMMR outlines a couple of performance indicators related to children's vaccinations. One indicator, the percentage of children aged 19 to 35 months with up-to-date immunizations decreased from 61.5% in the first 4 months of fiscal 2024 to 57.4% in the first 4 months of fiscal 25. Can you explain this decrease?
Yes, thank you for that question. We have unfortunately seen a national trend and a local trend of decreased childhood vaccination rates. It is certainly of concern to us. We have a number of ways that we engage families, communities, and providers around how to improve those vaccination rates. Our data tells us that pediatricians are the most trusted messengers when it comes to childhood vaccination rates. So we are continuing to partner with them to make sure that we improve those vaccination rates. The number that I will emphasize is that when we look at 24 months, our measles, mumps, rubella vaccination rate is about 81% right now for kids who are 24 months. A few years ago, it was 94%. So we have over the years seen a decrease in even measles, mumps, and rubella vaccination rates across the city. And again, we have a number of levers that we are pulling to try to partner with providers and communities and families to make sure those vaccination rates improve. The good news is that as children start kindergarten, our vaccination rates are about 96% for childhood vaccination. But we want 2-year-olds to be up to date. We don't want to wait until they're entering kindergarten.
Is there a way to do a breakdown by neighborhoods of how the vaccination rates are? Because we can help as council members and see, you know, and put you together with some of the folks in the community too. So if
We'd be happy to
if there's
follow
a
up.
way we can do that breakdown, that would be helpful.
We will definitely follow up on that.
Okay, great. Is there a direct link between the reduced rate of children's vaccinations and spikes in communicable diseases in the city?
Thank you for that question. I will say, well, there are a number of communicable diseases across the city, of course. The 3 cases of measles that we've seen in New York City in 2025 are unrelated, so that is not an outbreak. So I want to start by saying that to make that piece clear. Our biggest campaigns and focus are on the seasonal flu vaccine and COVID vaccines. This winter, we saw about 2 million flu vaccines and about 800,000 COVID vaccines. And that is just what is reported. It's not mandatory reporting, so that's probably an undercount of the amount of vaccination. We did have a particularly challenging flu season this year. However, our flu case rates are down by 14% in our most recent data, and we do seem to be quite a bit past our peak in flu. For our COVID rates, they have been somewhat similar for the past few months, but are not at this time increasing significantly. And we continue to engage with lots of communities and providers and partners around the importance and life-saving nature of both flu and COVID vaccines.
On February 7th, I'm going to ask a question about bird flu, and then I'm going to hand it over to Chair Lee and then come back, because I have some other questions about some other programs. On February 7th, 2025, live bird markets in the city were temporarily closed after traces of H5N1 bird flu were detected in markets across the city. Does DOHMH or any other agency monitor these markets?
Thank you for that question. We've been coordinating very closely with the State Department of Agriculture and the State Health Department around live bird markets. Our role here in the New York City Health Department is to, number one, be informed if there are detections of H5N1 amongst birds in live poultry markets across the city, so we're informed of that when it happens. And then our role is to monitor any of the workers who were exposed to those birds for symptoms, for preventive measures, and to educate them about the potential risks. But at this time, there have not been any human cases of H5N1 in New York City. There have been about 70 cases nationally, and almost all of them have been specifically related to exposures to either dairy cattle or poultry or wild birds that were infected with H5N1.
Is there any set budget for the bird flu?
At this time, we don't have a budget under the health department for bird flu, but there is an emergency federal grant for $3.5 million.
Really? Okay. All right, now I'm going to hand it over to Chair Lee. I'll come back later to ask some other questions. Thank you, Commissioner.
Thank
And
you.
Chair Schulman, if I could make one clarifying comment going back to OMB and hiring. So just to clarify, we're not exempt from the hiring freeze, but we do have exempt positions. So public health sanitarians, city pest control aides, exterminators, public health nurses.
Can you get
grant-
us a list of what's
And grant positions. yeah. So
exempted?
2 for 1 is the policy. that-
2 for 1 is the policy? All right. We'll follow up on that. Thank you.
Okay, thanks.
Hi. Hi, Dr. Wright. Sorry, I didn't see you sitting over there, but a special shout out to you. And where is Ricky Wong? Like, I feel like this is not complete without Ricky Wong. He needs to be here, so just tell him I said hi. I'm just gonna ask a few overall arching questions before I hand it off to my colleagues, and then I'll come back later for some other deeper dive questions into some of the topics. But I wanted to follow up on a question that Councilmember Schulman had asked about the overall split in the budget between state, federal, city. Because I know that specifically, and please, correct me if I'm wrong, but for the mental hygiene budget specifically for FY26, I believe the state has 54%, the city has 38%, and the federal is 4%. But just out of curiosity, the percentage of the federal budget that you had spoken to before previously, does that, like, in terms of the overall cuts, potential cuts, I'm sorry, does that include the pass-through money as well that is embedded in the state and city funding, just out of curiosity, like the CDBG block grants, all of that stuff? I just wanted to clarify that.
I'll pass to Aaron.
Yeah, thanks, Chair Lee. Yes, it does include pass-through. Yeah.
Okay, I just wanted to make sure that it was including all of those, including the pass-through money. Okay, perfect. Yeah. And then just really quickly, so this is like, probably one of my pet peeves, which you've heard in previous hearings, which is it's hard to track all the money that's within the mental health portfolio because so much of it sits within different city agencies. So for example, some is with you all, some is with EMS, others are with OCMH, others are with health and hospitals. And so I just wanted to, and Department of Education, of course, has a bunch as well. And so it's challenging to track all the mental health services provided and how much the city's full investment for mental health services is. So I was just wondering, is there a way to sort of, and how much of your hands do you have in the other city agencies? Because I'm assuming, and also correct me if I'm wrong, that, when it comes to the mental health purview and that bucket, I would like to think there's some agency that's overarchingly looking at all of this data. So just wanted to know how much information you share across agencies and how much you work together between the different agencies around the mental health services specifically.
Sure, I can start, and then I'll pass to our CFO to share some more details on the budget side. In general, when it comes to programs and policy work, we do work very closely with other agencies, particularly OCMH and Health and Hospitals. And we also have a number of different ways in which we share data for the whole city with those organizations as well, since that is in large part our role. Our mental health report that came out last year, I think, is a good example of that. And then just last week, we released a report on the mental health needs of LGBTQ plus New Yorkers as well. So those are the kinds of data and reports that our sister agencies look to us for in terms of guidance on programs, priorities, et cetera. So that work does occur. We also work collaboratively with New York City Public Schools on the school-based mental health clinics, et cetera. So there are a number of programmatic touch points for coordination and partnership. I'll pass to Aaron about the budget question specifically.
Yeah, thanks, Dr. Morris. And I would just echo that just as there are programmatic touch points, there are budgetary touch points. I'm always in contact with sister agencies, my counterparts, but really OMB is probably the place where, as an aggregator of information about where everything lives.
Okay, because during our budget hearing with OMB, especially around the contracting piece, they were saying that's largely with DOHMH. So my concern is that I feel like there's no clear sort of overseer of all the buckets of mental health programs. And I know that technically OCMH's role is to do that. However, even when I speak with them, they seem like they're limited in terms of how much reach they have with the budget as well as coordination. So I just want to make that point because I really, really, really hope that when it comes to the coordination of services, because as we all know, you know, I'm a whole person, right? So I may need homeless services, I may need drug addiction services, as well as mental health services, and I may be physically disabled and need help getting there. So me as a whole person, I'm just saying that it's a little frustrating for me to coordinate, and if we're thinking of offering the best care to our city and folks that, you know, deserve it, it's a little, you know, difficult to navigate. And if it is possible, I don't know if this is possible on your end, but if it is possible to get numbers from other agencies and also get a sense of where their budgets are, I think that would be great. I don't know if that lies with you all or if it lies with OCMH, but I just need to get some understanding of how much the total investments citywide are in terms of mental health services.
Yeah, I do understand the challenge. I think what our CFO shared, OMB really holds most of that information. We don't have access to the budgets of our sister agencies in an easy way. But I would also share that we do have programs like our Single Point of Access program that really does attempt to have a one-stop shop for a lot of mental health services, even though it's not every service that we offer.
Yeah. No, I appreciate that. Okay, I'm going to actually pass it off to my members, to other colleagues, to ask questions. Am I doing this? Okay. All right, okay. First, I want to call upon, I hope you're ready, Councilmember Menon, followed by, Councilmember Narcisse.
Yes, thank you so much, chairs, for today's hearing. So I have a number of questions related to the Office of Healthcare Accountability. As you know, the City Council unanimously passed my legislation creating this first-in-the-nation Municipal Office of Healthcare Accountability. The office was supposed to be fully operational and functional well over a year ago. My first question is, how many staff members are currently working at the office?
Thank you for your advocacy for this office, Councilmember Menon. We have certainly been working very hard to get the office up and running. As you probably saw, we did release our inaugural report on Friday. It is over 260 pages and is extensive in its documentation of some of the challenges with healthcare and healthcare pricing across the city. At this time, we have 7 candidates who are identified for the office, and we are continuing to make sure that the work required by law moves forward, including the fact that our website with price.
Okay, I just want to interrupt. I'm sorry, because the time is limited. So we fought really hard to get 15 lines. 15 lines were supposed to be funded for this, encompassing a $2 million budget. So you're saying 7 have been identified, meaning the office only has 1 person fully hired 1 year after the implementation date for the creation of this office. And I might add, this office, studies show, will save the city $2 billion a year. So my question is, why is only 1 person hired to fund this office?
Thank you for that question, Councilmember Menon. We are doing our best to hire and move the office's work forward. What I will share is that a number of the positions that were created for this office are specialized positions. We are glad that we were able to identify 7 candidates so far, but I think most importantly, we are thankful that we've been able to get this very comprehensive report out as was required by law. And we've also been able to move forward with all of the planning to make sure that the website for consumers is available, and consumers are able to go to the website to see the different prices for healthcare access across different services and hospital systems. So what the report even showed was that for something like a colonoscopy, the prices are anywhere from $900 to $11,000, depending on the health system that you go to across the city. A C-section rate is anywhere from something like $9,000 to $54,000, depending on what hospital system you go to. So we know that even though, again, we're prioritizing hiring, that report is the result of our agency taking this office very seriously.
Chair, can I just ask one last question related to the report? So the report came out, as you know, I'm incredibly frustrated that pieces of the report are missing critical data. There is enormous amount of information that has been redacted about hospital prices. The whole point of the creation of this office was to give consumers transparency around the price of every medical procedure at every New York City hospital, and to allow New York City, who's spending 10% of the city budget on public sector employee, retiree, and dependent health care, to be able to harness its purchasing power to drive down costs. That is nearly impossible to do if large swaths of this data is being redacted because Anthem is refusing to play ball and is utilizing the pretense of gag orders in these contracts. So I can't tell you how disappointing and frustrating this is after fighting so hard for the creation of this office, and I really urge the administration to go beyond this roadblock that Anthem is putting up and to finally, once and for all, provide this information to the City of New York.
Thank you for that, Council Member. I acknowledge that there are parts of the report that don't have the full data related to Anthem, and there are other reasons as well. We were constrained somewhat by the law in that the law says that it has to be publicly available, and so there have been conversations about that. But I will say that the three most important things from the report, from my perspective, is number one, it's very clear that New York City healthcare prices are higher than anywhere else in the country. Number two, what we also see is there is wide variation in the costs that are charged to insurance companies despite quality. So this is unrelated to the quality of those services. And the third is that there's really inconsistent and incomplete reporting of community benefit across the hospitals in the system. But we do intend to fulfill the full letter of the law and make sure that the office actually does what it was intended to do when council passed the law in 2023.
And I greatly appreciate that. But for Anthem to say that this information is not publicly available when federal CMS rules already mandate that every New York City hospital has to provide this data, it is just a completely ridiculous argument for Anthem to make. It doesn't hold water when federal rules mandate that the hospitals have to disclose that. And we know that approximately only 14% of New York City hospitals are complying with the federal rules. So I know my time is up, but I just wanted to make sure to make that point. Thank you.
Thank you.
Councilmember Narcisse.
Good morning, and thank you, Chair. Thank you for coming, Dr. Morris, and thank you, the whole team. The fiscal 2026 preliminary plan includes additional city funding of $60.1 million in fiscal 2025 only, including a funding swap of $36.1 million from the state funding. We're talking about our school. And if I'm correct, roughly about 60% of our kids on Medicaid now, so that's giving me more concern. How much is the current budget for school health?
Thank you for that question, Chair Narcisse. We work very closely with New York City Public Schools to make sure that the Office of School Health is a priority and that the children across the city who need either general health or behavioral health services have what they need. And we also have worked very closely with New York City Public Schools, health and hospitals, and others to make sure that the number of school-based mental health clinics actually increases. In fact, the 16th clinic just opened last week.
And I'm so grateful for that.
Which is very exciting. Mm-hmm. In terms of our overall budget for school health, I will pass to my Chief Financial Officer.
Thanks for the question, Council Member. Yeah, our school health nursing budget is approximately $195 million this year.
Thank you. What factors were considered or identified to determine this budget?
So we have a number of mandates for what kinds of work we can do and how we can partner with New York City Public Schools on ensuring that school health services and mental health services are fulfilled and that nurses are working in those school-based health centers as well. School-based health clinics as well as school-based health centers.
Okay. Will funding be allocated directly to schools?
Thank you for that question. I'll pass to my CFO.
Thanks for the question. I think the school-based question is really a question for New York City Public Schools. I mean, our role in jointly operating the school health program is really to support the nurses in the schools.
Okay, so the money is not, because the question is they gonna get the money, the funding from?
Yeah, the way the school health works today is really the funding lives in our agency budgets, so New York City Public Schools and the health department.
So please hold, because I have a few questions. How has the city health system evolved and improved since COVID-19 pandemic, particularly in terms of infrastructure, access to care, and public health preparedness? Are there specific lessons learned that have been incorporated into the budget to better support future health crises? Now I'm going to go to another question. How is the health department planning to integrate new technologies like AI and data analytics into the city's health system to improve service delivery and patient outcomes? What investments are being made in this area? What role, that's another one, what role will public health campaigns play in raising awareness about preventive care, since my number one thing is to prevent? Are there specific campaigns planned to educate New Yorkers about the importance of routine checkups, cancer screenings, and other preventive health measures? Because we realize there's an increase in colon cancer for Black men, some under 20s, under 30s. Thank you.
Thank you for those questions, Chair Narcisse. I will do my best to try to answer them. So the first one, I think you asked about changes kind of in healthcare, the healthcare system and service delivery since the pandemic. There are a number of things that did change during and after the pandemic, including ability to seek care, ability to seek primary care prevention services, mammograms, colonoscopy, et cetera. So we did see significant changes in health-seeking behavior during and in the immediate aftermath of the pandemic for a number of different reasons. One example that I'll give is we've talked a little bit about in our most recent HIV data, and I want to continue to highlight the work of our HIV teams because it's such important and life-saving work. And one of the things that we saw was actually there was an increase in diagnosis of HIV in 2023 compared to 2022, but a decrease in new cases of HIV. So the reason I mention that is an example of the new diagnosis is usually someone actually had HIV but didn't seek care early enough, and we think the pandemic is part of the reason that happened, and then got a new diagnosis. So even though the incidence, the new cases of HIV went down, people were getting their diagnosis of HIV a bit later, and it made our numbers look higher. So that's just one example of changes in care seeking and healthcare delivery in the pandemic and after. There are many, many, many lessons from COVID. I can't speak to all of them today. The city did work for 2 years on a COVID after action report that describes in detail some of the challenges, the successes, and the learnings from the COVID pandemic. And that report was published online, I think, a week or two ago. It really does list out extensively the things that we learned and the things that we hope to do better. I do believe that we learned quite a bit about historic marginalization and disinvestment and inequities both in geography and race led to some communities being unfairly hurt more by COVID than others. And we have a number of ways that we're trying to make sure that going forward, health equity is at the center of all of our emergency response work. So much was learned, and I defer to that very extensive report. For AI and technology, we have a Center for Population Health and Data Science and a division of IT that are both working collaboratively to explore the ways in which our agency could benefit from AI technologies and continuing to innovate and expand on the ways in which we do data surveillance, sharing that data with the public, et cetera. And then finally, for public health campaigns on preventive health, that is our bread and butter. We fully agree with you and appreciate council's support on making sure that we have the resources we need to educate the public about the most life-saving interventions and preventive care, and we plan to continue to do that work.
And about this sphygmomanometer, the blood pressure machine that we went around our city and then give folks some indicators how to seek help and when the blood pressure is not doing well. Where are we? Because we passed the bill trying to get people to more compliant to what's going on in their lives.
We do have quite a bit of work on hypertension. Hypertension is a part of our work within our Healthy NYC goals as well. And so for our blood pressure cuff specifically, sometimes it's covered by insurance. In fact, many insurance companies do cover blood pressure cuffs, which is great. Often what I see as an internal medicine doctor, and I practice at Kings County, as you know, I see people with high blood pressure all the time. And oftentimes the challenge for them is not necessarily getting the blood pressure cuff, but it's actually having someone to support them, like a community health worker, to make sure that they both know how to use the blood pressure cuff, know how to write down the results of the blood pressure cuff, know when to bring those results to their primary care doctor, and then have support in taking their medications, as well as making some of the diet changes that are necessary when you have high blood pressure. So I would say that our community health worker work is particularly important, since many insurance companies do cover blood pressure cuffs. That's kind of getting from the blood pressure cuff to the actual action and patient engagement and support to the patient who is trying to improve their blood pressure control.
Thank you, but it's an indicator. I used to do home care. Thank you, chairs. Thank you.
Thank you.
I want to recognize that we've been joined by Councilmember Lincoln Ressler, and I want to ask Councilmember Lewis to ask her questions.
Thank you, chairs, and good to see you, Commissioner and CFO Anderson. I have 3 quick questions, so I'm going to just do rapid fire because the time is limited. And as you stated in your testimony, New York City continues to face alarming maternal health rates, with Black and brown women disproportionately affected, as we've seen in high-profile cases in several hospitals across our city. So I wanted to know, how does DOH-MH justify the cuts in the city's worsening maternal health rates over the past year? I know you've mentioned it earlier, but if you could elaborate on that. Second question is in regards to trauma recovery. I'm very concerned about the budget's reductions within the preliminary plan, which raised significant concerns about the city's ability to respond to its ongoing mental health crisis, especially for our vulnerable youth. Of the total mental health services budget in FY25 and FY26, how much was specifically allocated for trauma recovery programs? And I specifically asked this question because in neighborhoods experiencing persistent gun violence, a lack of trauma response and remediation services can contribute to cycles of violence. How will DOH-MH address the potential consequences of these cuts, particularly during upcoming summer months where we know youth are out and about? And last question is regarding reproductive health. Many consumer products, including cosmetics, plastics, and household goods, contain chemicals linked to reproductive and uterine health issues disproportionately impacting women of color. With 42.6 million investment in the FY26 preliminary budget, will DOH-MH invest funds to expand the public health laboratory scope to include research and testing on product safety and its impact on reproductive and uterine health, especially in the absence of adequate federal protections? So those are the 3: reproductive health, trauma recovery, and gun violence.
Thank you,
and
Councilmember.
maternal mortality. Thank you.
Yes. Thank you, Councilmember Lewis. I'll start with the first question around our Black maternal health goal. Our goal, again, is to decrease Black maternal mortality rates by 10% by 2030. And we have a lot of work to do to meet that goal. What I haven't, I think we might, again, have slightly different numbers. Our FY25 budget for everything related to birth equity is about $58 million across multiple different programs. And we haven't, we are not planning any decreases to that budget in FY26. There may be some differences in city council designation numbers and in some of our federal grants.
And that's specifically it, just the adjustments. It would be good to be clear on that. Maybe not right now because time is limited, but if we could get that information.
We can follow up with you on that, absolutely. We also have a mandate to do a maternal mental health pilot that is currently unfunded. So that is another area within our maternal health work that we're hoping to be able to make more progress on in the future. For the trauma recovery programs specifically, I think, are you referring to trauma recovery centers? Okay, so our team is looking into the trauma recovery centers, the services they provide, the impact and the outcomes, and we are happy to follow up with council about our findings as we do a bit more of a deeper dive to understand the model and its effectiveness. However, what I would say is that we do certainly still have services and support through a number of other programs, including our mobile crisis teams and other service delivery that theoretically could help to support some of what you're describing. And then the final question, I think, was about reproductive health and your concern and our concern also about chemicals that may be causing fibroids and other uterine. I don't want to put words in your mouth, but I think you're talking about some of the chemical relaxers that have been shown to...
And also household items and other factors, all in one.
And household items and other factors. So we'd be happy to follow up with you and to share some of the work we've done in that space in the past. We continue to follow very closely all of the research and data that's emerging about associations between use of different products and health outcomes.
Thank you so much.
Thank you.
Okay, next we have Councilmember Hanif.
Thank you so much, and good morning, Commissioner Dr. Morse and CFO Anderson. The Progressive Caucus, which I co-chaired, recently launched our budget campaign, which we're calling Crisis to Care, to secure $61 million in mental health services and mental health treatment beds. And I want to go through some numbers for the Forensic Assertive Community Treatment Team, the Single Point of Access, and the Intensive Mobile Treatment Team. For the IMT teams, we are asking for $22 million in baseline funding, which would bring the total, the stagnant total, well, the 42 million is currently stagnant, but would bring the total to 64 million. And for FACT teams, we are calling for $7 million in baseline funding, bringing the total to $21 million. I want to start with single point of access. Could you explain how someone might move through the DOHMH single point of access system from an initial call to treatment and dismissal? And what percentage of New Yorkers treated through SPOA are referred after 911 or a 988 call? And what are the most common referral sites for treatments through SPOA?
Thank you for those questions, Councilmember Hanif. I'll start, but I'm going to ask my Executive Deputy Commissioner for Mental Hygiene, Dr. Jean Wright, to join me at the table as well to support some of those responses. So overall, last year, FY24, we had 4,107 referrals through our single point of access system. And that system does not have a wait list. It does provide referrals to programs like ACT and IMT, as well as other programs. Our budget for our single point of access program is about $4 million. And I think you had some specific questions about how someone would walk through that system. So I'm going to ask Dr. Wright to join us to share a little bit more about that.
And I also have questions about the wait lists. Before you respond to my question, I wanted to point out the wait list you're talking about for SPOA. Is that 2024 or 2025?
We don't have a wait list, but we had 4,107 referrals in FY24.
Oh, got it.
Through SPOA.
And then I'm going to ask for some of the numbers for the wait list for IMT and FACT teams.
Good morning. If you could please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to council member questions? I do. You may proceed.
Thank you for your question, Councilmember.
Can you turn on the mic?
Thank you for your question. Our single point of access, as Dr. Morris stated, helps providers connect with SMI to specialty mental health and treatment and recovery services that provide high level of care over several years. Most referrals come from inpatient psychiatric services, including but not limited to health and hospitals, as well as correctional health and homeless services. The health department reviews and makes referrals as appropriate to IMT, ACT, SPAC, FACT, and we use care coordination as well. So we have referral lists, and those are not connected to 988 or any of our mobile crisis teams. So if you have an immediate need for care or crisis, you can certainly call 988, chat, or text, and those will be handled. So there are no referral lists for those other programs. For IMT and ACT, there are 672 on the referral list for IMT and 682 on the referral list for ACT.
For FACT, you said?
For ACT.
ACT, okay. And what about for FACT?
For FACT, 51.
Got it. And how long does it take on average for someone to receive treatment from an IMT treatment team after an initial request? Same for FACT team. And I'd like to learn a little bit more about the wait lists. Are there wait lists for the IMT and FACT teams?
The referral list for IMT and FACT are the numbers I just gave you. Okay. And there are no referral lists for, again, 988 mobile crisis treatment, any of those things. And so your question again?
The average wait time.
So while individuals are waiting to be connected to services, we have care coordination, and so those individuals are connected to services similar to a care manager or a case manager during that time. So it does not preclude them from getting connected to services even while they're waiting on the referral to get to a specific program.
Thank you for that. These are extremely important programs. We need to expand them, and we're looking forward as the Progressive Caucus to getting this win. But thank you so much for your responses.
Okay, Councilmember Narcisse? Councilmember Nurse, I'm sorry.
Thank you, chairs. I had a question about your testimony, and then something later you mentioned. You talked about, in the mortality rates, you talked about the uptick in the racial inequity around overdose deaths. And I wanted to know a little bit more about where your resources are currently deployed to address this inequity. What are the tactics and strategies you're using specifically to bring this down?
Thank you for that question. Our team has been looking very closely at the data and where we need to focus so that we no longer see that trend of rising rates of overdose in Black and Latino communities. Our FY26 budget, we're expecting to have about $77 million overall dedicated to our opioid overdose crisis work. And I'm also going to ask our Assistant Commissioner to join me at the table to share a little bit more specifics on where we're focusing resources to address the high and increasing overdose rates for Black and Latino New Yorkers.
And before you answer that, is that an increase or is that a...
It's an increase.
Okay.
Do I need to do the?
Uncertain.
Sorry, make sure.
Sorry. Oh, wow. Good morning. All right, please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to council members' questions?
I do.
You may proceed. Thank you.
Okay. Yeah, so a lot of our work is actually looking at those communities where we're seeing the highest rates, and that's how we both disperse dollars and then, more importantly, disperse people into communities and work with nonprofits in those communities. So for a good example, I always think of is the relay teams. So those are our non-fatal overdose response in hospitals, and so we go very clearly by overdose rates, and then we work very closely with hospitals in those communities so that they're ready to receive our peers and our other workers who are coming bedside to do response. So those are some of the ways in which we're doing it. Also, our all of our programming really does focus, and wherever you see darker blue on the map of more people unfortunately overdosing, we're right there with a number of across the whole spectrum, from clinical care to harm reduction services, working with our HIV programs, because we know that there's a crossover with infectious disease, and then also prevention through helping people access clean syringes and other services that we know are going to drive down rates and help lives, and more importantly, help people turn their lives around through the services we're providing.
I'm going to ask some questions about Be Heard, but I want to keep on this track for a second. So what are your interventions at the block level?
At the block level, we're looking, so we work with our state partners and our local city partners to make sure there's enough treatment access, there's enough slots for people to get treatment access. We're also working, we go out with outreach team, or our community providers go out with outreach teams so that they can engage someone who maybe isn't connected to any services right there on the street.
Do you know
block.
what the capacity of your outreach teams are for your network?
We have the outreach and syringe litter teams. We have 6 who are connected to 14 different syringe services programs, and so they're canvassing the entire community. So it's not so much do they have enough slots, it's are they going out into the community, and the answer is they're right there on the streets. But we also work with DHS so that when they interact with someone who may also need services, it doesn't have to come through the OSL team. We want to make sure that all of our partner agencies know where to come to get people connected to care.
I think I would recommend more outreach to your elected officials and your community boards so they understand exactly how to get those outreach teams, because I would argue that most folks don't see those outreach teams on the street, and certainly not when we request them for a sustained period of time. So I'd love to get a little more transparency on that, and I think it would be great for y'all to do some deeper education around what that actually looks like and what the expectations are when there is an area where we know there is a sustained level of particularly syringe use. Okay, if I have a second, I wanted to ask about Be Heard. I wanted to get a sense of what is the current vacancy rate for social workers on Be Heard teams, and then I would love to get your opinion and thoughts about adding peers or people with their own lived mental health experiences onto Be Heard teams.
Thank you for the question, Councilmember. Be Heard is a program actually that the Health Department is not involved in. It is fully run by OCMH, so we're not involved in the operations of that program. As far as peers go, we at the Health Department are very supportive and believe in the power of peers and work with peers in many of our other programs at the Health Department, although we can't comment on the utility of peers in Be Heard, but we do believe in the peer model.
Okay. Do you all have peers on staff or within your department?
That is a great question. I believe that we do, but we can follow up with you on the details.
That would be great. I will come back for a second round. Thank you.
Actually, can I just follow up on that? Because I know that at every DOHMH hearing, when we ask about Be Heard, the response is that you guys are not involved in that, but then on the OCMH website, it says that they're working in direct partnership with you and H&H. So I just, if someone could clarify that, that'd be great, because I know OCMH is supposed to be overseeing it, but I can't understand how they possibly would not be coordinating with you guys on this. And maybe I'm just not getting it, I don't know.
We can follow up with you.
Okay, perfect.
Okay, Councilmember Bottcher.
Hi.
Hello.
understanding that Be Heard is under the auspices of Health and Hospitals, what's your opinion of the effectiveness of the Be Heard program, and how does that fit into your overall efforts to address mental health crises on the streets of New York City?
Thank you for the question. Be Heard, as was mentioned, is run by OCMH, the Office of Community Mental Health. My understanding is that they do work closely with Health and Hospitals to run the program. I am not familiar with any of their annual programmatic reports or any of that work, so I unfortunately can't comment on the effectiveness of the program since the Health Department doesn't lead the program or lead the interventions. What I would say, however, is that we continue to see lots of progress in other mobile treatment teams that we use to address severe mental illness, overdose, and other urgent and immediate behavioral health concerns across New York City. And we're certainly happy to follow up with programmatic data and outcomes data on any of those other programs if you would find that useful.
Do you meet regularly with OCMH and the other entities that are involved in Be Heard and share information about how these teams are working and how they fit in with your other teams?
We could follow up with more details on how we do coordination. My understanding is that our Division of Mental Hygiene and our Executive Deputy Commissioner, Dr. Wright, does meet regularly with OCMH. As to the agenda and whether or not Be Heard is a part of it, we can certainly follow up. But again, Be Heard is not a program that's run by DOHMH.
So the main program in New York City for in which medical professionals respond to 911 calls for mental health crises is Be Heard. It's in 31 precincts currently out of 78. None of those precincts are in City Council District 3. The west side of Manhattan, which includes Times Square, Garment District. We need to expand this to all 78 precincts. The mayor announced 2 years ago that that was the plan. Hasn't happened. And what I want to know is, why isn't the administration allocating that funding, requesting that that happen in next year's budget?
I do understand your concern, Councilmember Bottcher. I would refer you to Eva Wong, who leads OCMH, for further conversation.
I think even though it might not be under your direct control, I think we all need to take some ownership over the effort to expand Be Heard citywide, because we could do the right thing on all these other kind of outreach programs, but if we still have beat cops responding to 911 calls, people aren't going to get the help that they need on our streets. A couple weeks ago, Wendy Williams, who lives in Hudson Yards in my district, calls for help, mental health assistance, and we got beat cops showing up in force. No medical that I'm aware of, no mental health professionals on the scene. That's a policy failure, in my view. And we have a program that's up and running in 31 precincts. So I would like to, even though it might not be under your direct control, I would like to follow up with you and work with you and everyone in the Adams administration to get this expanded throughout the city, including in Council District 3, which sees hundreds of millions of tourists a year and is the face of New York City for nearly every person who comes around the world, from around the world. Their impression of New York comes from what they see in City Council District 3, looking forward to working with you on this.
Thank you, Councilmember. The last thing I'll just mention is we'd also be happy to follow up and tell you more about 988, which is an alternative and a program that we believe in very strongly. 90% of the calls to 988 are answered within 30 seconds. So we'd be happy to talk more with you about 988 as well.
Thank you.
Thank you. Councilmember Mamarato?
Thank you, Chair. Good afternoon.
Good afternoon.
So the bird flu outbreak has impacted poultry supply chains. What steps are being taken to ensure that food safety in our local grocery stores, restaurants, and markets, like in my area in Morris Park, are occurring?
Thank you for that question. We are spending quite a bit of our time following H5N1 bird flu very, very closely. This is where our surveillance systems are just critical and super important. We do work also very closely with the New York State Health Department, as well as New York State Department of Agriculture, to make sure that we are sharing information, that we're notified if there are new cases amongst poultry, wild birds, or dairy cattle, although we don't have dairy cattle in New York City. And so that surveillance work is happening kind of in an invisible way behind the scenes. The safety of the public is our primary concern in the New York City Health Department. So please do believe that we are taking all the cases of H5N1, any cases that we see in poultry, in live bird markets very seriously. Our role in the health department is to monitor the workers who are exposed to those live bird market H5N1 infected poultry very closely and make sure that they don't develop any additional symptoms. But the most important thing right now is that there is no person-to-person transmission of H5N1, and that is very reassuring.
Okay. Are there any initiatives or incentives for loss of wages to the employees who would possibly their place of business is closed? Or at least are you able to direct them to the state agency or figure out a way to help them regain their wages?
That does extend beyond our purview, although I absolutely understand there's an economic impact of closing live bird markets and doing the disinfecting and unfortunately, clearing out the live bird markets, but that piece is a bit beyond our purview. We focus on the health of the workers.
Do you recommend that they look into one of the state agencies for help?
I would say that, again, that's outside of our purview.
Okay. So I just wanted to kind of clarify something as far as the COVID-19 vaccines and the federal funding. Did you guys say that the federal funding will run out in 2027? Is that correct?
The federal funding for COVID, well, number one, we're thankful that we were able to get an extension to use some of that federal funding, but there are different timelines for when it expires, and I'll pass to our Chief Financial Officer to share more.
Yeah, thanks, Councilmember. I think the one you're referring to is the immunization vax funding, and that has been extended to June of 2027.
Okay, considering that we live in a state that you have to have health insurance, so if I go for a COVID vaccine, my health insurance is getting charged. Where is this funding going to? Like, I don't understand. Is it not covered under our health insurance?
A lot of the funding is for a number of different surveillance activities related to COVID, as well as activities to do community engagement, community education, and those types of...
So it doesn't just go towards the vaccines?
It goes towards a number of different activities related to COVID prevention and vaccination.
Okay, thank you. Thank you, Chair.
Thank you.
Councilmember Brewer?
Thank you. We have 2 cows at the Queens Farmhouse, just so you know.
That's in my district.
Let the record be corrected. All right.
I have a couple of questions. First of all, following up on school-based health, I am very supportive of it. I believe there are 105 schools that do not have a nurse. And so I don't know, do you keep track of that? I know you mentioned 195 million total for nurses. Does that include all the schools, or is it supposed to?
Thank you for that question. I can share those numbers. So there are 134 school-based health centers that serve over 145,000 students in 314 public schools. And we offer support for 35 of those sites. But I think your question is actually for school nurses. The 1,400 school nurses covers a broader swath than what I just mentioned.
But I'm just saying, Dr. Platt's no longer alive or around, I assume, but he had both DO, is he here? No. But he had the only person who had DOH and DOE. Does anybody else have that now?
I don't believe that is the case.
Okay, so who's in charge of school-based health care? That's what I'm trying to find out. Are you in charge of it?
It's a shared responsibility between NYC Public Schools and us, but we are the lead on the
Okay.
Office of
The reason
School.
I ask is there's a big coalition, as you know, of school-based, and they're not happy, and they say there are a lot of deficiencies. I won't get into it now because of time, but they say 104 or 105 schools do not have a nurse. That's not good, and they call in for $25 million more with some possible state money to supplement or complement or underwrite. But it's a long story. We do not have good school-based health care right now. So I'd love to have a further conversation about that.
We'd be
The
happy
state has some responsibility also. Number two, in terms of mental health and the Be Heard. I went out with the Be Heard in Queens. I went to Queens once in my life. And I went out once. And we went out with the social worker and the EMS workers. So issue, though, which I do think is your problem, is you can get support for somebody, but there's very few beds for them to go to. So what are we doing about that? That's the 24,000 elephant in the room question in New York City. Is that your responsibility? Is that Eva Wan's responsibility? Whose responsibility are these beds?
Thank you for that question. We do have a combination of different ways we try to support housing for people who are dealing with mental illness. One of the most expansive ways is through our supportive housing programs. It's about 12,000 people. We also do function respite beds as a part of our scope of work. But you are right that there are sometimes challenges with getting space for respite.
So who's in charge of trying to figure that out? Because they say that, there's one program in East Harlem, one program, 11 beds for men, 3 for women. That's it. That's got 24-hour psychiatric OT and nursing services. We need more of those. So who is in charge of trying to get more beds for this population, the one that Be Heard excellently deals with?
Thank you for that question. I'm going to ask our Executive Deputy Commissioner, Dr. Wright, to come back to the table to share a little bit more on those efforts.
So nobody has Dr. Platt's thing. What happened to his, his thing that he hung around his neck, because it had 2 things in it. Go ahead, sir, I'm sorry. 2 IDs in one, only human being in the world. Go ahead.
Thank you, council member.
Where are my beds?
So I'm thankful for the council for promoting this invaluable program, supportive housing. My team testified on supportive housing at the end of last year, and we are proud to provide information on our role in this work alongside our partners HPD, DSS, and other agencies. So it is a combination of city agencies that work together to create more housing. And as Commissioner Morris said, we're very excited by the fact that we've been able to provide more than 12,458 housing place for housing.
Okay, I won't belabor it now, but the issue is it's sort of the in-between housing that you're looking for. I know what supportive housing is. I'm quite familiar with it, but in between, to get person from Be Heard to what you're talking about, it needs an in-between. It needs something that's going to get them stabilized so that they can go to the supportive housing, and those beds don't exist. So I guess you're working on it. Somebody's working on it.
Thank
you don't
you
know
so
who
much.
though, right?
And we're certainly always willing to learn more and to take in
Put us in
information,
charge.
and so we're going to continue to do that. Thank you.
Next question is clubhouses. I want to thank Councilmember Linda Lee. She's on the clubhouses. Are you going to support the smaller clubhouses? We like the big ones, but we want the smaller ones. Are you going to help us support them?
What I'll start by saying is that we really believe in the clubhouse model in the New York City Health Department. 11 of the 12 clubhouses that were a part of the new RFP.
Those are big ones.
They are large, but they're in action. And so we're proud that that has happened. From our perspective, the RFP is closed, all the funds have been fully awarded, and the contracts have been executed. So that's where we are on our clubhouse.
So we're going to have to go back for the 1 year, 1 year, 1 year, 1 year to get the smaller ones.
We do support the clubhouse model.
Okay, we won't get into that anymore. In terms of rats, so obviously they're down between Carolyn Bragdon, who's my hero, and the rat lady. So how big is that department, and what is the budget? And is it increasing, decreasing? What's the budget?
Our FY26 budget for rat mitigation is $4.7 million. And that work includes, in FY24, for example, we conducted over 190,000 inspections related to concerns around rats.
How does that show any improvement? What's your analysis with all that money?
I do think we have seen some changes, but I'm going to ask our Deputy Commissioner Corinne Schiff to join me at the table and share a little bit more.
Thank you.
And as she's joining, I just want to also mention that the current Office of School Health at the New York City Health Department is led by Gail Admin.
Okay.
Good afternoon. Please raise your right hand. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council members' questions?
I do, yes.
You may proceed.
Thank you, Council Member, for the question about rats and for your ongoing support for that program. And I'll be sure to
mostly for Caroline.
I will be
Bragdon.
sure to pass on your regards to Carolyn Bragdon and to Kathy Karate, who's the city's
the rat lady,
the so-called rat czar, who's been doing a terrific job coordinating efforts among the different agencies that do rat control work. We are starting to see some improvements. We've seen complaints dropping, and you heard Dr. Morris talk about our increasing inspections. And I think we will also see ongoing improvements with the Department of Sanitation's efforts to containerize trash and the changes that the council made to the Dining Out New York. So I think that the trajectory is really good on rats after we had seen a lot of improvements before the pandemic and then lost some ground.
All right, can you keep the committee updated, so maybe in 6 months to let us know what the improvements are or not?
We sure can, and then I would also encourage you to look on our environmental health data portal where we provide some of that data, and on our rat information portal where New Yorkers can check to see our inspections on their particular properties.
All right. ACC, I'm a big supporter of Rita, but obviously there are people out there who are always complaining. So my question is, what's the status of the numbers of animals? Are they able to continue to take in dogs and cats? What's the budget? They always are needing staff because they have such hard work to do. Can you update me on ACC?
Yes, I'll pass to Corinne Schiff.
Yes, thank you for your support for ACC. It has been a challenging time for ACC since the pandemic. Intakes are up. We encourage New Yorkers who are looking to add a pet to their family to visit our new Manhattan Pet Adoption Center. ACC is always open. It is New York City's only open admissions shelter, so we are never closed for intakes. ACC has a really robust program to help New Yorkers who are looking for ways to keep their pet to do that.
What's their budget, and are they part of any new needs? Because they do need more staff.
Our current budget for ACC is $34 million in this year, and for next year it will be $37 million.
Okay, and what are they planning to do with the extra money?
I'll pass to Corinne Schiff.
The budget is for all of their ongoing operations. As you know, and Chair Schulman was with us when we opened the Queens Animal Care Center, which is a beautiful, big, state-of-the-art animal shelter, and we are looking forward to opening the first full-service shelter in the Bronx. There's the full renovation happening right now in Brooklyn.
Okay. Planned Parenthood is leaving Manhattan. It's irritating me quite a bit. Will that have any impact, or is this not your expertise to have to deal with? I do find they're going to be in other boroughs, but I find it upsetting that they're leaving Manhattan. Does that have anything to do with my concern and your concern that people get good health care?
This is 100% a priority for us in the New York City Health Department and for the whole entire city. We do operate an abortion access hub, which is a phone line that anyone in the whole country can call, actually, to get information
I'm aware.
about access. And since it started, we've had over 8,000 calls and chats. About 1,000 of those calls are for people from out of state. So we still are touching and engaging New Yorkers the most. We are always concerned about any changes in capacity for reproductive health care, but our commitment is to continue to work with all the partners who are providing that care to make sure that New Yorkers have access to the care.
So you're not concerned that this closure of Bleecker Street will impact the care?
We are happy to follow up with you with any more specifics about any concerns we have with capacity. But currently, we also offer abortion services at our sexual health clinics in the New York City Health Department. And the last I heard is about a 2-week wait, and so which is still pretty timely. But we'd be happy to follow up with you with more information.
Okay, and then the issue of inspections of both for cigarettes, for vaping, for restaurants, et cetera. Obviously, this is a big aspect of your multifaceted department. My question is, do you have enough staff to do that? Is that something that has had to take a back seat because of all the budget cuts? And I just want to know where we are with that issue.
Thank you for that question.
Then I'll stop, Madam Chair.
Thank you for the question. Our current budget for food safety is about $24 million, and we do inspections of food service entities, about 30,000 or so per year. We have been working to hire up in that particular program to make sure that our inspections are done in a very timely way. But we're happy to follow up with
What's the
any more
vacancy?
details. We can follow up with the specifics on our vacancy rate.
Thank you.
Thank
I think it's a problem. Thank you.
Thank you.
Okay, Commissioner, we're gonna have Chair Lee is gonna ask questions. Then I'm gonna ask the rest of my questions, and then we're gonna do a second round, okay? So I just wanted you to be aware of that. Chair Lee?
Yes, let us know if you need coffee or water or anything else. And just as a personal PSA, I turned 45 last year and got my endoscopy colonoscopy, so I fully recommend everyone to do that. And mammograms every year, very, very important.
Thank you. That's great.
Yes. Okay, so let me switch over to Jish. I feel like Dr. Wright, you should just stay up here and get comfortable. But so I know the preliminary plan also, in terms of supportive housing, it is 64.2 million of the fiscal 25 only, and out of that total, 42.9 million was dedicated to support units of 1515 supportive housing. And there are currently 4,500 1515 units and 8,500 pre-1515 units in the city. In addition, 500,000 is dedicated to justice-involved supportive housing, known as JISH. 4.8 million is dedicated to New York 3 supportive housing, and 16 million is dedicated to additional mental health services. So how many 1515 units will be supported with this funding, and where are they located?
Thank you for that question. I am going to ask my colleague, Dr. Wright, to join me at the table to share a response.
Thank you, Chair Lee. The city's commitment to develop 15,000 units in 15 years, half congregate and half scattered. We're on track for the congregate, but not on track for the scattered. The health department has been on opening new supportive housing. In recent updates for 1515, the units were awarded, and towards this overall goal. The health department focuses on the services provided in the units and are open and available.
Okay, so not on track for you're on track for the congregate, you said, right?
Yes, but not the scattered.
Not the scattered, okay. Where are we at with that, the scattered?
In terms of the, we have about, I'll have to get back to you on the actual number on the scattered, if that's okay,
Okay.
Chair? Okay.
And then are there any new units that are being built with the funding?
So we're on track to reach our goal of 15,000, and so yes, there will be new units built.
Okay.
And just to clarify, Chair, yeah, the funding that was added in the prelim budget is all to support the ongoing rollout of existing units and recent.
To support, I'm sorry.
Oh, sorry, to support the rollout of existing units and recently built ones. So
Okay,
the money that was just added.
Okay. And how many DOHMH staff work on the 1515 supportive housing needs?
I'll pass to Dr. Wright on that one as well.
How many staff?
Yes. Are working on that initiative to make sure that everything within 1515 and JISH gets done.
I do not have a number with me today, Chair. I'll have to get back to you on that.
Okay. And how will JISH units be served by the additional 500,000, and which units will receive the additional supports?
I'll ask Dr. Wright to share some updates on that as well.
So as our CFO has stated, the money is for the current units, and so I'll have to get back to you in terms of anything coming in the future.
Okay. Do you know if the state also, and I don't know, because I know you guys regularly speak with the state as well. I, for one, have Creedmoor, which is in my district. And so I just wanted to know if you have heard that there are going to be additional beds and supportive services and supportive housing, because I know they have some groups on that campus already.
I think we'll have to follow up with you on that.
Okay. 16 million is dedicated to a program that is described as mental health voluntary. So can you provide details on this program in the budget?
I will have to pass to my chief financial officer. I'm not familiar.
Okay, and then going back to the housing, supportive
Sorry,
housing.
Can you just say the name of that program again?
Mental health voluntary.
Mental health voluntary.
Yeah, it's 16 million, so I just wanted to know what that was, if you could give me more details. And if you don't need that money, can we put that somewhere else? That's my other question. Okay, if you could just let us know. I'm gonna switch over to clubhouses, and I know that Councilmember Brewer also asked questions about this. And by the way, I can attest to the fact and was a witness of her expletives that came out of her mouth when she came out to Queens to visit. But yes, the clubhouses are, obviously in the spectrum and continuum of care that we're talking about when it comes to mental health is super, super critical and important. And is there a chance that, and I think I know the answer to this and I'll ask a follow-up, but is there a chance that the current contracting with the larger clubhouses, that there's room for amendment to those?
Thank you for the question, Chair Lee. We, again, remain very committed to the clubhouse model and have seen great impact from it. We're glad that 11 of the 12 clubhouses are in action for the RFP that we recently issued. That was the first time that RFP had been issued since the 1990s. So we do think it was a good step forward, actually, to address any issues with service delivery, to reissue that RFP. In terms of amendments to the RFP is closed and all the funds have been awarded and the contracts have been signed with those 11 clubhouses.
Okay, and if the scope of work slightly were to change, there's no reason why a new RFP that does include some of the smaller clubhouses would not be able to happen, correct?
We'd be happy to follow up with you to have a conversation about that. But at this time, we do feel that the RFP that we issued was very comprehensive. It was $30 million in funding. We're glad that those $30 million are getting out to the 12 clubhouses. And we expect even more New Yorkers to be able to access clubhouse services because of this new RFP and our increased investment in clubhouses.
Okay, and I'm sure, obviously, as you know, that, it's not a one-size-fits-all, which I think is some of the concern that the community members have, especially the 5, Shelton Lofts, Job Connection Center, Lifelinks, Rainbow Club, and Top Clubhouses. I just wanted to mention that those are part of the 5 that did not meet the threshold of the numbers in terms of the annual membership. And so I just want to make sure, what is DOHMH doing then to make sure that in the future moving forward, that they're going to be able to receive the resources that they need?
I do acknowledge that those are clubhouses that have been providing services for some time, so I do understand your concern. From our perspective, again, the RFP with increased investment, $30 million, has been closed out, and all of the contracts have been awarded. And the dollars have been awarded to the clubhouses. So I do understand your concern about the smaller clubhouses. However, we feel that, again, this new RFP is the best path forward to make sure New Yorkers have more access to clubhouse services.
Okay. Subcontracting, hub and spoke, those kind of models. I know that I had previous conversations, but just want to emphasize that I still would love to look into those options as well. And then according to OCMH's annual report, 10 of the DOHMH funded clubhouses are currently open, while 3 will open soon, if I'm understanding this correctly. And so which clubhouses are not open yet, and why was their opening delayed?
Apologies, the numbers that I have is that 11 of the 13 clubhouses are up and running, including 7 that were previously established. Our expectation is that we'll have about 6,600 members enrolled by July of 2027.
Okay. I'm going to switch gears a little bit to the opioid settlement funds, because I know DOHMH received $23.4 million in fiscal year 25, and some of these questions have been asked already. But as discussed in the hearing, $4.1 million will be allocated to expand wraparound services at all the 14 syringe service providers, with $1 million to expand the Relay program. And $3 million to improve and expand services on Staten Island. An additional $4 million will be allocated to expand buprenorphine access, and $3 million will expand recovery support. What will the remaining $15.8 million be spent on?
Thank you for the question, Chair Lee. We do work very closely with OMB on how the funds for OSF are allocated. It's a combination of us at the New York City Health Department, plus Health and Hospitals, plus OCME that all receive OSF funding to try to, again, meet our goal in Healthy NYC of reducing overdose deaths by 25% by 2030. So we are continuing to find ways to do that work. For the specific question about where that the $15 million is going to go, I'm going to ask my colleague, Rebecca Lynn Walton, to join me at the table again to share some more specifics. Oh.
Do you want to take this? Okay. So happy to talk about the health departments, and thank you so much for having an OSF specific hearing a few months ago. That was very welcome and needed. And yeah, so I can talk about, we have 5 really exciting initiatives. So we have expansion to all of the continuum of care on Staten Island, and we have the ongoing investment in on-points care. We also have the Relay expansion you mentioned with the hospitals. We also have the treatment initiative to expand access for opioid use disorder at 10 recovery clinics, and that was the model I talked about before, wanting that to really be the standard of care across the city for same-day access to medication-assisted therapy. And then we also have recovery supports expansion, which expands recovery supports at the 8 recovery centers across the city. So I can easily say that it's full investment across the continuum of care.
Okay, so there's no remaining $15.8 million?
I defer to my colleague, the CFO, for numbers.
Yeah, all of the funding has been accounted for. A part of the balance that you were talking about is $3 million for OCME, so we defer to them on that piece.
Yeah, that one I know is going to them, but I was just, because according to our numbers, we're seeing that there's a $15.5 million to be spent. And so I'm just wondering where that money's going to go.
I think it's, I mean, we can quickly run through the list if it would be helpful.
Okay, because I'm not good at math, so I need help with this.
Yeah, so the round 2 expansion was really, so Staten Island was $3 million, SSP service expansion was 4.1, Relay was 1 million, treatment expansion was 4, recovery expansion was 3, so that's the 15.1 increase in the round 2, and then that's on top of the remaining funds that were allocated to OnPoint, which was 8.4 million.
Okay, because there's 23.4 in FY25 and then another 26.9 in FY26, so I just want to make sure.
Yeah, so the numbers are a little bit different than the ones you have, so the correct number is about 20 in the current year and about 24 starting next year.
Okay, So if maybe we could have a follow-up conversation, because I want to
Sure.
figure out where the discrepancy in those numbers are. And I know that DOHMH publishes an annual report on the opioid overdose prevention programs that receive settlement funding. Would it be possible for future reports to include the amount of opioid settlement funds that each program uses, as well as information on what the funds are spent on?
We are required by law, or the city is required by law, to report on how we spend all of the OSF funding annually. So we can certainly look at that report, that annual report that's required by law, and see what the opportunities are to make it clearer.
Okay, perfect. And I'm just going to end this round for myself with questions around disabilities, and then I'll wait till round 2. So I know this is obviously not your department, but the Mayor's Office of People with Disabilities, MOPED, has, in my opinion, an atrociously low budget. It's $678,657. So I just want to be very clear. $678,657. It's not even $1 million, which is $138,254 more than at adoption. But there's been ups and downs with that budget number. And so I know MOPED obviously is not technically under DOHMH, but it does provide services to 1 million New Yorkers with disabilities. And was DOHMH involved in any discussions, or has there been any coordination with MOPED about the budget?
Thank you for the question. We are also in the health department very much aligned with prioritizing New Yorkers with disabilities. We don't have any say over the budget of other agencies or other offices.
Okay, so let's talk about the DOHMH disability services funding then, because in DOHMH's budget for FY26, for developmental disabilities program area, it's about $9.5 million, which is only 1.3% of the mental hygiene budget for FY26. And in addition, the developmental disabilities program area is $883,545 less than it was at adoption last year. And so quick question, is all of that funding contracted out for the 9.5?
Chief Financial Officer for that question.
Yeah, thanks for the question, Chair Lee. The vast majority of that funding is contracted out.
Okay, and what are if you could just go through, what are the disabilities-related services that DOHMH provides, for the record?
I think we'll have to get back to you on the specifics.
Okay. Sorry, I'm just kind of pausing because I'm like, how do we? I feel like we should know the answer to that question, but okay. How many people with disabilities did DOHMH work with in the calendar year 2024? If possible, can you provide a breakdown of the number of people that were treated by each disability-related program?
I'm going to have to just tell you that we'll get back to you with the specific numbers for the number of people treated.
Okay. All right, I'm going to pause for now there. Sorry. Thank you.
All right, so I'm going to ask some questions, and then we're going to do a second round with folks. So DOHMH partnered with Undue Medical Debt, formerly known as Rest in Peace Medical Debt, to clear New Yorkers of $2 billion in medical debt. The program was first announced last year in January and was first funded in the fiscal 2025 executive plan for $18 million dispersed between fiscal years 2025 through 2027. As of January 17th, 2025, 35,000 New Yorkers were relieved of a total of $80 million in medical debt. How many people were addressed by this program, and how much medical debt was relieved since then?
Thank you for the question. We are excited that we've been able to launch this program, considering the extensive amount of medical debt that many New Yorkers hold, and the fact that it impacts on levels of poverty and healthcare seeking behavior extensively. We have a contract with Undue Medical Debt that's $6 million per year for 3 years. And that contract allows us to partner with them to relieve large amounts of debt to the number that you described. We can follow up with you with the specific number of how much debt has already been relieved since the contract just started this year.
Okay, that would be really good. Are DOHMH and Undue Medical Debt working on target goals for how many people will be addressed, as well as how much medical debt has been cleared throughout the time frame of the program?
Yes, we do work very closely with them on both the number of people impacted and the amount of debt relieved but we're happy to follow up with specific numbers.
Okay, and you're monitoring the work that that Undue Medical Debt is conducting?
Yes, that is correct.
How many staff are assigned to monitor this program, and how is the work monitored?
I'll have to pass to my Chief Financial Officer.
Yeah, I mean, there are a variety of staff throughout the agency that work on this. We can get back to you with specifics if needed.
All right, please, yeah, we have a number of things for you guys to get back to us on, so let's make sure that we get that. What criteria, what's the eligibility for someone to be qualified for their medical debt to be cleared, do you know?
Yep, the eligibility criteria is outlined. It's been shared publicly. This is for people with debt at the hospitals that Undue Medical Debt has a partnership with, and it's for people who have up to 400% of the poverty line in income as well.
Okay, is this service being advertised, and if yes, what methods are being used to advertise it?
Undue Medical Debt works specifically with the hospitals directly to reach out to individuals who meet the criteria that I just described, and then send those individuals letters specifically outlining the amount of debt that is going to be relieved. So it's not broadly advertised, but it really is in partnership. Undue Medical Debt partners with the hospitals to move that work forward.
So do you know if those hospitals go to the patients and advertise it that way or tell them about it?
My understanding is that the communications come from Undue Medical Debt.
Okay. All right, so I also want to ask you, every year I ask this question in the budget. You have a line for emergency preparedness. What does that really involve? Because I just want the delineation between that and the Office of Emergency Management.
Absolutely. So our agency is very, very much focused on and invested in emergency preparedness.
Right.
In fact, I would say that all 7,000 employees of the health department have the potential to have a role in any emergency response. Each of them, based on their skill set, is assigned within our systems because of their expertise, a role that they could or would potentially play were there to be a public health emergency. So that is kind of one of the ways in which we organize all of our emergency preparedness work across the New York City Health Department. That is distinct from NYSEM. NYSEM does the coordination for emergencies on behalf of the city. We do have, again, all staff have the potential to play a role in an emergency, but we do have one division that is specifically focused on emergency preparedness, operations, training, et cetera, and the budget for that division is $41 million.
And so that's for staff and for the training and everything else, because it's a lot of money. That's why I'm asking. If we could have a breakdown, because I always ask every year and then we don't get it, but.
Sure. We'd be happy to share that and follow up.
Thank you. All right, now I'm going to ask about the animal care centers. Do you want to bring up your?
Depends on the question. You can ask the question.
Okay. So what are DOH-MH's fiscal 2024 and fiscal 2025 budgets for the animal care centers?
Thanks. I'm going to pass to my Chief Financial Officer for those budgets.
Yeah, thanks for the question. So our budget this year is $34 million for AC&C, and next year it's going to be $37 million.
Okay, can you give a breakdown of PS and OTPS by each animal care center?
It's a little bit complicated to give a breakdown in that way because the resources are shared across sites.
Okay.
We're always working with AC&C to make sure they have their needs.
You have, the Brooklyn site is currently closed, am I correct? Yeah, and so when do you expect that to come back online, because that's creating a problem for the other centers?
I think it's 2 years, but I'm looking over at Corinne.
Yes, we are doing a full renovation of the Brooklyn Care Center, and we're anticipating it would reopen in the fall of 2026.
Okay. I know each animal care center is different, but do you know the average cost to operate each center?
I think, as Aaron said, we'll get back to you about details, and it's hard to break it down in that way, but we'll share some of those details.
Okay, what is DOH-MH's fiscal 2025 headcount under the ACC's broken down by location and the positions and salaries. I assume you're going to have to get back to me on that, too.
Well, it's a contract that allows us to partner with them based on their
Okay.
needs, but I'll pass to our CFO to share more.
That's right. We'll give it is a contract, and again, there are a number of positions that are shared across sites. So.
So if we can get that information. What is the total capital cost for renovations for the Brooklyn ACC?
I'll pass to my CFO.
And I will tell you in just a second. So Brooklyn is about $50 million in capital.
Okay. Now, now the Bronx ACC is only a resource center, and so it doesn't provide adoptions or medical services. So I'm just curious why the construction for the Brooklyn ACC, how is the determination made to keep it fully closed as opposed to partially closed while it's under construction? Because there's such a dearth of facilities and resources.
So as we planned for the full renovation of the Brooklyn site, actually the initial plan was to develop it in stages and to keep it open in pieces. As the development of the Queens site moved along, it turned out that those two projects were fairly aligned in timing, and that gave us the opportunity to essentially move the Brooklyn activities to Queens, which is letting us do the development in Brooklyn much more quickly, and also spare what we were concerned about, which was having the animals and staff at the site during the construction. So this was a way to move the renovation more quickly, and once we are done in the fall of 2026, our expectation is we will have a full-service shelter in every borough, which has been a longstanding goal of the council and the health department.
How many animals were in the Brooklyn ACC when it closed, and how many were moved to each of the other ACCs?
I don't have the animal count. I know that Risa Weinstock, who's the president and CEO of Animal Care Centers, is always happy to meet with council members. And I know, Chair, you've been to the site, and she
Yes.
would be happy to provide those details to you, I'm sure. There's also just a wonderful video, I don't know if you've seen it, of the move of the animals from Brooklyn
I
to
haven't seen it.
Queens. Oh, I've seen it many times. I could watch it a million more, but I'm sure that Ms. Weinstock would be happy to
You
share
could
that
share
with
that.
you.
That would be good. How many employees worked at Brooklyn ACC, and where did they go after the facility was closed?
So for the most part, the staff who were working in Brooklyn have moved to Queens. We do provide staffing numbers in the Local Law 59 report that we submit, so you can find those there.
What alternative options do people that live in Brooklyn have for adoptions and medical care?
The Queens ACC is actually essentially on the border with Brooklyn, so residents of Brooklyn are welcome to go to the Queens ACC for adoption, or as I mentioned to Councilmember Brewer's question, to our beautiful new pet adoption center in Manhattan. And I do urge all New Yorkers looking for a pet, come to ACC.
Are there any conversations to expand the services available in the Bronx ACC so people living in that borough can access them?
We are very excited that we're hoping in the spring, in about a year from now, spring of 2026, to open that borough's first full-service shelter, and we're very much focused on that. And at that time, the Bronx residents won't have to travel to ACC in another location to adopt.
Local Law 59, which you mentioned, of 2011, mandates that DOHMH submits a detailed report annually by February 28th on the management and operation of all full-service shelters in the city. Where's mine? I'm missing a sheet here. I'm missing it. Excuse me one second. Never mind, I apologize for that. I'm actually going to ask about HACA now, people living with HIV and AIDS. Now, I'm done with these questions. The Housing Opportunities for Persons with AIDS program is a federal program that assists low-income individuals with HIV or AIDS with housing and support services. HOPWA is funded at $22.3 million in fiscal 2026 and has 7 funded positions in the preliminary plan. How many people currently live on HOPWA sites in the city?
Thank you for the question. HOPWA is certainly a program that we have seen great impact from and is a very positive one for people living with HIV. I'm not sure that we actually have the number for how many people are living in HOPWA right now, but we can follow up with you.
Okay. In the preliminary plan, the funding was increased by $1.1 million in federal dollars in fiscal 2025 for the HOPWA program. Will this funding be allocated to the construction of new sites, or will it be allocated for other services?
I'll pass to my CFO.
Thanks, Chair. That's actually just a technical adjustment around, increasing grant funding, rolling out grant funding as it comes in. So that was a technical adjustment.
So there's no additional or specific services that are going to be funded with that?
Correct.
Okay. On February 12th, the Committee on General Welfare held a joint hearing with the Committee on Health on the HIV/AIDS Services Administration, HASA, which provides temporary and supportive housing in addition to support services. What is HOPWA's relationship to HASA?
Thank you for the question. We can get back to you with more details on that.
Okay, the PMMR highlights the number of new HIV diagnoses in calendar year 2023, which has increased to 1,686 from 1,567 in 2022 and 1,595 people in 2021. 122 people and 1,347 people in 2022. What factors, aside from the COVID-19 pandemic, has impacted the number of new diagnoses?
Thank you for that question. This is kind of what I was referencing earlier, that there was an increase in the number of new diagnoses for HIV, but a decrease in the number of new infections. And again, we believe that that is related to changes in care-seeking behavior during the pandemic, in that people were getting diagnosed with HIV a bit later post-infection.
Are new HIV infections a reporting metric?
They are.
Okay. Are there additional PMMR metrics related to HIV or AIDS that DOHMH would consider adding in the future, such as the percentage of people living with HIV that is undetectable?
We would be happy to have conversations with council in the future about that.
Okay, and I have one capital program question, and then I'm going to give it to other folks. The capital commitment plan allocated $2.4 million in fiscal 2028 for a computed tomography simulator. How many people will be served with the CAT simulator?
I'll pass to my Chief Financial Officer.
Okay.
Yeah, we'll have to get back to you on that one, Chair.
Okay, so the other questions that go with that, so you can give us that also, is does Jamaica Hospital currently have any CAT simulators or CT simulators or scanners? And why is this funding scheduled for several years into the future? And these are DOHMH capital projects.
We'll have to get back to you on that.
Okay, I appreciate it. I'm going to ask Councilmember Ressler to ask his questions. Thank you.
Thank you very much, Chair Schulman. Really appreciate your thoughtful leadership of this committee, and also just want to thank Chairperson Lee. I often hear from mental health advocates and substance use advocates across my district about just how grateful they are to have Chairperson Lee championing their needs here in the City Council. So thank you very much for that. And I'll just say, Deputy Commissioner Schiff, if you are failing to send around cute pet videos to the chair and other members of the committee, I am questioning your priorities. But with that, I will shift to mental health issues. So I'm really concerned about 988. I think we'd all agree that we want to see more mental health professionals responding to calls where their expertise is best suited. Has the call volume been increasing for NYC 988 with the change in the political climate? Are there sufficient resources to handle crisis calls from LGBTQ and Spanish-speaking communities right now?
Thank you for the question. We agree that 988 is an invaluable resource, and we partner closely with OMH to make sure that it is working and is meeting the needs of New Yorkers.
Do we have capacity to handle the increased is there increased call volume, and do we have the capacity to handle it?
There, as of December 2025, there were 29,000.
December 24.
Thank you. December 2024, there were 29,000 inbound calls, and we get about 335,000 calls per year.
No new data
through
for the
998.
Trump administration? No new data through the new year?
We would be happy to follow up for 2025.
I'm just totally confounded at why the health department would propose a 30% cut to 988. Considering how critical a service this is, how important a resource it is for communities at risk, why would your department propose such a draconian cut at this time when this resource is more important than ever?
Our current budget for Vibrant, our contract with Vibrant, which is the organization that runs our 988 contract in partnership with OMH, is $22 million.
Down from what the previous year? 32?
Down from $33 million the previous year.
So that's a 30% cut year over year. This service is more needed than ever. Call volume is going up. Why a 30% cut? Could you explain the rationale?
Absolutely. So we expected there to be an increase in volume in FY23 and FY24 because of a number of different things. What we were expecting for those years was about 500,000 calls per year. That never materialized. So that higher rate of funding was really with the anticipation of having a higher number of calls, again, about 500,000 calls per year. What we're seeing right now is about 335,000 calls per year. And so our $22 million per year contract with Vibrant right now is meeting that need.
I mean, I think inherently, if you were to if this cut that you all have imposed, a 30% cut on Vibrant and the 988 call capacity were to be realized, it would significantly reduce the ability of 988 to respond to calls in the ways that we all want to see. And it takes time to build up a new infrastructure, a new number for people to call so they don't just go to 911. And I think we're cutting off our nose to spite our face here. It's penny wise but pound foolish. It doesn't make sense for us to impose such significant cuts to this mental health infrastructure that we need so much. Chair, could I do two more topics briefly?
Can I just mention, Councilmember Ressler, we take that concern extremely seriously. Mental health concerns for the city are one of our top priorities. And as I already mentioned, within Healthy NYC, we both have an overdose and suicide reduction goal. We know that we have to have a certain level of service delivery to make
I respect you articulating that, but
can I finish my
please,
comment?
Go ahead.
So our expectation is for us to get to that goal, we are going to have to make sure our service delivery is commensurate with it. At this time, 90% of the calls to 988 are answered within 30 seconds, and we have mobile crisis teams that are mobilized. In fact, we had more mobilized this year than last year to address the needs of callers to 988. So I would say that I do understand your concern and definitely want to make sure that New Yorkers get the services that they need. But we do have a $22 million contract with Vibrant, and we're in discussion with Vibrant again about any changes in call volume that are expected.
I hear you. I appreciate that you articulate it's a priority, that you want to reduce the number of overdose deaths and mental health crises in New York City, but when we cut this resource, it undermines those goals. So just briefly on a couple other topics before the chairs kick me out. How many DOHMH health clinics, the kind of city-owned DOHMH clinics, operate in the city of New York?
We have 8 clinics currently operating.
And are there a certain number that are closed, that are not operating?
We do have a couple of clinics that are not yet reopened.
So one of the pieces that I thought was missing from your testimony was you mentioned the risk in federal funding, but I'm more concerned about the shift in federal policy, right? We have somebody who's in charge of our Health and Human Services department who doesn't believe in vaccines. Have you considered activating each of our DOHMH health clinics that are conveniently located in neighborhoods across the boroughs to make them immunization and vaccination hubs, to expand those resources and services so that we can be that first line of defense?
Thank you for the question. Immunizations and vaccination rates are a top concern for us. We are concerned about the national and local decreases in childhood vaccination rates, and we have a number of different initiatives that are currently in place and active to make sure that we get our vaccination rates higher. We think this is partially a legacy, again, of care-seeking behavior during the pandemic, and also partially a legacy of misinformation. Even though our clinics are essential and critical public health infrastructure and are often the safety net of the safety net, the programs that really get the largest number, of vaccines out there, our programs that are in partnership with our pharmacies and our other healthcare delivery systems across the city. Through that method, we get 2.7 million childhood vaccines per year out to New York City through our Vaccine for Children program. So those programs are already in action, and we're always open to speaking with council about new ideas for expanding impact of childhood vaccination.
Well, I think it's, we're the ones who can help break through in culturally competent ways to the communities across New York that are not being as responsive as they should be to vaccinations. And so I do think that this is a moment where we really need the health department to get a lot louder and be a lot more present in outreach campaigns and partnerships with each of us and our communities, because these diseases are coming to our doorstep, and the federal government is totally giving up their responsibility to do anything about it. And so it's falling on you and us to help keep our communities safe. I'm going to shut up. Last thing. I'm really concerned that we can no longer trust information from the CDC, that we no longer have a CDC that's going to be sharing information with us about what infectious diseases are breaking out and where and what we need to do about it. In your role as commissioner, acting commissioner, are you thinking about how to convene stakeholders? We have some of the leading public health experts at New York City, not just our health department, but at New York City hospitals, research institutions, so that we can begin to try and provide New Yorkers with the clear, basic information they need on how to stay safe from public health emergencies that are coming into our neighborhoods and communities?
We are also watching very closely the messages and the fact base of the information that's coming from the new federal government. So it's, believe me, it's one of our top concerns. We are concerned about misinformation around vaccines. That has been a concern of ours for quite some time. Even before this federal administration, there were concerns about misinformation about vaccines. Yeah. So all those things considered, one of the ways that we're working to increase our ability to ensure that New Yorkers have accurate and scientific information is partnering even more closely with our colleagues in the state health department. And I have found that to be very, very productive. We're also in constant conversation with health departments and city health departments in the region of New York City to make sure, again, that we're all sharing information and that we're aligned.
Right.
But I would say that ultimately your support in getting the Article 6 match rate restored would be one of the most impactful ways that we could ensure that what you're describing actually happens.
I've signed on to that letter with Councilmember Shulman. I'll just say, many of us have lost faith that this mayor is going to stand up to President Trump and his appointees. But the medical professionals of the health department have Hippocratic oath, and we need you to speak out and speak up, and we need you to educate New Yorkers to stay safe, because the federal government is no longer a partner we can depend on. Lastly, major cuts at the FDA. We're down. We're up, I think, slightly this year on restaurant inspections. We're still not going to hit our 100% goal. Do we need to be doing more when outbreaks of salmonella, listeria, other things are a risk to our communities, to be doing extra restaurant inspections, doing more to keep New Yorkers safe? How do we help fill that gap?
Thank you for the question and for your concern. I will say that we have, as you said, improved the number of restaurant inspections. We are doing about 30,000 per year of food delivery sites across the city. Our environmental health team is working very actively to make sure that we're adequately staffed, to make sure that we can continue to improve and meet our goal of 100%.
But we're not going to meet that goal this year.
We are working towards it.
But the PMMR said you're not going to meet the goal this year. Is there something I'm missing, that you're working toward it, but we're not going to hit it? Don't we need to be doing more if the FDA isn't going to take on its responsibilities?
Well, first of all, I'm not aware of the FDA changing the number of staff that they currently hire, although I know that that's been under discussion. And I would say that we are always willing to partner with council to do more, so we'd be happy to speak with you offline.
Thank you for answering my questions, Dr. Morris. I appreciate it.
Thank you. I apologize for earlier. I do have an ACC question, and I was missing a sheet. So Local Law 59 of 2011 mandates that DOHMH submits a detailed report annually by February 28th on the management and operation of all full-service shelters in the city. The report for 2024 includes the total amount of animals adopted, returned to their owners, transferred to other shelters, or euthanized, broken down by location, but the totals of those three don't fully align to the total animal intake. What happens to an animal if they're brought to the ACC but aren't adopted, returned, transferred, or euthanized?
I'll pass to Corinne.
That local law report, as you say, has us provide to you the number of intakes in the calendar year and the outcomes in the calendar year. So the gap in the numbers are the animals for which there are not yet an outcome. So those are animals that are still at ACC or with foster care.
On average, how long does an animal spend at the ACC?
I would like to have Ms. Weinstock reach out and have a conversation with you. That's a complicated number. I don't have that number at my fingertips.
Okay, all right, that was the question I wanted to ask, and now, well, two things. One, I want to acknowledge that we've been joined virtually by Councilmember Ariola and Councilmember Narcisse. Councilmember Narcisse.
Thank you, thank you. Thank you, chairs, and thank you, Mr. Anderson, for giving us all the data and how we're spending our money, and of course, our Commissioner Morse, thank you for being here again. I have a question on diabetes and related with our limb amputations. Do we have an increase in the city of New York?
Thank you for your question about diabetes. This is an area certainly of concern for us as well. There are about 800,000 New Yorkers who reported that they had diabetes from our 2022 data, and that's about 11% of New Yorkers. We do see significant racial inequities in the rates of amputation across New York City, and we're happy to share some of that information and follow-up. We're also, of course, required by law to, under Local Law 52, we're required to release a progress report on the citywide diabetes reduction plan, and that would have, again, more information about some of the programs and data as well. And that report is due on April 1st.
On April 1st. How does that tie with Healthy NYC to you?
Absolutely. It is intimately related. Cardiovascular, cardiometabolic, and diabetes-related diseases are the #1 killer of New Yorkers. So we do see diabetes as well as cardiometabolic disease as a top priority. And we did just release an extensive chronic disease report at the end of January that really does describe a number of the main issues that we see with chronic disease across the city, the inequities we see in chronic disease, and it proposes 19 initiatives to really advance the city's response to diabetes prevention and addressing chronic disease prevention and chronic disease management across the city. Included within that is a number of diabetes initiatives.
Can you walk me through some initiatives, because especially in where you see the increase? I'm assuming it's a lot has to do with the chronic illnesses in Black and brown communities.
That's correct. One of the initiatives that we proposed in the chronic disease plan is that we start a guaranteed basic income pilot in the Bronx. The Bronx has one of the highest rates of diabetes in the whole entire city. And through this pilot program, were it to be funded, we would look at the ways in which guaranteed basic income address and meet the needs of New Yorkers with diabetes, and hopefully demonstrates an improved set of outcomes for their diabetes and for their health overall. Guaranteed basic income has been looked at in a number of areas, but it has not been looked at specifically for chronic disease. So we would be very excited to speak with Council more about this initiative and what it would take to move it forward.
Surprisingly, we have an increase in Manhattan as well.
In diabetes specifically?
Amputation too. Mm-hmm.
Okay, I'm happy to follow up with any more information about amputations for sure.
Okay, can you send us a breakdown through our boroughs specifically, so we'll have, especially those related to diabetes, the amputation related to diabetes?
Yes, that will be included in our annual report.
All our boroughs in 5 years, if possible, so we can have a better look at it?
We can follow up on that.
All right. So thank you, chairs. I don't want to take any longer. Thank you. I appreciate your time, Dr. Morse, as usual.
Councilmember Nurse?
Sorry, thanks. I wasn't sure which one of us were first, so I'll just pick up on the IMT. I wanted to go back to the single point of access line of questions that we talked about, and perhaps there's some language discrepancy here, but it was mentioned that there isn't a wait list, and so that's fine if we don't want to use that word, but I think there's some clarity that we're looking for in terms of when people, when you're reviewing this referral and you all determine that someone qualifies for one of these teams, how long are they generally, on average, waiting to be connected to those teams? And then additionally, if you could, in a detailed way, talk about the access to care coordination they're getting in between the time when it's determined they're eligible and they're waiting for the actual connection.
Absolutely. I'll ask Dr. Wright to join me at the table. Again, I'll start the response and then I'll pass to him. There are, for IMT specifically, our current annual budget for IMT is $42 million. There were 1,028 individuals served in FY24 in our IMT program, and we have 38 teams for IMT. There are about 672 individuals who've been referred to IMT but are not yet enrolled in the program. The time that they wait depends a little bit on their comorbidities and their unique situation. So there is triage in the list of people who've been referred. And I'll pass to Dr. Wright to share more about the specifics of case management while they're waiting to enroll in the program.
Thank you, Commissioner. Thank you, Council Member. So the SPOA, as you just indicated, is the referral process. So that is, all the referrals come through the SPOA. So there's not a specific time that I can give you for that. But in terms of those that are waiting for a particular service, they are receiving care coordination, which is similar to case management, so that they can be connected to services, and nothing precludes them from being connected to services while they're waiting on their specific referral.
Okay. You might have to talk it out to me like I don't know anything, and I'm fine I'm ignorant of this. So if you get referred, someone is referred and you find, you've reviewed their case, this person should be connected to a FACT team. How long on average are they waiting for that to be directly start working with that team? Or a team, however you want to call it, yeah.
Thank you for your question. I understand your question, and I will have to get back to you to give you an average of wait time.
Is there, I imagine y'all are going to be here for a little bit. Is there the ability with everybody here to maybe pull some data or ask a question back at your HQ and see if we can get something, just a little bit of something here to have?
Yeah, so you mentioned several different programs. You mentioned FACT, ACT, different ones.
Specifically looking for FACT and IMT.
We will certainly get back to you with that information.
Okay. It'd be great if we could get anything here for today.
I will do my
But
best.
if not, we will accept direct follow-up.
Okay.
How many people, what would be the personnel capacity that you would need or dollar amount to reduce that gap and get everyone connected to the service they need for those IMT and FACT teams?
That's a number I think we'd have to follow up with you about.
Okay. Yeah, it would be great for us to know, what do you need to reduce that whatever referral period? It's a wait list, even if you don't want to call it that, but knowing how many people you need, what money do you need to recruit for it, what money you need to retain people to do that, so that we can drop that down. And then I had one other question. I'm sorry if it's not fully relevant to you all, but I had a question about respite centers, or I don't know if we're calling them respite centers still, the local law we passed, wondering for a timeline on the 4 crisis respite centers that the council passed legislation on to stand up. And if we have a timeline, or if any are operational, if there's a contract out for anything, any information would be helpful if that's relevant to you all.
Yes, we do offer crisis respite residences, and folks who are in need are able to stay for up to 1 week in those crisis respite centers. I will pass to Dr. Wright to share a little bit more about the program.
Thank you. So the crisis residences, I think you referred to previously as respites, provide an alternative to hospitalization, as you know, and people experiencing emotional crisis. The crisis residences offer stays for up to 1 week, as Commissioner stated, and provide an open-door setting where people...
No, I understand what they are, but just, can you give us a
timeline.
A timeline?
I do not
for-
have a timeline.
Okay. What are the bottlenecks that you can share here with us?
I will have to get back to you on that specific question.
Okay. Do you have the money for it, or do you need more personnel? Do you need to issue an RFP for providers?
I do not have that information. I'll have to get back to you on that.
Okay.
I do have an answer to your previous question
Oh,
in terms of the act, if you would allow me.
Yes, please.
Okay. So it's important to recognize that some individuals that are on the referral list for ACT are currently receiving ACT services and awaiting referral to a team closer to their residence, to where they are. And so that, as you can imagine, this is a very transient population to some degree, and the program is designed to meet people where they are at. And so there are some systemic issues nationwide, as you know, with access to mental health care, but many of these individuals are already on a team, and they're waiting for another to get something closer to home.
Okay. We were hearing on our end that anywhere from 6 months to a year for someone who has identified that they could really benefit from this. You all agree before they actually get that. We want to help you get what you need to do that, because everyone's up in arms about people having a crisis everywhere, and we really want to make sure you have what you need to attach people and get them to dedicated care. So please let us know candidly what you need in the follow-up.
Absolutely. We appreciate your support, and we will definitely do that.
Thank you, Chair.
Councilmember Hanif?
Thank you. It's really disappointing that the administration does not have the average wait period for these services. And I hope that during the duration of today's hearing that you're able to come up with some numbers, because what's this hearing about then, if you're not presenting us with numbers? I want to ask about reproductive rights and trans rights. I authored Local Law 75 of 2022, requiring the city to conduct public information and outreach regarding safe access to reproductive health care. It's been really sad to hear from providers like Planned Parenthood about what's happening to our providers. And we need to have New York City be a leader in abortion, in safe abortions and reproductive health care more broadly. Could you provide an update regarding compliance with this law?
So thank you for your concern about abortion care and reproductive care and access to care. We do run a number of different clinics that offer access to abortion care in New York City. We also do run...
I'm sorry, my question is just simply about the law that mandates that the city do outreach and ensure that everyone in our city know, including folks from anti-abortion states.
Yes, we have done extensive public outreach, including a communications campaign that specifically shared information all across the city about our abortion access line. It gave information both on social media, online, television, perhaps not television ads, excuse me, but ads on the trains and subways as well, to make sure that New Yorkers have access to the information about where to call if they need abortion care or if they have reproductive health questions. So we are, from our perspective, in compliance with the law.
And how is the existing clinic access law being enforced? Do we have any data regarding the number of violations or relevant penalties that were assessed?
We would have to follow up with you about that information specifically.
This should be hand in hand with Local Law 75, given we want to make sure that folks know the protections that exist in our city. The clinic access law is incredibly important, and not having the number of violations is simply disappointing. And hopefully the number is 0. Moving on, it's been very painful and devastating to learn from some constituents of mine who have had pre-existing appointments for gender-affirming care canceled at NYU and NYU Langone and Mount Sinai. What is the administration doing to ensure that our healthcare providers are not discriminating against patients on the basis of gender identity? And are you tracking which healthcare providers within the city are continuing to resume delivery of gender-affirming care?
We are very concerned and are following very closely. Access to gender-affirming care is something that we at the health department do believe in, although we do not offer those services ourselves directly. We don't, in the New York City Health Department, regulate our healthcare partners across the city. That is the role of the State Health Department. And my understanding is the State Health Department has been in contact with many different health providers across the city about their legal requirement to care for all people. I also am aware of a letter from the Attorney General at the state also stating those same values and legal requirements. So we're very aligned with that, although we ourselves at the New York City Health Department don't enforce any assurances that the New York City healthcare delivery organizations would be doing that. And then I did want to just follow up on your prior question about the number of organizations or clinics that might be in violation of Local Law 75. It's not our agency that does the enforcement of that law. It's DCWP that does enforcement related to violations for Local Law 75.
Thank you. And I understand that the State Department has jurisdiction over healthcare providers, but what is the city specifically doing to ensure that that news, that information is reaching New Yorkers? Like, has there been any outreach around not discriminating, healthcare providers not discriminating against folks with gender identity?
Absolutely, yes. Well, I'm happy to follow up with communications that have described that. We use our social media channels that are both on Twitter and LinkedIn, as well as Instagram, as channels to educate the public about their rights, and we have done social media posts to that effect. We're happy to follow up with those specific posts.
That would be great, because I certainly haven't seen anything clear on this issue from the administration, and with our civil rights being stripped away and trans folks particularly being very, very vulnerable, we can't be the city that allows for our hospitals to deny care. Thank you.
We understand and agree.
You done? Okay, Councilmember Bottcher.
Hi. According to CDC data, 13.6% of New York City high school students have attempted suicide. Not contemplated suicide, attempted suicide. That's an increase of 56% since 2021. And it's more than 50% higher than the national average. One of my proudest accomplishments as a council member was passing legislation requiring the Department of Education to distribute suicide prevention resources to all New York City students. As a survivor of teen suicide, it's incredibly moving to me to see how many resources are out there that exist now that didn't exist when I was 15. But what is being done to get those resources out to our teens when more than 1 in 10 New York City high school students report having attempted suicide? That's a statistic that should terrify all of us. What is the New York City Department of Health doing to address this crisis? To what factors do you attribute this crisis, and what's your action plan?
Thank you so much for raising awareness about the concerning trends in suicide. It is certainly top of mind for us as well. We have a number of initiatives that are focused on youth mental health. And overall, where are we going on this issue? Our goal within Healthy NYC is to decrease suicide rates by 20% by 2030. So that's our North Star, and that's what we're working towards with the many programs that I'll share. In FY25, our youth mental health budget was $75.8 million, and that includes a number of different programs, including peer support, work that we've done around social media and youth mental health, as well as youth suicide prevention work. In addition to that, I do want to highlight our program called Teen Space. Teen Space is a program that many New York City teens with mental health concerns have engaged. Since the launch of Teen Space, over 20,000 New York City teens have engaged in services through Teen Space, and our FY26 budget for Teen Space is $10.8 million. And 80% of the users of Teen Space identify as people of color, and almost 60% live in tree neighborhoods. So we do believe that our Teen Space program is another way to improve access to mental health care and prevent suicide. Thank you.
Chair Lee.
Oh, Eric's done. All right. Actually, perfect segue, because I wanted to follow up on asking questions around youth mental health programs. So you said 75.8 million total is how much is being spent on mental health services related to youth, correct?
Correct.
Okay. And then how much of that is specifically for the school-based mental health clinics?
That is actually in a separate budget from the youth mental health. So our school-based mental health clinics are clinics that we support in partnership with New York City Public Schools. There's over 360 school-based mental health clinics that we support in partnership with New York City Public Schools through our Office of School Health. The health department's role in that work is really to offer technical assistance to the community-based organizations who provide those school-based mental health services and service delivery within those schools.
Those are the Article 30 ones?
Correct.
Okay. So there's 360 locations?
There are about 360 clinics, and the number of schools I have here, and I can tell you, is 223 clinics in 366 schools, supporting 366 schools.
Okay. And how many schools have mental health clinics that are still in need? Like, in other words, how many schools have requested to want to start one that have not received a school-based mental health clinic yet?
That would be a question for New York City Public Schools. They're the ones that provide the funding for the actual service delivery for the school-based mental health clinics. Our role is to really partner with the organizations doing the care delivery and helping them to make sure that their service delivery is as impactful and effective as possible.
Okay, so we'll follow up with that. And then, quick question, have there been any increases in the budget? Because I know one of the biggest complaints from the provider side is that in order to start up the clinic at, which is considered one of their off-site locations, they only have, I think, about $25,000 in startup costs, which we know is pretty much nothing. And so I just want to know if there's an increase to that startup cost, and if, in general, there's more of an increase in terms of the school-based mental health clinics. I know it's regulated more so through Medicaid and the insurances and the reimbursements and everything, but on top of that, is there additional support that DOHMH is able to offer them?
We do offer the technical assistance, as I was mentioning, but the question about funding for service delivery specifically would have to go to New York City Public Schools, who funds that part.
So you guys don't fund any of this, it's just oversight?
We do partnership, technical assistance to improve service delivery, and that's our role.
Okay. Have you had conversations with DOE about the challenges in starting up a lot of these clinics as well as maintaining? Because as we know, things like education workshops within the schools or to the school communities, those are not reimbursable services. And so my question I'm wondering is, has there been any joint conversations with you as well as DOE in terms of making sure that those clinics survive? Because, as we've just heard from Councilmember Botcher and others, and I know Chair Stevens is a huge, obviously, advocate for youth mental health services, just wanting to know that we're setting them up to thrive and not fail.
We are in constant conversation with New York City Public Schools about youth and school children age mental health concerns, and the chancellor has communicated to me directly that student well-being is one of her top concerns. So we are in very, very frequent communication with them.
Okay, and then what is the current budget for the mental health continuum? Because I know that that's a super popular program from everyone that I speak to, whether you're the agency or provider, and so just wanting to know what the budget is for that.
Sure, I'll pass to my Chief Financial Officer.
Sure, thanks, Chair Lee. These are typically funds that are added during the adopted budget, but if it's based on historical practice, it's about $472,000 for the health department. And of course, there are lots of other funds in DOE and H&H as well.
Okay, sorry, it was 400, can you repeat that?
Yeah, historically, it's been annual increase of about $472,000 a year for the health department portion.
Oy, okay.
And I think there's substantially more in New York City Public Schools and H&H.
Yeah, I think, if I recall, I think it's 5 million total, which I think is, I've always been advocating and pushing that there needs to be more for that, because I think this is definitely one of the programs that people say is successful and that they're very much in support of. So whatever we can do to increase that number would be amazing. And then I had a quick question around services related to veterans, actually. Sorry, let me just find. Okay. So just really quickly, on March 19th, 2025, Mayor Adams and Department of Veterans Services Commissioner described the efforts of the administration has been making to connect veterans in New York with mental health services. During the FY26 preliminary plan, the administration highlighted the Bridge to Home program as an effort the city will take to ensure that mentally ill homeless New Yorkers are receiving the services they need. So my question is, are any of those 100 beds in the Bridge to Home program allocated or set aside for veterans?
Thank you for that question. The Bridge to Home program is very exciting. It is a health and hospitals program, so I'm not able to comment on that.
Okay, can we follow up with that then, if possible? Because I would love to figure out how many of those beds also could be allocated for veterans. And what programs dedicated to veterans does DOHMH provide?
We don't have any specific service delivery that's only for veterans. That does come through the Veterans Affairs services, but we certainly do, we comply. There is a local law that specifically asks us to document how many people are veterans, and my understanding is we are in compliance with that law.
Okay, and just want to make sure that, and in terms of the treatment courts, whether it's for veterans or just overall mental health treatment courts. I know that you all are involved in that, so I just want to make sure how that is in terms of the staffing, because it seems like those are much more underfunded, and I just want to, is that in partnership with you and H&H?
I am not familiar with exactly what program you're referencing when you're talking about the treatment courts.
So if someone is going to, let's just say, have committed a crime, they're in the queue to go to Rikers, there should be some sort of assessment that's done where, if they come to, before a judge, there should be something in place in the treatment courts where it'll either, have those folks go towards treatment versus having to go to Rikers, let's just say. So from my understanding, it seems like the treatment courts are severely understaffed and underfunded, and I just wanted to see, and I know that veterans also have a separate treatment court, so I just wanted to know the status on the staffing for those and what the budget is for that as well.
We don't have jurisdiction over the treatment courts. That's separate from us in the New York City Health Department.
Okay, thank you.
Thank you.
Oh, and sorry, just wanted to clarify, the vacancies for DOHMH for, specifically for the mental hygiene positions and programs, is that at 33%? I know that you had mentioned 27% vacancies earlier, so I just wanted, because we had 33, I just wanted to clarify.
Yes, the number that I have is 27%.
Okay, perfect, thank you.
Thank you.
Commissioner, thank you. You've been here for a long time, and we appreciate, I know you're leaving somebody here
Yes,
to
we are.
listen to the public testimony. And we're just going to take a 5-minute break, and then we're going to do the Office of the Chief Medical Examiner. Thank you.
Thank you.
Ladies and gentlemen, please find your seats. Quiet down. Please find your seats. We're about ready to start. Quiet down, please.
Good afternoon, everyone. Now I would like to welcome the Office of the Chief Medical Examiner that investigates mortalities and conducts forensic research for the city, as well as Chief Medical Examiner Jason Graham. OCME's fiscal 2026 budget is $119.6 million, which includes $91.7 million for personal services and about $28 million for other than personal services. OCME's budget has increased by $15.2 million compared to last year's fiscal 2025 adopted budget. OCME has had federal grants in the past, but none in the fiscal 2026 preliminary plan. To echo our concerns with DOHMH's public health budget, we want to ensure that OCME has a contingency plan in case the loss in federal grants is permanent. In addition, we will discuss OCME staffing for forensic pathologists. There's a notable vacancy rate in this position, which is concerning because they provide autopsies for the city, and in the fiscal 2025 PMMR, it was reported that 600 fewer autopsies were prepared in the first 4 months of fiscal 2025 than they were at the same time in fiscal 2024. In addition, OCME has during the past year reportedly paused autopsies conducted on decedents that were suspected of passing away from a drug overdose due to these staffing concerns, and we want to get their response to these allegations and their plan to resolve any issues with autopsies in this category. Salaries for medical examiners within OCME have not kept pace with similar positions in other U.S. municipalities, contributing to the vacancy rate and morale levels within the office. This past December, the administration reached a 5-year contract agreement with Doctors Council, SEIU, to institute long overdue wage increases for the city's medical examiners. With this agreement, my hope is that OCME will be able to recruit, train, and retain medical examiners for years to come. OCME has historically done excellent work for the city, and as chair of the Health Committee, I want to ensure that OCME has the resources it needs to operate at the highest level. Once again, I would like to thank the committee staff and my own staff for their work on this hearing. I will now turn it over to Dr. Graham for his opening remarks.
Good afternoon.
Chief Medical Examiner, we do have to just swear you in first. Oh, I'm sorry. I'm so sorry. Yes, you can continue with your testimony, and then we will move to swearing in after. Thank you.
All right. Good afternoon, Chair Schulman, Chair Lee, members of the Committee on Health and the Committee on Mental Health, Disabilities, and Addiction. On behalf of the Office of Chief Medical Examiner, or the OCME, I appreciate the opportunity to testify today. We value your leadership and ongoing support in our mission to serve New York City's communities in times of profound need. My name is Jason Graham. I'm the Chief Medical Examiner for the City of New York. In attendance with me from the OCME are Yvonne Williams, our Deputy Commissioner of Administration and Finance, and Nicholas Schultz, Chief Operating Officer and Deputy Commissioner of Forensic Operations and Investigations. And we look forward to providing an update on our budget and our activities today and answering your questions. Since we last met in these chambers 1 year ago, much has changed and much remains the same. One constant is the steadfast dedication of our employees to the OCME mission, to protect public health and serve impartial justice 24/7 by providing the highest quality forensic science and medicine. While not always easy, this singular focus is grounded and propelled by the core values of OCME Cares. I want to take a moment to tell you about these 5 guiding principles of our agency, which are so fundamental to everything we do. Adopted in spring of 2024, following a process of deep reflection and with input from across our agency, our core values inform how we relate to each other and to the stakeholders we serve. These core values are commitment, accountability, resilience, excellence, and service, which taken together, as you'll note, spell the word CARES. I'll tell you a little bit about each value now. Commitment. We're dedicated to the mission at all times. Accountability. We're responsible to each other and the community. Resilience. We adapt in the face of adversity. Excellence. We achieve and maintain the highest quality. And service. We innovate to meet evolving needs. CARES represents the essence of who we are and what we do at OCME. These core values are infused throughout our work and sustain us through the triumphs and the challenges that I'll discuss today. This month marks the 5th anniversary of the first recorded death from COVID-19 in New York City. While we remember all those we lost and honor all those who served in the response, we also recognize how the impacts of the pandemic continue to reverberate throughout our communities. Indeed, as I previously stated in these chambers, if not for the COVID-19 pandemic, the number of unintentional overdose deaths following in its wake would be the public health emergency of our times. OCME continues to cope with a 30% increase in caseloads compared to the immediate years before the pandemic, driven in large part by overdose fatalities stemming from the fentanyl crisis. This elevation is now our new normal, and the administration has acknowledged the urgency of our need in the FY26 budget. I'm pleased to report that OCME will receive $11.3 million, the bulk of which will support 83 positions to help us mitigate the impact of increased caseload volume across our agency. With this generous investment, the administration recognizes the importance of our work and the key role OCME plays in achieving the goals of Healthy NYC and its vision of longer and healthier lives for all New Yorkers. We're still in the early stages of allocating these resources with a focus on our forensic operations areas, including mortuary, transportation, and outreach, and we look forward to continuing to update you. As we adjust to our new equilibrium, OCME continues to grapple with the severe shortage of medical examiners. The highly trained forensic pathologists who are the namesake and in many ways the bedrock of our agency since its founding in 1918. This national problem was not created overnight, nor will it be solved in a matter of months. In fact, our situation grew more challenging over the past year as we continued to lose medical examiners, often due to relocations to other jurisdictions. Our staff of full-time forensic pathologists today stands at approximately 2/3 of where it stood this time last year, and permanently growing their ranks will require the cultivation of a new generation of doctors specializing in this noble work to meet the urgent national demand. In the meantime, we are adapting to support our medical examiners because resilience is a core value at OCME. We completed an operational realignment in September to optimize our staffing and resources across 2 forensic pathology centers in Manhattan and Brooklyn in the interest of upholding the highest quality of service for New Yorkers. As a part of this process, we've strengthened our engagement and bonds with the community, updating autopsy protocols to accommodate religious requirements and meeting with faith-based and community leaders. Concurrent with the successful realignment, we've begun implementing postmortem computed tomography, or CT scanning, into our operations. CT scanners help medical examiners with diagnosis and facilitate religious objections to autopsy, while also hoping in the future to increase the potential number of eligible tissue donations that can save lives. In mid-December, the administration reached a tentative 5-year contract agreement with the Doctors' Council Service Employees International Union, as Chair Schulman mentioned. That's to deliver wage increases and bonuses for our medical examiners, which will help us retain and recruit these highly skilled professionals who continue to be in demand by medical examiners' offices across the nation. Our renowned Forensic Pathology Fellowship Program remains among the leading training programs in the nation, attracting physicians who want to specialize while immersed in the most comprehensive resources of any medical examiner's office in the country. We continue to hire from the ranks of our graduates every year, and I'm pleased to report that for the academic year 2026-2027, we have a record number of highly qualified candidates, and we hope to match applicants for all 6 of our coveted fellowship seats, reaffirming the New York City OCME is the largest training program of its kind in the nation. To further bolster the ranks of medical examiners during this period, we're using locum tenens to add additional board-certified forensic pathologists for casework on a temporary basis. Locums provide a mechanism to employ highly qualified forensic medicine physicians to help fill gaps in coverage on a part-time basis. We also remain active in planning for the Science Park and Research Campus at Kips Bay, or SPARC Kips Bay, a project anticipated for completion in 2031. We're thrilled to be making strides toward moving our Manhattan forensic pathology operations from the current aging facility, which we've occupied for over half a century, into this first-of-its-kind health and science campus that integrates public health institutions, public education, and private industry. The addition of OCME's Forensic Pathology Center to the campus as a training institution and national leader in forensic science and medicine will enhance Spark's purpose to support public health and secure New York City's place as a leader in life sciences innovation for years to come. Beyond forensic pathology, OCME is home to world-class, fully accredited laboratories that support our mission at the intersection of public health and justice. Staffing levels at our laboratories remain strong thanks to prior investments in personnel and equipment, allowing our hundreds of dedicated forensic scientists to stay accountable to the public for timely and accurate testing results. Despite the sustained increase in caseloads, our laboratories continue to perform at a consistently high level and set the standard in innovation. Our Department of Forensic Biology operates the largest public DNA crime laboratory in North America, analyzing evidence submitted from cases across the 5 boroughs. The impartial findings of the laboratory help to convict the guilty and exonerate the innocent. Over the past year, the lab received more than 10,000 cases, onboarded and trained new analysts, and pursued cold case and post-conviction work, all the while remaining responsive to urgent requests from the criminal justice system, such as our expedited efforts to analyze evidence from the scene of the fatal shooting of a CEO in Midtown this past December. More than half the cases handled by our DNA laboratory involve gun violence. Our first-in-the-nation DNA gun crimes unit, formed in 2022, has consistently reached its goal of a 30-day turnaround time for testing evidence in gun crime cases, the fastest of any major jurisdiction in the country. Accelerated testing of gun crime evidence helps to process cases more rapidly in the criminal justice system and informs work to address the urgent public health issue of gun violence affecting our communities. The lab maintained this strong performance while undertaking the largest quality control review in its history, launched when our robust internal systems detected limited instances of cross-contamination in examined evidence in late summer of last year. As our comprehensive review winds down, I can report that the retrospective evaluation has found no deleterious impact on the outcome of cases in the criminal justice system, and will continue to keep stakeholders updated because accountability is a core value at the OCME. Our forensic toxicology laboratory is the oldest of its kind in the nation. The lab advanced its legacy of excellence in the last year, bolstered by investments from the administration in the fight against the overdose crisis. An infusion of staff and new equipment from the opioid settlement funds allowed the lab to perform more sensitive testing with an accelerated turnaround time, reducing the time it takes to deliver testing results in fatal drug overdose cases by nearly 50% to 40 days. The efforts of the Forensic Toxicology Laboratory to provide timely and accurate data for the public health and justice systems contributed to the first slight reduction in the number of overdose deaths our city has seen in 4 years, as reported by the administration in the fall. While we still have a long way to go and too many families are still being affected, we're making progress in this battle. And OCME is marshaling our resources of forensic science and medicine to make a difference for New Yorkers. The sensitive nature of our work provides OCME with unique access to populations experiencing the most challenging events of their lives. This special relationship, built on trust, gives us an opportunity to play a more expanded role for families, with the aim of saving the lives of those still at risk after tragedy occurs. Our embrace of this role exemplifies our core value of service, how OCME innovates to meet the evolving needs of communities. Our growing work to help the loved ones of those lost to overdose illustrates this innovation. The Drug Intelligence and Intervention Group, or DIG, works with surviving loved ones in close contacts following an overdose death. DIG evolved from our years of work on the front lines of the overdose crisis, where our data over time showed that those who experience the death of a loved one from overdose often struggle with unmet needs of their own, from grief counseling to accessing social services and assistance with substance use. DIG expanded in 2022 to help this population make connections, and to date, more than 2,500 close contacts of those who died from overdose have been reached. Nearly 3/4 of those reached have accepted direct services and referrals to potentially life-saving interventions. Our DIG program is staffed by social workers, epidemiologists, and program specialists, pioneering an inspiring model for how OCME can help populations affected by other public health challenges. While embracing innovation in the service of communities, OCME also stays grounded in our fundamental duty to provide answers for families no matter how long it takes. This is why we exist as an agency. Our core value of commitment keeps us dedicated to the mission at all times, no matter the obstacles. Recent developments in our work to identify the coldest cases attest to this dedication. For more than a decade, our annual New York City Missing Persons Day event has made the most advanced forensic science and support services available in person and free of cost to families seeking help to find long-term missing loved ones, making dozens of identifications in the process. In addition to hosting the event in Manhattan with partners including NYPD this past June, we brought New York City Missing Persons Day to the Bronx for the first time ever in December. The two events connected more than 24 families with confidential support and expert resources, bridging a gap for those still seeking closure. We invite anyone in need of assistance with a long-term missing loved one to contact our office at any time, and we look forward to bringing this special event to more locations throughout the city. Our missing persons work of today extends from our experience with the World Trade Center disaster of 2001, an effort that pushed the frontiers of DNA science and continues to this day. This is our solemn pledge to the families of the 2,753 victims who died in the attacks. This promise was depicted in a special segment of CBS News 60 Minutes by the same name that aired in November, and I want to thank the families who shared their stories in the interest of helping those who are still searching for answers. OCME never gives up, and that's why we recently invited family members of World Trade Center victims who may never have submitted DNA reference samples to get in touch with our office. The remains of 1,103 victims of the World Trade Center disaster have yet to be identified, and we're still working to match them to their names. By renewing our call for reference samples, we aim to solve these cases that have been open for nearly 25 years, reaching new generations of family members undeterred and undaunted by the passage of time, because OCME cares. I'd like to conclude with a thoughtful anecdote shared by an out-of-state family member recently assisted by our office. Despite coping with the sudden loss of a loved one and the complicated logistics of making final arrangements, this family member took the time to write and share positive feedback on the outstanding service provided by a member of our identification unit. OCME's dedicated public servant worked with the family every step of the way to ensure they received a copy of their loved one's death certificate the very day it was issued, including recommendations on how to obtain this crucial document in person and following up by phone the next day to make sure the family had everything they needed. As the family member wrote, New Yorkers get a reputation for cold and gruff treatment of others, especially from the viewpoint of a Southerner like me. I cannot, however, imagine I'd ever find better treatment here in my own city. Thank you for this opportunity to testify today, and we look forward to your questions.
Okay. Thank you. And then at this point, if you could please raise your right hands. In accordance with the rules of the council, I will administer the affirmation to the witnesses from OCME. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council members' questions?
I do.
Okay. Thank you. You proceed.
Thank you. So in the preliminary plan, OCME's federal funding decreased by $23.2 million in fiscal 2026 compared to the fiscal 2025 adopted budget, down to zero. While OCME has received federal funding for COVID-19 services in the past, prior to the sunsetting of COVID-19 dollars, OCME has also received additional federal grants for services such as opioid abuse and forensic research. Does OCME anticipate receiving additional federal grants for fiscal 2026?
The vast majority of our budget at OCME is city tax levy, over 99%, and our current federal grants are not affected by any federal cuts. We are, at this point, have had no solid communication as to or any unambiguous communication from the federal government as to what, if any, effects to grants we will incur going forward. We're going to work closely with OMB once we have additional guidance. But our grants at the moment have been unaffected, and we, for FY25, have federal grants of $7.1 million.
Okay, is there any chance that those will go away, or?
At the moment, we would have to wait for additional guidance. We have no reason to believe that at this point. They've been unaffected so far.
Okay, has, OCME has had difficulty in the past, as you've acknowledged, Dr. Graham, with hiring forensic pathologists to perform autopsies, which resulted in a backlog. What is the current amount of forensic pathologists at OCME?
We currently have 24 medical examiners on staff at OCME.
What is the vacancy rate at this position right now?
If we are fully staffed, we have 39 medical examiners. We have 24 at the moment, and there are presently 18 vacancies.
What steps are you taking to retain employees in this position and to recruit new ones?
Well, I'm pleased to echo the settlement that you alluded to that occurred in the fall of last year between the Doctors' Council and the city. I think this was a measure that provided wage increases and bonuses for our medical examiners that make us far more competitive and will increase our ability to recruit and retain not only trainees but also senior staff medical examiners. And in addition to the pay increases, we have implemented various mechanisms internally at the OCME to better support our medical examiners in doing their work every day. An operational realignment that provides additional staffing efficiencies that allow them to more directly focus on their work as physicians. Also, the incorporation of support in the form of locum attendants pathologists who are going to be able to relieve some of that staffing burden. In the process of continuing to train a significant number of new medical examiners in our forensic pathology training program, which has been the pipeline of medical examiners for the city historically. And so we're anticipating a continued number of trainees that will hopefully be able to be retained on senior staff after their training period. And so we are incorporating a multi-pronged approach at this staffing situation that has been challenging, to say the least.
Okay, the preliminary plan added $3.9 million in fiscal 2025 and $11.3 million in fiscal 2026 for the hiring of 83 people at OCME. How many of these people are forensic pathologists?
The 83 head count that will be added to our office is across a range of departments, focusing on forensic operations, frontline areas of our operation ranging from investigations to mortuary to outreach. And we have positions for forensic pathologists, and the issue is less for us the ability to hire than the number of forensic pathologists available to hire. So we're in the process of recruiting and hopefully retaining our trainees. But the focus of the 83 head count that's coming to the agency will be directed primarily at forensic operational areas.
Okay, great. Why was suspected overdose autopsies specifically chosen to be paused?
So we continue to do autopsies every day, 7 days a week, and that includes autopsies that may involve overdoses. In the midst of the record caseload, in the face of staffing concerns, we evaluated our data and were able to, based on our experience over the course of many years dealing with the opioid crisis and the experience of performing autopsies on the part of our doctors over these years, we were able to be flexible and change our guidance about certain types of cases that gave our doctors greater flexibility to use their medical judgment about whether or not an autopsy is performed or not. And we've, in addition to adding that flexibility, I would say that we have two basic medical procedures that we perform in our office, either an autopsy, which is an invasive procedure, versus an external physical examination of a person by our physicians. And in both instances, those examinations are done in the context of a complete death investigation, a scene investigation if it occurs in the field, in addition to comprehensive toxicology testing. So we perform comprehensive toxicology testing to determine if there's a drug that may be involved in someone's death. And we've also incorporated new postmortem imaging, our CT scanning capability, which gives our doctors more diagnostic information than they've had before, that they put to use in making those judgments about which cases need an autopsy and which do not. So we've not stopped performing autopsies at all. We continue to perform autopsies every day. We've added a level of flexibility that increases the judgment of our doctors in terms of what's medically necessary, as a doctor in the hospital would decide what procedures may or may not be needed.
On average, how many suspected overdose cases does OCME receive annually?
Well, as has been reported by the health department, we were pleased to be able to see that there's been a slight reduction in the number of confirmed overdose, unintentional overdose deaths in the city, but for the past, for the previous couple of years, we've seen over 3,000 overdose deaths in the city. And our death certificates, the information about which drugs are involved in those deaths become very important to local and national vital statistics, and our death certificates serve to inform those that data.
How many forensic pathologists would need to be employed at OCME for the suspected overdose autopsy pause to be lifted, or is that still sort of, you go to people, see what's needed, what's not needed?
Yeah, I believe that we are, as medicine changes based on data and evidence-driven changes in our practice, I think that these changes that we have made and our guidance will persist. We have an adequate number of doctors at the moment to be able to perform what's necessary in order to accurately determine the cause and manner of death. We are intending to continue to hire medical examiners, but these changes in our practice have in no way altered our ability to accurately determine cause and manner of death and provide answers to families, to the criminal justice system and public health systems.
I know each case is very different, but how long does an average autopsy take to do? I know there's toxicology involved in some aspects as well, so.
That's correct. And to be clear, the autopsy procedure itself is an examination of someone that takes place within 24 hours of our receiving the body, and we perform the examination and the body is able to be released. That there is no delay for families with respect to the release of their loved one to a funeral home for a final disposition. So the autopsy procedure itself takes place very rapidly. The report of autopsy may take additional time depending on what's involved. If toxicology testing is required for us to determine ultimately the cause of death, that takes a bit of time. But I'm also equally pleased to report our toxicology turnaround times have dramatically improved since last testifying in this chamber, and to nearly 50% improvement in that turnaround time. And that also is reflected in the autopsy reports that depend on those toxicology reports to be able to be completed. And so we've had also a significant improvement in our autopsy report turnaround time, which has improved to 30%, roughly. And so it's variable depending on the nature of the individual case.
Right, but just give me a ballpark, like average.
Well, now our toxicology turnaround times have decreased to around 40 days. We ultimately want to have autopsy reports soon follow that in turnaround time.
And the actual autopsy itself, forgetting about the toxicology, takes about what?
Once the doctor gets the toxicology results, they have to place those results in the context of the case and then finalize the autopsy report. So we ultimately want a turnaround time for autopsy reports in drug overdose deaths to be within 45 days.
Okay.
The target turnaround time is 90 days for autopsy reports overall.
Okay.
And so we're in a much better position in that regard.
Good. On September 6th, the council was notified of the contamination of 8 forensic biology cases on July 31st, which were immediately investigated. A root cause analysis report was published on November 4th detailing what had happened, how OCME addressed the situation, and next steps to prevent contamination. Can you provide an overview of what happened that resulted in the contaminated cases? Is that done now, that investigation, or it's still?
It's, the root cause analysis committee report has been issued. The investigation is ongoing now at on a smaller scale versus the initial steps that were taken. And so this involved a limited number of case-to-case contamination events between cases involving evidence that was being examined in our lab. We, through our own internal robust quality assurance measures, identified this in the late part of the summer of last year. We immediately moved to form a root cause analysis committee and do a comprehensive investigation of these cases and do a complete evaluation of cases occurring from March through early part of August of last year, and that encompassed more than 20,000 samples, over 5,700 cases. And this is a limited set of events, limited to 9 individual criminalists on our staff. And the cases that are involved had no impact at all whatsoever with respect to their involvement in the criminal justice system. So there were no impacts, no deleterious impacts to the cases in the court system. And this is now reaching its final stages in terms of the investigation, which we will keep you updated about. We have placed we have implemented the recommendations of the root cause analysis committee in our lab to help ensure that this doesn't occur again going forward, and have a very robust QC monitoring program to that end.
No, I appreciate that, and you'll, when it's totally completed, you'll circle back with us?
Certainly.
Thank you. In the preliminary plan, OCME received $1.3 million in fiscal 2025 and $1.8 million starting in fiscal 2026 for collective bargaining under the Doctors' Council Union. DOHMH had also received $2.1 million in fiscal 2025 and $2.3 million starting in fiscal 2026 for Doctors' Council. What is OCME's role with the Doctors' Council?
So all of our physicians, all of the forensic pathologists who serve as city medical examiners are members of the Doctors' Council. They're represented by the Doctors' Council, which is within the Service Employees International Union. And so that settlement affected essentially all of our medical staff. And the new contract is effective going back from June of 2021 through December of 2026. And again, as I mentioned before, I'm very hopeful that some of the staffing constraints that we've had will be improved going forward by our ability to recruit and retain based on better salaries and bonus structures for our doctors.
Great. Before you know, you're going to have to start negotiating again.
Very soon, it feels, yes.
OCME's cars are currently ineligible to be designated, we've had this conversation, as emergency vehicles with alarms attached to reach their destination quickly. This has resulted in delays with both OCME's ability to reach the decedent and their ability to return to their headquarters. What criteria would OCME cars need to meet to be eligible to be designated as emergency vehicles?
Well, we're certainly a response agency. When EMS, Fire Department, NYPD respond and there is a death involved in the field, OCME is also a responder. And there are, according to the New York State vehicle and traffic laws, there are designated emergency response vehicles. At the moment, the medical examiner vehicles do not have such designation. And so we're working with the administration, and we certainly appreciate the support of the council and your support, Chair Schulman, in this regard in terms of our attempt to amend the New York State vehicle and traffic law to recognize medical examiner vehicles in this way. This will allow us to respond to scenes more quickly. We are a relatively small agency compared to those much larger response agencies, and yet we have responses that are required across all 5 boroughs. And the ability for us to respond more quickly will not only provide better service to the families, but it'll also provide the ability of those responding units on the part of EMS and NYPD to be back in service much more quickly. We also have a responsibility, I should say, in the event of a mass fatality incident. We're a lead agency with respect to dealing with mass fatality incidents in the city, and the ability to quickly respond is important. And so we're hopeful that we will be successful in that attempt to get.
What's the average response time? Do you,
It depends on what specific area you're looking at.
Okay.
Our MLI response times are 2 hours 2:42. So there are variabilities in our response times because it's a coordinated response.
Right.
Crime scene, for example, we're not called to respond to that scene until after a period of time has passed for crime scene to process the scene.
Right.
Other situations, we're dependent on the NYPD, for example, to report cases to us, and then our response occurs from that point forward. So it's variable depending on the type of case.
Okay, what would be your ideal response time from your perspective?
Well, I don't know necessarily that I have an ideal response time in mind. I think being that it is a coordinated response like that, it's difficult to say how long a crime scene may take to process, for example, and then.
Right, but if it's not a crime scene.
If it's not a crime scene, as soon as possible. I wouldn't have I think a specific target in mind, but I think that clearly we have, there are families at death scenes, there are other members of other response agencies, and the onus is on us to respond as quickly as possible.
So do you know what they do in other cities? What other city response times are like, or if are there other cities that do have, where they're treated as emergency vehicles, or just out of curiosity?
I don't know that I have figures off the top of my head.
Okay.
We could provide that in follow-up.
Okay.
And just to correct that, our current response times are for investigations in the field is 2 hours 25 minutes.
Okay, thank you. Healthy NYC is an initiative which is primarily led by DOHMH with the goal of increasing life expectancy rates in the city over the next 5 years. The program includes the investigation of mortality trends in the city to attempt to determine the reasons why the life expectancy rate has decreased in recent years. What role does OCME play with Healthy NYC?
Well, I think we have several important roles. I think one of the most important has to do with being a source of critically important data. Our death certificates provide data that inform all of our stakeholder partners on both the criminal justice and the public health side, including not just violent deaths, homicides, suicides, accidents, but also the number of sudden unexpected natural deaths that we investigate and that we determine the cause of death for. Providing disease and injury epidemiologic data on things, not only those violent deaths, but also heart disease, high blood pressure, diabetes, undiagnosed cancers. All of those are elements that, via our death certificates, inform policy and programmatic changes that will ladder up to the ultimate goal of Healthy NYC and the reduction the reduction of mortality and the extension of our life expectancy as a city. Aside from being a critical data source, another critical area that we have been very active with is outreach to families, particularly around drug overdose deaths. And our Drug Intelligence and Intervention Group engages social workers to actively perform outreach to family members who have lost someone to a drug overdose and connect them to care and services, including substance use support and healthcare services that may be potentially life-saving. And so I feel like that this is very direct primary care prevention work in addition to serving as a source of data. And another area that is, I think, very innovative in a way that we are, again, going beyond the traditional role of the medical examiner's office in active life-saving prevention work is around our molecular genetics laboratory. And we have a full-time genetic counselor who, when someone dies suddenly or unexpectedly due to a genetic cause, we have a genetic counselor that reaches out to that family who may be at risk of losing someone else to that same genetic or hereditary problem, and having a conversation with them and connecting them to care potentially that can be life-saving. And so I think in many facets the work of the OCME, and as I've said before, everything we do is for the living, and we take that very much to heart.
The Mayor's Management Report and preliminary Mayor's Management Report serve as a report card for the agencies and the services they provide. The PMMR indicated that 1,504 autopsies were performed in the first 4 months of fiscal 2025, while 2,156 were performed during the same period in fiscal 2024. The reduced rate of autopsies accounts for OCME's limited autopsies on decedents that were suspected to die from a drug overdose. What other factors resulted in a lower rate of autopsies performed?
Many of the factors that I mentioned previously with respect to our guidance to our doctors who now have the flexibility to make a medical judgment and determine which cases an autopsy is needed for and which may be an adequate investigation with an external physical examination of the body and toxicology testing. This is, again, in the presence of additional testing options such as postmortem CT scanning. So this is a judgment, a shift in the judgment based on our doctor's ability to ascertain which cases need an autopsy and which do not, without compromising our cause and manner of death determination.
Is there a backlog now of autopsies?
There's not an autopsy backlog in terms of the performance of autopsies. There is no delay in performing autopsies at either of our forensic pathology centers.
Okay, great. Let's see, went over this. The median time for scene arrivals by medical legal investigators was 2 hours and 25 minutes in the first 4 months of fiscal 2025, while it took 1 hour and 48 minutes during the same time period in fiscal 2024. In addition, the median time for fiscal 2024 as a whole was 2 hours and 13 minutes, which in fiscal 2023, it was 1 hour and 37 minutes. So I know you talked a little bit about this, but what factors resulted in OCME's longest scene arrival time?
This, aside from the factors I mentioned before, I think a couple of other reasons will factor in. One, the sustained increased case volume, the 30% increase in our volume. And internally, over the course of the past year, we've also had staffing adjustments within our investigations, forensic investigations division. 5 of our death investigators were moved into higher level supervisory managerial roles, which affected the number of individuals immediately responsive. We are now, with the infusion of this 83 new headcount, these new resources, we are fully anticipating that with investigations being one of the areas that will benefit, we're anticipating that this response time will improve considerably over the course of the next year.
Are there specific neighborhoods that take longer for an investigator to arrive? Or is that just, I mean, you sort of alluded to it a little bit.
Yeah, there are many factors aside from just the geography in the city. I think the time of day also has, clear implications with respect to traffic flow and our ability to, again, without emergency responder status, be able to respond in a timely way from, northern Bronx to Staten Island to Far Rockaways, and so it's a citywide set of variables.
No, I appreciate all this, and thank you for all the great work that you do. And so my last question for you is, and you may not answer it here, but the question is, what do you need from us, the council, in terms of resources, budgetary resources?
Well, I would certainly like the opportunity to follow up with you and provide an
Please.
answer to that, but I would also add that I think it is much appreciated, the support for our work to amend the New York State vehicle and traffic law to change the status of our vehicles. And so any support would be appreciated in that regard.
All right, no, I appreciate, Chair Lee? No? Councilmember Narcisse?
Thank you, chairs. Thank you so much, and thank you for being here. One of the questions I just asked, I just heard the chair say that, what can we do to help you? But it seems like you're doing very well. You don't need much help. The preliminary plan added $3.9 million in fiscal 2025 and $11.3 million in fiscal 2026 of the hiring of 83 people of OCME, right? How many of those people are forensic pathologists? And how many people were hired for different titles within their OCME?
Yes, this is a significant, obviously, infusion of resources into the agency. These 83 headcount will be directed toward our very frontline forensic operations areas, which would range from death investigations to city mortuary operations to our outreach to families. We have vacant positions in terms of our forensic pathologists. So as I alluded to before, it's not necessarily a matter of having lines for forensic pathologists for our medical examiners. We have adequate lines. It's a matter of being able to staff those lines with qualified doctors. Whereas the 83 headcount will go toward all of our forensic operational divisions and increase the support for those doctors that we do have.
Thank you. Have you hired anyone yet? Because your vacancy is still high.
This was yes, and that relates to the fact that this just came to our agency, and so we are, relatively speaking, very shortly ago, and so we are very actively working with OMB to recruit, interview, hire, and onboard these 83 staff across various operational agencies. So we're expecting significant progress in that regard moving into the summer.
I appreciate that. Have you had any high level of departures? Because we're talking about vacancies, and do you have you had any high level of departures other than the medical? You have some medical examiners who have left, right? Have you have a high level of departures?
Well, I think that very often, aside from the medical examiner staffing situation that we've already discussed, I think that there is always amongst our laboratories a continuous rate of turnover. Whether that differs significantly from previous years, I would have to get back with some statistical information for you.
Okay. So having said that, are you doing anything to retain the staffs?
Well, certainly with respect to the medical examiner, across many sectors of our operation, the contract negotiations, I think, were very critically important. That involving DC 37, for example, the Doctors' Council for our doctors, those were, I think, critically important in ensuring our ability to retain staff. And with respect to our doctors, some of the additional steps that we've taken, and as I said, a multi-pronged approach to not only keep the senior doctors that we have, train new doctors, but also better support the doctors that we have on staff by realignment in many ways in our forensic operations, so that they are able to have additional layers of support, and that includes the addition of the locum tenens pathologists who are going to be able to fill in some of the staffing gaps until we have an adequate amount of time to reconstitute fully our medical examiner staff, which I'm hoping will happen over the course of months.
The way I'm pushing so hard is because we have a gold standard lab, because we are the leading in that aspect. New York City's done outstanding job, and I want to say thank you for that. But what concerning me is the equity in getting those bodies as well. Some families that calling me, some bodies stay with them for hours. So there is a problem there. So I want to find out how we're gonna pick up those, how you plan, your plan been going. Do we have equity in picking up bodies throughout? Because I know in Brooklyn, we have a situation. So how are we doing with that?
I appreciate that question, and I feel that this is an area of concern of ours as well, and we are continuously working to improve our response times. However, some of the factors that I mentioned before also play a role in the situation that you described. We are, EMS responds to a death scene, NYPD responds to a death scene. It's often a coordinated response. If it is a crime scene or judged to be a potential crime scene, that requires a different response and at different times than would be a more routine case. When NYPD responds to death scenes, they contact our office, and then our office responds from that point forward. And so there are many factors that go into the overall response times, which I feel like we are working together to try and improve overall between EMS, NYPD, and the OCME.
We are here for you. Do you have a chief of lab now?
Our chief of labs position is currently vacant. We anticipate that that position will be filled. We're pleased that there are many qualified applicants who are in the process of interviewing for that position. We anticipate that position will be filled probably by mid-April or so.
So in the meanwhile, who's helping the process?
We have assistant directors who are in charge and who are running the day-to-day operation of that, the forensic biology laboratory. In forensic biology, we have laboratory directors for each of our other forensic science laboratories, which we have 5 total forensic science laboratories at the OCME. Each has a director. We are in the process of selecting a new chief of laboratories who will serve as the executive, overseeing all 5 of those laboratories.
While we're talking about pay equity, we need to address that too as well, because a lot of complaints that I got, because I'm, chair for hospital and I'm hearing it, so that's the reason I have those questions for you. We just celebrated the 5 years anniversary of COVID-19. Considering the nature of your work and what your employees see day to day, do you have any concern about the mental health of your employees? And if so, how are you addressing that? Because those are folks that are dealing with bodies day in and day out.
Thank you for that question. I think it's very important, and it is something that we have been attending to in a much more significant way over the course of the past several years. Vicarious trauma on the part of our staff who are day-to-day dealing with violent death, and our staff that managed the largest multi-fatality incident in modern history, who were dealing with enormous numbers of fatalities during the pandemic, including our laboratory staff who were redeployed to morgue operations, for example. So this is something that's absolutely on our minds. We, several years ago, developed a wellness program that focuses on vicarious trauma, overall health and wellness. That program has grown in many ways over the past several years, working with WorkWell, New York City. We've built a robust, I believe, wellness program that not only addresses mental health concerns, but physical health and wellness. And that has been an active part of our agency for some time now. And it's something that historically, I think generally in medicine, we could have been better at. But it's something that we fully recognize now and are working actively to mitigate any sort of deleterious effects of the very difficult and emotionally challenging work that we do every day.
Thank you. I appreciate you. DEI is under attack. So are you ensuring diversity within the workplace right now? Because I'm very concerned about that.
Yes, we have we have Chief Diversity Officer. We also have a belonging and inclusiveness group at our agency, which is focused on the making certain that we have an inclusive work environment, and that's I think very active group in our agency now that we're looking forward to future programming with.
Thank you. That's not my hearing, but I would say the chief of staff that you have, hopefully everybody put it together. And I think that's Mr. Schultz. That's Schultz, right? I hope I'm right. Okay, you're the COO, right? So how that going? Because that's a lot of stress over there because you don't have enough staff.
We're very fortunate, as the Chief Medical Examiner explained, that we are getting a new infusion of resources and doing very well. We have a lot of support from the administration and OMB and working very closely with them to staff up all of our positions.
So I'm hoping that you have experience in the forensic that you can help.
Yes.
You do?
Yes.
Oh, all right. So thank you, Chair. Thank you for your time.
Chair Lee would like to make some closing remarks.
No, yeah, I didn't have any questions, but just wanted to say thank you to Dr. Graham, your team at OCME, because I don't think folks understand and realize sometimes how much work you guys do behind the scenes and how critical your data is when it comes to public health trends, a lot of the mental health trends, the drug addiction trends. And so I just want to say thank you and shout out to your team who is sitting with us today for all the work you do.
Thank you very much. It's very kind.
I want to say the same, and I encourage my colleagues to go and visit the OCME. It's quite the experience, and there's a lot that you can learn, and there's a lot I learned, and I'll be taking my staff there too at some point. So we really do appreciate the work that you guys do. It's very behind the scenes, but it's very something that's extremely needed in the city and your premier medical examiner's office. So thank you very much.
Thank you so much, Chair Schulman. Really appreciate you and the council, and open invitation to anyone for a visit anytime.
I'll take you on that one.
All right.
Thank you.
Thank you. Thank you.
Okay. Yeah, let's do it. All right, I am now going to open the hearing for public testimony. I remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant-at-Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant-at-Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on today's topic of the fiscal 2026 preliminary budget for DOHMH and OCME. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant-at-Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. We have a lot of people who have asked to testify, and so I am going to keep people to 2 minutes. If you want, you can summarize your testimony and then submit it to us, and all the testimony will be gone through by the staff. Thank you. Here's Okay, first panel. Misha Sharp, Samantha Rappa, Gio Vagnoli, Denise Mises, and Megan Peterson. And Dr. Dre is also on this panel.
You have any copies to give out?
I think they already have them.
Yes, yes. Did you get your name? Also, you can. All right.
Thank you for your patience, everyone. We'll start in a few minutes.
Dr. Dre, do you want to go first?
You put me out. I was waiting for everybody else. I was
That's all
supposed to
right.
be here with Chris
We're just
Nolan
waiting for everybody to settle down.
and
so.
Kendra Hardy. Can they also join me, please? We were a panel.
So,
You let me know.
Dr. Dre, do you want to testify now, or do you want to wait for? Or do you want to wait?
Again, I'm at your disposal. Whenever you're ready.
All right, yeah, we're ready to hear you.
Oh, you ready for me now? I
Yes,
didn't know.
yes, yes, yes.
Okay, well, my name is Dr. Dre. Okay, my name is Dr. Dre. I am a blind amputee and a type 2 diabetic. I consider myself to be super bad because I don't let things keep me down. I actually go out and make things happen. So being blessed with working with the Healthy People Organization, Ms. Chris Norwood and Kendra O'Hardy, we need resources so that we can help educate people with diabetes, help educate people with amputations, help educate people with nutrition, help educate people, of course, with physical fitness. All these elements, we treat diabetes like it's a curse for people. Oh, you did it to yourself. It doesn't happen that way all the time. It's based on what, especially type 2 diabetics, what's around our regions, such as Staten Island, Brooklyn, Queens, Manhattan, uptown and downtown, and of course the alarming rates that are happening in the Bronx, which are out of control. And me being here as an advocate, and not only an advocate, but I am a food, and I am a food, you with me? I'm a food person that eats the wrong stuff, just like everybody else. Because you eat where you live, and you live where you eat. Everybody can't eat the best food or get, especially at these prices. Have you seen a price of eggs now? Woo! So that cuts the cake down, but we need to get the cream because cash rules everything around me. Dollar bill, but let's change that to more than $1. We need to get into the hundreds of dollars because this program and what we're advocating for, what we're actually doing is helping people. So honestly, by donating and giving us the resources, we actually help bring down the cost of medical issues. Because if people can't learn, people can't access it on their phone, people can't access it face-to-face with a gentleman like me being a food addict, then where are we going with this? We can turn it around. We will turn it around. That's why I'm here. Because I'm a lifelong resident of New York. All my life. And the blessing is, what's up, y'all? What you gonna say? Who's gonna give resources to help people and Dre? I thank you for your time.
Thank you for your time. Who's next? Yeah. Just state your name and.
Great. Thank you, Chair Schulman and committee members, for the opportunity to testify. My name is Misha Sharp, and I'm the Assistant Director of Policy for 32BJ Health Fund. We provide health benefits to over 200,000 32BJ SEIU union members and their families using contributions from over 5,000 employers. For many years, we have talked about the rising prices at New York City hospitals, which drive up the cost of health benefits and squeeze workers' wages. In 1 year, we pay more for care at 5 large academic medical centers than the entirety of our pension benefit. Over the last 2 years, we have worked with members of this committee to establish a fully resourced Office of Healthcare Accountability. On Friday, we received the office's first report on healthcare cost drivers and hospital prices. The report shows the same pattern we have seen elsewhere, that hospital prices are driving untenably high healthcare cost increases, and that in New York City, this is driven by several large academic medical centers with outsized market power. For example, from 2022 to 2024, the city's employee health plan spending increased 11% at NYU Langone and 20% at New York Presbyterian, where an average inpatient admission cost over $92,000. We can see where the problem lies, and we need to act with urgency to solve it. We urge the City Council to call the largest hospitals to the table to answer for these prices and their impact on working people. The City Council should also advocate for the publication of Medicare benchmarks for hospital prices paid by the city employee health plan. It is deeply concerning that the city, who pays billions a year on employee health benefits with taxpayer dollars, doesn't have or can't share how their prices compare to what Medicare pays as required under Local Law 78. Thank you for your time.
Thank you very much. And there's also I'm going to be introducing a resolution to support the New York State bill about costs reining in the costs of medical care that I'm working with you guys on, so.
Thank you, Chair Schulman.
Yes, so next,
Good afternoon. Good afternoon.
put on the
Hello.
much better.
Good afternoon, Chair Lee, to the distinguished members of the committee. I'm Denise Mieses, chairperson of Local 372. Sorry, SAPIS chairperson of Local 372 and current SAPIS. I'm a SAPIS now for 9.5 years with the Department of Education. I am here representing 236 SAPIS, Substance Abuse Prevention and Intervention Specialists, with a request that the City of New York fund the SAPIS program through a dollar-for-dollar match of $6 million with the state legislature. The SAPIS program has been around since 1971. From 1995 to 1999, I myself was a SAPIS kid. It is what kept me in school. I attribute it as a major factor to not only graduating high school, but graduating high school on time, right? What kept me going to my SAPIS counselor was a relationship she was able to build not just with me, but with my family. And now, as the universe would have it, I get to be that gap between my students and the resources that they need. Because we are the only people in the school that have these unique relationships with our students. Our students are not scared to come and talk to us. We have nothing to do with discipline. We don't scold them for cutting a class. We do the opposite, right? We don't want them to cut class. We don't want them to do drugs. And yes, that's a symptom, but our job, our responsibility is to kind of focus on the root of why that symptom is happening, right? And the SAPIS program gives us the opportunity to help them with that. We know that different kinds of stressors are interconnected. What happens at home, what happens in personal relationships, in romantic relationships, have a big factor in how or if our students are able to focus and concentrate in class, right? And so the programs, the social emotional learning programs that we offer them, give them the opportunity to learn life skills, to learn things like goal setting, right? To understand what it is to say no, it's okay. Refusal skills.
Summarize the rest of it, and then you can submit the testimony.
So to add insult to injury, the explosion of the illicit cannabis shops near city schools are ones that we struggle with day in and day out. I know for myself, there are 3 around my high school, and all of them know me, because I'm in there every morning trying to make sure that, our students aren't in there, and so that the owners and the people at the counter understand that I got my eye on you, and so does everybody else, right? So currently, there are 236 SAPIS servicing 912,000 public school students, and that's simply not enough. The money that we're asking to meet is to allow for the hiring of at least 25 new full-time SAPIS to not only be in schools, but on campuses, and different campuses house up to 5 different schools, right? Instead of splitting one SAPIS between 4 different campuses, we're asking that each school have their own so that we're able to provide them with the services that not only the students, but that their families are in need of.
Okay, thank you very much.
Thank you.
Next.
Hi, my name is Megan Peterson, and I am a research scientist in the Bureau of Hepatitis, HIV, and STIs at the Health Department. Today, I am here on behalf of DC 37, Local 3005, representing scientific and technical titles across the Health Department and Medical Examiner's Office. I am incredibly proud to work at the Health Department, where we have made progress ending the HIV epidemic and creating accessible treatment for all New Yorkers. However, recent Program to Eliminate the Gap, or PEG, budget cuts, OMB delays, and threats to federal funding have created an environment that makes it difficult to complete the innovative work for which we are known. For the past few years under this mayoral administration, I have heard constantly from our union members about disruptions because of funding. When a colleague leaves and we cannot hire a replacement due to PEG cuts, teams are restructured, interrupting work. Hiring new workers can take up to a year, as OMB will delay most actions unnecessarily, time that the most talented scientists who we should be hiring will not wait. As a result of this, hiring managers will instead often opt to contract out work to privatized, non-city line positions where workers can be hired more efficiently. This austerity has downstream effects. We cannot stay up to date on developments in our field because the public health library is closed. Members are routinely paid incorrectly because so few people work in the payroll office at this point. In my own bureau, we nearly ran out of condoms that we distribute to the community, something we can all agree we want people to use more of because of procurement issues with OMB. So recent federal budget cuts, privatization of mission-driven services, and censorship have been jarring, but these are only more recent developments in a slow gutting of public services that we have seen for years under the Adams administration. I ask you to robustly fund the health department and the medical examiner's office so that we can continue our work impacting public safety and health.
Thank you very much. Next.
Good afternoon. Good afternoon, and thank you, members of the committee and council, for your time and commitment to oversight on health and to the budget that this broad category affects.
Can you tell us your name first before you do that?
Yes, my name is Samantha Rapacevignoli.
Okay.
And I am the president and a proud member of District Council 37, Local 30005, Local 3005, New York City Department of Health and Mental Hygiene and Office of Chief Medical Examiner, technical professional employees. I will refer to them as DOHMH and OCME. I am here today to oppose any budget cuts to the two vital agencies and its workforce. I instead ask for support of allocation of funding to the budget and to increase the staffing and promotional lines in the New York City OCME and DOHMH. These agencies and its workforce provide vital public safe services, as well as education to the general public, health communities, and legal communities of New York City and other jurisdictions, inclusive of the New York City Police Department, New York City District Attorney's offices, and New York City and state health clinics, to name a few. The workforce contributes to their training, skills, knowledge, and expertise as representatives of Gold Star Laboratories to help build others around the world. District Council 37, Local 3005 represents criminalists, also known everywhere else in the world as forensic scientists, city research scientists, scientist water ecologists, scientist radiologists, engineers, architects, graphic artists, and administrative public health nurses, to name a few. I am a criminalist who began working for the New York City in OCME in 2004, and with me today are my fellow scientists, researchers, colleagues, and members of Local 3005, representative of the crucial work and cuts and scrutiny being performed at DOHMH, as you just heard. All Local 3005 members, many female and childbearing, last I checked, approximately 70%, and excluded from any benefit of the previous...
You need to summarize.
In
the
summary,
rest of it. Go ahead.
In summary, without even reading my testimony, you have it. In summary, this administration and your council supports STEM programs. Your council supports the KIPS program. Your council just heard how they need more medical examiners. The forensic scientists at OCME handle thousands of cases per year. They handle the homicides, sexual assaults. They're the behind-the-scene heroes, but the NYPD takes the credit for them. It's their work. It's their scientific testing. I am asking that you help fill the 80 vacancies that currently have, and also to help support those who are graduating this year in those STEM programs that you help support, and to fund them with 100 more positions, and to stop the cuts at DOHMH. And with that, thank you.
Thank you very much. Next, I want to thank this panel very much for taking the time to come here and testify. And if we don't have your testimony, we have the... Okay, we have everybody's testimony.
Yes.
If not, you can submit it. You have up to 72 hours, but if we have everybody's,
And may I just, Mayor Adams did not create that program. That gun program has been there since I was a criminalist. It was called the Property Crimes Unit, and I have a certificate that I plan on submitting to demonstrate it.
Okay,
So help
thank
fund
you.
them.
Thank you very much. Okay, next panel, Marianne Mohammed Miller, Kellen Dewar, Gabriella De Leon, Bella McAllister, Stephanie Kanan. Everybody settled in? I just want to remind everybody, please, we have a lot of people who want to testify today, so please keep it to 2 minutes. If you want to summarize, fine. We're going to, the committee staff goes through every single piece of testimony that's submitted. So go ahead. You go first. Tell us who you are, and then go ahead.
Good afternoon. My name is Gabriela De Leon, and I'm a volunteer with Planned Parenthood of Greater New York. I want to thank the chair of the Health Committee, Councilmember Lynn Schulman, and all the committee members for the chance to discuss how PPGNY's programs and services have benefited me and New Yorkers throughout the city. For over 100 years, PPGNY has been a trusted provider of sexual and reproductive health care and education programs for communities throughout New York City. Today, I'm here to urge the council to support critical investments in PPGNY to ensure they can continue to provide the care over 70,000 New Yorkers depend on. Planned Parenthood is important to me because as a student at Hofstra University, I've witnessed the positive impact it has had on the Long Island community. The organization connects with vulnerable populations by providing essential healthcare services at community events, health fairs, and other outreach initiatives. Through these ongoing efforts, Planned Parenthood has built trust within the community, ensuring that people have access to the care they need, especially those who may not have other options. As an aspiring OBGYN, I am passionate about creating a future where equitable healthcare is accessible for everyone. Planned Parenthood plays a vital role in making that future a reality. This year, PPGNY is asking for an increase in funding to support its programs and allow it to continue to provide healthcare to any New Yorker who may need it. You may know that PPGNY has been forced to make several painful decisions in the last year to ensure they can provide the care New Yorkers rely on. I strongly urge you to support PPGNY's ask for $1,250,000 from the Reproductive and Sexual Health Initiative, as well as $1,250,000 from the speakers list on top of current funding to allow PPGNY to continue to provide healthcare services and educational programs throughout New York City. Increased funding will help improve an annual budget deficit that threatens access to care for over 7,500 New Yorkers. Support from the council now is more critical than ever. Continued attacks from the federal government have made communities fearful that they will lose access to the resources they depend on. Thank you.
Thank you. Next.
Hello. Good afternoon. My name is Kellen Dorr, and I'm a volunteer at Planned Parenthood of Greater New York. I want to thank the chair of the Health Committee, Councilmember Lynn Schulman, and the committee members for the chance to discuss how PPGNY programs and services have benefited me and many New Yorkers throughout the city. I'm here today to urge the council to support critical investments in PPGNY to ensure they can continue to provide the care over 70,000 New Yorkers depend on. Planned Parenthood has profoundly impacted my life in ways I will always be grateful for. When I faced financial difficulties and didn't know what birth control options were available to me, they provided in-care and support I desperately needed. From the moment I walked in, I was met with kindness and understanding, never judged for my circumstances. The staff, from the nurses to the practitioners, not only demonstrated exceptional medical expertise, but also showed deep emotional empathy, making me feel truly supported. I've witnessed firsthand the powerful impacts of their work. I've seen patients, tears in their eyes, express heartfelt gratitude to the brave escorts standing outside the doors of Planned Parenthood on Bleecker and Court Street. I've been one of those patients, scared and alone with people trying to tell me what to do with my body. But inside those doors, I've always felt heard, respected, and safe. Planned Parenthood has been and continues to be sanctuary for so many. I strongly urge you to support PPGNY's ask for $1,250,000 from the Reproductive and Sexual Health Initiative, as well as $1,250,000 from the speakers list on top of the current funding to allow PPGNY to continue to provide healthcare services and educational programs throughout New York City. Increased funding will help improve an annual budget deficit that threatens access to care for over 7,500 New Yorkers. We must ensure reproductive freedom for New Yorkers now, before it's too late. Thank you to the Health Committee and the New York City Council for listening to me today to understand how critical this funding is to ensuring care for all New Yorkers.
Thank you so much. No clapping. You can go like this to show the support, but no clapping. Go ahead, Mary Ann.
Good afternoon. My name is Miriam Mohammed Miller, and I'm the Director of Government Relations and Policy at Planned Parenthood of Greater New York, and PPGNY for short. I would like to thank the chairs of the committees on health and mental health, disabilities, and addiction, council members Lee and Shulman, for the opportunity to discuss Planned Parenthood of Greater New York's programs and services. As you've already heard from my colleagues, we serve thousands of New Yorkers each year through our clinical services and over 20,000 individuals through our education and community engagement programs. We offer a full range of reproductive health care services, everything including gynecological care, STI testing and treatment, contraceptive care, and care for the LGBTQ+ community at our 4 health centers. We're thankful for the council for the continuous support you've showed our organization over the years, but with the ever-changing landscape on reproductive health care and continued restrictions on care throughout the country, New York has been seen as a haven for critical resources that many depend on. Unfortunately, longstanding underinvestment in reproductive health care, combined with the soaring cost of care, workforce shortages, and restrictions imposed since the decision to overturn Roe, have impacted New York. To make matters worse, we expect the Trump-Vance administration to continue to gut critical public health programs. That is why today we are asking for increases to initiatives that fund Planned Parenthood of Greater New York and critical services throughout the city. We are asking for an increase to the Reproductive and Sexual Health Initiative and ask from the speakers list to support our programs and services. Failure to provide funding to PPGNY could potentially impact over 7,000 New Yorkers. We're also asking for funding increases for our patient navigation program that supports New Yorkers and those forced to travel to our city for abortion care. We are thankful for the council for establishing the first patient navigation program in the country, and hope to have this work continued and have PPGNY continued to be funded through this initiative. To summarize, again, we are greatly thankful for the council's support for our work, hope to receive continued funding to help bolster our operational funding so that we can provide care to the New Yorkers that depend on us. Thank you.
Thank you. Next. There you go.
Good
Disappointing
afternoon.
you, just in case you couldn't see.
Thank you.
Go ahead.
My name is Bella McAllister, and I am a volunteer at Planned Parenthood of Greater New York. Planned Parenthood has been at the forefront of my reproductive health care. Healthcare that is accessible, affordable, and comprehensive is critical, and it is for those reasons that I have relied and respected the services that Planned Parenthood provides. Planned Parenthood's educational resources have made informed decision-making so straightforward, and I have interacted with providers who have affirmed my choices without hesitation. Planned Parenthood has been essential for me, and without its services, I would not have received the care I needed when I was at my most vulnerable. I strongly urge you to support PPGYN's ask for $1,255,000, sorry, I have trouble with numbers, from Reproductive and Sexual Health Initiative, as well as $1,255,000 from the speakers list on top of the current funding to allow PPGYN to continue to provide healthcare services and educational programs throughout New York City. Increased funding will help improve the annual budget deficit that threatens access to care for over 700,000 New Yorkers. Support from the council will help PPGYN continue providing healthcare like trans and non-binary gender-affirming care, mobile healthcare services with Project Street Beat, options for out-of-state patients, and access to healthcare for low-income individuals. Sorry. We must ensure reproductive freedom for all New Yorkers now before it is too late. The New York City Council has always shown up as a champion for healthcare access, and I urge you all to continue to do so. Thank you to the Health Committee and to the New York City Council for listening to me today to understand how critical this funding is to ensuring care for all.
Thank you. Next.
Good afternoon. My name is Stephanie Stupak-Cannon. I'm a volunteer at Planned Parenthood of Greater New York. I want to thank the chair of the Health Committee, Councilmember Lynn Shulman, and the committee members for the chance to discuss how PPGNY's programs and services have benefited me and many New Yorkers throughout the city. For over 100 years, PPGNY has been a trusted provider of sexual and reproductive health care and education programs for communities throughout New York. Today, I'm here to urge the council to support critical investments in PPGNY to ensure they can continue to provide the care for over 70,000 New Yorkers. I was raised by a single mom who couldn't afford health care. So at 17, it was Planned Parenthood who gave me my first OBGYN exam, birth control, and the education to help me enter adulthood safely. As I grew older, they've been a lifeline for accessing vital health care in my scariest moments. While many people now know about PrEP, a daily pill which can help prevent HIV, Planned Parenthood of Greater New York was there for me when I needed to start PEP, post-exposure prophylaxis, within 72 hours to reduce the risk of contracting HIV after a partner's condom broke. Their compassionate and prompt care not only made me feel safe in a dire time, but also allowed me to sit before you HIV-free today. This year, PPGNY is asking for an increase in funding to support its programs and allow it to continue to provide health care to any New Yorker who might need it. You may know that PPGNY has been forced to make several painful decisions in the last year to ensure they can provide the care to New Yorkers that they rely on. Long-standing underinvestment in reproductive health care combined with soaring healthcare costs and workforce shortages have contributed to the intense financial difficulties that PPGNY has been experiencing. Every year, PPGNY loses tens of millions of dollars because of gaps between reimbursement rates and the cost of care. I strongly urge you to support PPGNY's ask for $1,250,000 from the Reproductive and Sexual Health Initiative, as well as $1,250,000 from the speakers list on top of current funding to allow PPGNY to continue to provide healthcare services and educational programs.
Thank you. Marianne, I have a question for you. So with the closing of Bleecker Street, which I was very sad to see, where are people being sent?
Thank you for the question. We are and the health center is still currently operating. We don't have a timeline as to when it will be closed.
Operating at Bleecker Street?
Yes.
Okay.
We don't have a timeline for when it will be closed, but when that does happen, we will be directing patients to the closest health center, which will be in the Bronx, Queens, and Brooklyn.
The employees also, what's happening with them?
They will also be directed to their closest health center. So there are no plans to reduce force with the closure of Bleecker.
Hold on one second. Yeah, what about I wanted to ask you about potential cuts to Title X, and how would that impact services?
Sure. We received Title X program funding to support our reproductive health care services as well as our education programs. The last iteration of the Trump administration, we were forced to leave the program, and thankfully the state and the city council have stepped in to support those gaps. If we are forced to leave the program, we will see a decrease in funding, potentially a decrease in services and education programs we offer throughout the city.
So if we were to give you the funds that you requested, what would they go for specifically?
To our healthcare operations, to bolster the operations that we're currently providing. As folks mentioned here, potentially 7,000 New Yorkers could lose access to care because of shrinkage in services that we offer. So it'll help sustain our current operations.
Is there any help from the state?
We've received funding from the state. We have made ask for funding through the FY26 budget. We're waiting for hopefully April 1st to see what is finalized in that budget.
Okay, whatever we can help with. I mean, we're big fans here of Planned Parenthood of Greater New York, so we'll do what we can and just, keep in touch with the council about how we can be helpful moving forward. Okay?
Yes.
Thank you
We
very much.
appreciate the
I want to
council's
thank this
support.
panel. Have another Planned Parenthood panel. Yay. Gabriella Aguila. If I screw up the name, my apologies. Jane Kaufman. Jessica Bathurst, sorry. Gillian Dean. Everybody here? Okay. Go.
Okay, good afternoon. My name is Dr. Gabriela Aguilar, and I'm the medical director at Planned Parenthood of Greater New York. I would like to thank the chairs of the committees on health and mental health, disabilities and addiction, Council Members Schulman and Lee, and the committee members for the chance to discuss PPGNY's program and services and the need for critical investments. It's no exaggeration to say that the abortion care ecosystem in New York is in a crisis. Systemic failures in the U.S. healthcare system have yielded unprecedented challenges that are forcing many healthcare providers, including PPGNY, to take serious and immediate cost savings measures and pursue long-term structural shifts. For example, we were forced to pause deep sedation services, abortion past 20 weeks of pregnancy, close our Staten Island Health Center, and recently announced plans to sell our Manhattan Health Center in an effort to sustain our operations. We recognize that New York State has achieved many incredible wins to protect sexual and reproductive health care access. We applaud our leaders for their efforts. And now, New York must step up its ability to meet the demands of the present day. True abortion access means fully funding the organizations and providers delivering life-saving health care. We need the New York City Council to prioritize sexual and reproductive health care services more than they ever have before. As a healthcare provider, I feel the effects of the strain on reproductive care in our city on a daily basis. We must continue to fight for our communities, ensuring that abortion is not only protected in New York, but actually accessible for all, regardless of ability to pay. This year, PPGNY is asking for an increase in funding to support its programs and allow it to continue to provide health care to any New Yorker who may need it. You may know that PPGNY has been forced to make several painful decisions in the last year to ensure they can provide the care on which New Yorkers rely to pursue their dreams and live their fullest lives. Long-standing underinvestment in reproductive health care, combined with soaring healthcare costs and COVID, have contributed to the intense financial difficulties PPGNY is experiencing. Every year, PPGNY loses over $30 million because of massive gaps between reimbursement rates and the rising costs of care delivery. Like everyone else has said, I strongly urge you to support PPGNY's ask for $1.25 million from the Reproductive and Sexual Health Initiative, as well as $1.25 million from the speakers list, on top of current funding to allow PPGNY to continue to provide healthcare services and educational programs. Thank you.
Thank you. Next.
Good afternoon. My name is Dr. Jillian Dean. I'm the Chief Medical Officer and a physician at Planned Parenthood of Greater New York. I want to thank you for the chance to discuss PPGNY's programs and services and the need for critical investments. For over 100 years, PPGNY has been a trusted provider of sexual and reproductive health care and education programs for communities throughout New York City. Today, I am here to urge the Council to support critical investments in PPGNY to ensure that we can continue to provide the care that over 70,000 New Yorkers depend on. As a healthcare provider at PPGNY, I see and feel the effects of the strain on reproductive care in our city daily. Every day, we provide reproductive health care services that patients and communities rely on, including critical preventive care services like birth control services, wellness exams, tests and treatment for sexually transmitted infections, breast and cervical cancer screening, gender-affirming care, and critically abortion care. Unfortunately, longstanding underinvestment in reproductive health care, combined with soaring costs, workforce shortages, the havoc of the COVID pandemic, and care restrictions imposed in the wake of the Dobbs decision, are limiting access to care even here in New York City. Making matters worse, we know that the incoming administration will bring new attacks on our funding and service delivery, such as threats to Title X that you mentioned earlier. Amidst this very challenging backdrop, and despite the rising costs of providing sexual and reproductive health care, funding, including New York State Medicaid and private insurance reimbursement rates, has remained largely stagnant for a decade. The ever-widening gap between reimbursement and expenses threatens the sustainability of our services and puts abortion access at risk. What does this all mean? The care New Yorkers deserve and have come to rely on from PPGNY over many years is in real danger. PPGNY has been forced to make several very difficult financial decisions, and we need your help. I strongly urge you to support our ask for $1,250,000 from the Reproductive and Sexual Health Initiative, as well as the same number from the speakers list, on top of the current funding, to allow us to continue to provide healthcare services and educational programs throughout New York City. Support from the council will help PPGNY continue providing health care, including gender-affirming care to trans and non-binary patients, and access to health care for low-income New Yorkers.
You have to we need you to summarize.
It will allow New York City to remain the beacon of abortion access that we hope to always be.
Thank you, Doctor.
Thank you.
Appreciate it. Go ahead, next.
Hello?
Yes, we can hear you.
Hi, my name is Dr. Jane Kaufman, and I am the Director of Clinical Education and Special Services at Planned Parenthood of Greater New York and a provider. I want to thank Council Members Schulman and Lee and all the other Council members here today. I also urge you to support the additional investments of $1.25 million from each of these funds for Planned Parenthood of Greater New York. I know that many of you are familiar with our abortion care, but I wanted to tell a little story to highlight one of our other services, cervical cancer screening and prevention. So a patient we have seen this month at our centers had an abnormal pap smear a few years ago. She did not follow up because she was scared and was a student with no income and no health insurance. She mustered up the courage to see us a few weeks ago, repeated the pap smear and the HPV test, and they were still abnormal. The patient then returned to have a colposcopy procedure with us and underwent some cervical biopsies to determine the extent and degree of the abnormal cells. If these patients' cervical biopsies show a high-grade abnormality, we can do a LEAP procedure at one of our centers for this patient and remove the precancerous area on her cervix, which would prevent her from getting cervical cancer and likely save her life. We can provide this care in a warm, welcoming environment where our patient feels safe. Best of all, we can provide this care for our uninsured patient with a sliding scale fee schedule. This patient will pay nothing or very little for her care. We need funding to provide low-cost care for patients who need it most. Even for patients with Medicaid, the majority of our patients at PPGNY, we are not reimbursed anywhere close to the amount it costs us to provide this care. When low-income patients get the care they need, they have fewer unintended pregnancies, lower maternal and infant mortality rates, improved mental health, and better overall health outcomes. This allows them to pursue educational and employment opportunities, to better parent their children, and become more involved in their communities. This improves not just their lives, but the lives of all New Yorkers and helps our city thrive. An additional investment in PPGNY is one that has an immeasurable return. Thank you.
Thank you. Next.
Good afternoon. My name is Jessica Bathurst, and I'm a volunteer at Planned Parenthood of Greater New York, PPGNY. I also want to thank the committee members and Chair Council Member Lynn Schulman for the chance to discuss how PPGNY programs have benefited me and many New Yorkers throughout the city. I'm here today to add my voice to urge that the Council support these critical investments in PPNYG to ensure they can continue to provide the care that we've been hearing about for over 70,000 New Yorkers. Planned Parenthood is important to me because when I moved to New York to go to graduate school, Planned Parenthood was the only place that I could access affordable and reliable gynecological care, including birth control. I had a health issue that these clinicians discovered, and the staff was so caring as we worked through this issue, and I am so grateful that this medical care was available to me in this kind and supportive setting. I want to make sure that it continues to be available for all who need it. So this year, PPGNY is asking for an increase in funding to support its programs. And so I strongly urge that you support the additional ask for $1.25 million from the Reproductive and Sexual Health Initiative, as well as $1.25 million from the speakers list on top of current funding to allow PPGNY to continue to provide these healthcare services and educational programs throughout New York City. That's it. Thank you.
Thank you. Before you leave, Chair Lee has a...
Yeah, no, just wanted to quickly say thank you because when I was running my previous nonprofits for a women's health program in the AAPI community, we partnered a lot with you all and just wanted to say thank you, because especially this topic is very taboo still among many immigrant communities, and I think you guys provide such an essential service. So just wanted to say thank you, and of course we'll continue to fight, because private insurance is the worst when it comes to reimbursement rates. We all know that. And we need to make sure that the Medicaid, Medicare dollars stay in place, and so we'll continue to fight on that front too. So thank you.
Thank you.
Thank you very much. Appreciate the testimony. Okay, next panel is Deirdre DeLeo. Jordana Weber, Brianna McKinney, Eric Blazik, and Lori, it's hard for me to read the, Putty Esther, or,
Include NYC, maybe just say the organization. Include NYC.
oh, Include NYC is the organization. Sorry, I just can't make out the last name. Oh, there you go. I saw her before. All right. Okay, go ahead.
Hi, I'm Deirdre DeLeo. Good afternoon, Chair Lee and Chair Schulman, and thank you for allowing me to testify. I'm a Director of Behavioral Health Programs at VNS Health. And I just want to thank you for your leadership in advancing mental health access across the city. I don't know, can you hear me? I think so. For over 130 years, VNS Health has supported New Yorkers where they live, in their homes and communities. Every day, we serve over 70,000 people and more than 31,000 people for behavioral health services. We focus on early intervention and meeting people where they are. Our programs include mobile crisis teams, assertive community treatment, intensive mobile treatment, and health home programs across the city. Most recently, we launched a certified community behavioral health clinic in the South Bronx to provide integrated substance abuse and behavioral health for youth and adults. Today, I wanted to speak specifically about two initiatives that are made possible through your discretionary funding. First, our geriatric mental health initiative brings mental health care directly to homebound adults in the Bronx. With the continued support of $200,000, we can continue to sustain and expand this work, ensuring our city seniors get the support they need to age safely and with dignity. Second, our Promise Zone initiative places mental health professionals inside 9 Bronx public schools. These clinicians provide trauma-informed care to students facing emotional and behavioral challenges. With your help, we're asking for $200,000 to meet the growing demand, strengthen staffing, and ensure more students and families receive critical support. These programs work. They prevent hospitalizations and they reduce emergency interventions and help New Yorkers stay connected. Thank you for your support and standing by us to expand access to compassionate, community-based mental health care.
Thank you. Next.
Thank you, Committee Chair Lee and Chair Schulman and all committee members. My name is Jordana Weber, and I serve as Chief Program Officer of Service Program for Older People, or SPOP. SPOP is the only agency in New York City exclusively dedicated to community-based mental health care for older adults. We provide outpatient services for adults age 55 and older at 20 satellite locations throughout Manhattan, downtown Brooklyn, and the Bronx, via telehealth and at our flagship offices on the Upper West Side of Manhattan. SPOP also operates the only geriatric personalized recovery-oriented service program, PROS program, in the state. We serve over 2,000 adults annually and provide individual and group therapy, psychiatric evaluation and medication management, psychiatric rehabilitation, and specialized substance use counseling. To reach those most isolated, most frail, or most medically ill, SPOP partners with hospitals, aging service providers, and other community organizations to make mental health care accessible, acceptable, and effective. We all have older adults in our lives. If not ourselves, it's our parent or grandparent, our neighbor, our fellow bus or subway passenger, our colleague, or our friend. And if you know an older adult, you know that the need for mental health care does not decrease as we age. About 20% of older adults are living with a mental health condition, but in fact, older adults are less likely to have the financial, family, or community supports that can help them weather trauma, crises, or chronic mental illness. They are most vulnerable to falling through the cracks of the mental health care system. The impact of mental illness and addiction on older adults can be devastating, especially for our LGBTQ+ elders, those without secure housing, and those living with multiple disabilities. We are seeing higher rates of suicidal ideation and attempts. We're seeing greater severity of alcohol dependence, and we're seeing major challenges to recovering from trauma. Mental health care plays a pivotal role in the health and well-being of older adults so they can live well at home and participate in the community. Community mental health care reduces the costs of hospitalization or institutional care. And I'll wrap up. I urge the New York City Council to allocate robust funding for mental health care in the year ahead, including programs that support older adults. Thank you for the opportunity.
Thank you. Next.
Hi. We'd like to thank the Joint Committees for holding this important hearing. My name is Lori Podvesker, and I lead the policy work at Include NYC. I'm also a parent of a 22-year-old with developmental disabilities. Include NYC, formerly known as Resources for Children with Special Needs, has helped hundreds of thousands of families navigate the complex special education service and support systems. Today, we testify to urge the Council to fund the Autism Awareness Initiative in FY26 fully. Families with children on the autism spectrum have always struggled with accessing adequate services and support for their loved ones living at home. However, with devastating cuts looming at the federal level to Medicaid and education, there has never been a more significant time than now for the city to fund services and to ensure individuals who benefit from them continue to do so. This funding will allow community-based organizations such as Include NYC to continue supporting and connecting children and families in dire need of critical information on how to access services and support at home, school, and within the community, such as early intervention, preschool and school-age special education services, public benefits, home and community-based services through the New York State's Office of People with Developmental Disabilities, child and medical care, behavioral and mental health support, and socialization activities and groups. We also expect in the coming year to see extreme staffing and program shortages, significant delays in evaluations, larger class sizes, and reduced protections for students with disabilities and civil rights enforcements, sadly leaving the safety of our most vulnerable children at even greater risk today. According to the most recent annual report on special education from the New York City Public Schools to the City Council, as per Local Law 27, more than 33,000 children with autism between the ages of 3 through 21 received special education services last year. And as per the preliminary mayor's management report, roughly 10% of all infants in the city receive early intervention services, including 4,400 babies who receive them for the first time in the first 4 months of fiscal year 25. Last year at Include NYC, our helpline had over 1,200 requests related to autism, including 500 for them for children under 5. We held lots of workshops with almost 2,000 attendees, and we held an in-person event that had nearly 1,000 attendees doing activities in person. To summarize, we urge the council to restore funding to the level it was at in FY23 and to apply a 3% increase, which never happened, to help providers address the rising costs of providing services for a total investment of $3,416,351 in FY26. These funds provide vital resources for programs that would not have any other city support. Thank you so much.
Thank you. Next.
Good afternoon.
Put the mic on.
Can you hear me? Good afternoon, Chairs Lee and Schulman and fellow members of the council. My name is Brianna McKinney, and I'm the Chief Advancement Officer at Project Guardianship. Thank you for your leadership in recognizing the need to invest in nonprofit guardianship services and for lifting up the critical work that we do. Project Guardianship serves as the legal guardian for nearly 200 New Yorkers in need of surrogate decision-making, most of whom are low-income older adults facing complex challenges such as housing insecurity, serious mental illness, dementia, and more. We also run a guardianship helpline where anyone who has a question about Article 81 guardianship or its less restrictive alternatives can speak with an expert to get a better understanding of the processes and resources surrounding these issues. Since launching the helpline in June 2023, we received over 1,200 calls, mostly from women caregivers seeking help for loved ones who are also overwhelmingly women. Guardianship is not only an aging and health issue, it is also a women's issue, an immigration issue, and a housing issue. We're grateful to this council for passing Resolution 561, urging the state to fund a public guardianship program in partnership with reputable nonprofit providers. This is a response to the severe shortage of qualified guardians to serve in cases where a person has no family or friends to serve and no money to pay a private guardian, and the devastating outcomes of these shortages. It is a crucial step forward. But while we advocate for state investment, we cannot ignore the reality that 60% of all guardianship cases originate within the 5 boroughs. The crisis is here in our city today. That's why in fiscal 26, we're calling on the City Council to make deeper investments in guardianship services. With additional support, Project Guardianship can further safeguard vulnerable adults, prevent unnecessary institutionalization, and ensure that every New Yorker in need has access to a qualified, person-centered guardian. Thank you for your time and the opportunity to testify today.
Thank you. Next.
Good afternoon, members of the New York City Council.
Oh, push your mic button on.
Good afternoon, members of the New York City Council. My name is Eric Blazik, Manager of Mental Health Services at Center for Independence of the Disabled in New York. Many of us are here today to advocate for a peer-driven mental health crisis response system in accord with Daniels Law. I am here today to advocate for Sydney regarding Daniels Law programming. Our experience in addressing mental health and physical disabilities, along with our ability to manage complex collaborations, enables us at Sydney to deliver effective services under this initiative. Sydney employs a high percentage of staff with lived experience of disability and uses metrics like client satisfaction and case outcomes to guide service delivery. Our commitment to evidence-based, culturally competent care ensures we engage people with disabilities respectfully. Additionally, Sydney systematically increases cultural competence within the mental health system through our New York State-approved Multicultural Competence Continuing Education Program for licensed social workers and mental health counselors, addressing the lack of necessary training in culturally responsive mental health care. Central to Daniels Law is creating a communities-based crisis response system, including mobile crisis teams, crisis call centers, and stabilization centers. Sydney's strengths include our expertise, infrastructure, and experience in managing effective memoranda of understanding and subcontracting relationships. Our group counseling and wellness call programs provide accessible mental health support to the New York City community, and we provide case management for benefits, housing, vocational support, and mental health referrals, enhancing our ability to provide sustainable aftercare. In conclusion, Sydney's history of service, established infrastructure, understanding of the complex needs within the disability community, and proving ability to manage collaborations positions us ideally to deliver Daniels Law programming. Thank you. 4.5 for peers, additionally.
Chair, can I just, thank you so much. Just wanted to
Thank you.
Quick comment, sorry. I just wanted to say thank you to each and every one of you because I know that you are all doing incredible services on the ground around disabilities, SPOP, VNS, we got to get you guys more money for GMHI, autism. And I'm going to sound like a broken record, so I'll just say this, which for the rest of the committee, I just really appreciate all the nonprofit providers that are here. And one thing I would say is I would encourage all of you, because I see so many faces here that are incredible leaders in your own areas, and just encourage you guys to exchange contact information and share expertise, because there's a lot of that in this room right now. So I just wanted to say thank you to all of you.
Yeah, thank you very much. Really, really appreciate the work that you do. All right, next panel is Martha Neighbors, Kendra Hardy, Chris Norwood. It's just these three. Yeah. All right. No, they're not. I just want to remind folks that you can't tape record or video anything from the table. So,
Guess that's me.
I guess that's you.
Sorry.
That's all right.
All right, off.
Okay, fine. All right, go ahead, I'm sorry.
Good afternoon, Chair Schulman, Chair Lee, and members of the committees. I am Martha Neighbors, Executive Vice President of Snug Harbor Cultural Center and Botanical Garden in Staten Island, and I am here today to support a proposed new speaker initiative rooted in accessibility, which will enhance the ability of the city's public botanical gardens to provide access to disabled New Yorkers and support positive public health outcomes. Founded in 1977, Snug Harbor is an expansive culture park on Staten Island where arts, nature, education, and history unite to bring dynamic programming, events, and festivals to our diverse community. We seek to create a more culturally connected, thriving community in an underserved area of New York City. We are the city's only free botanical garden, open 365 days a year from dawn to dusk, and we welcome over 500,000 visitors annually. According to the National Institutes of Health, the burden of non-communicable diseases, including poor mental health, is increasing. Some practitioners are turning to nature to provide the solution. NIH reviewed 39 related studies. 92% demonstrated consistent improvements across health outcomes when individuals engaged with outdoor environments. Mental health outcomes improved across 98% of studies, while physical and cognitive health outcomes showed improvement across 83% and 75%, respectively. Our 4 public botanical gardens provide exactly these opportunities. Snug Harbor partners with DOE District 75, City Access New York, the Grace Foundation, Lifestyles for the Disabled, and On Your Mark to host events and provide workforce development opportunities for people with physical, cognitive, and/or sensory challenges, serving thousands annually. To summarize, we are asking you to support our public gardens' unique role in providing safe, accessible outdoor spaces with a modest $1 million annual investment rooted in accessibility. Disabled New Yorkers deserve the benefits of engaging with nature and the positive effect of such engagement on their mental and physical health, and our public gardens need your help. Thank you.
Thank you. Go ahead.
Yes, good afternoon. Thank you. I'm Chris Norwood, Executive Director of Health People. I have to remark on the continuing failure of the city administration to implement and fund the comprehensive diabetes reduction plan mandated by the council. Having worked on that extensively as community co-chair with C. Virginia Fields to produce that plan, I particularly find it incomprehensible that neither the health department or the city council has funded the community self-management peer-delivered education, which is a chief recommendation of that plan. We have this kind of peer education for almost everything else, HIV, COVID, mental health, and yet to continue to fail to put it in place for people with diabetes so they can in their community learn effective, safe self-management has left a staggering gap. The figures that will soon come out from the city show horrifying increases in complications, particularly amputation, which went up 100% between 2010 and 2019, and just in the 2 years since 2020 has gone up 52% in the Bronx, 66% in New York, and 25% in Queens. A huge portion of people with diabetes remain with very out-of-control blood sugar, which puts them at more risk for other complications. And very importantly, as we talk about mental health, The Diabetes Self-Management Program, which is a 6-session peer-delivered program, is well evaluated to slash depression by 50%. I am asking the City Council to please finally address this. And we have asked for an allocation from the speakers list of $3.5 million to start peer education programs, teach other agencies how to do it so they can do it themselves and keep going, and it's sustainable.
Thank you. Next.
Hi, everyone. Oh, sorry. Good afternoon, Council, and I appreciate you hearing us today. My name is Kendra Oki. I am Crossover Television Live with Kendra and also Kendra's Crossover Inc. And the reason that I'm here today alongside Chris Norwood is because I am that product of a diabetic. I'm a diabetic for 29 years. I lost my mother to diabetes. She died of kidney failure and heart attack when she was 64 a few years ago. 10 years ago, then I joined Health People, and I was at the most depressing state of my life, losing my mother to diabetes. I lost my dad to diabetes when he was very young, in his 40s. The same thing, kidney failure. And my thought was, I don't want to lose, my life. My son will have no one, to kidney failure. Right now, I'm going blind in my right eye. And by the grace of God, I came to Chris Norwood 10 years ago. I'm not even reading this. I came to Chris Norwood 10 years ago to Health People, and she saved my life. Depression is very surreal for us with diabetics. Dr. Dre said food addict. That is very surreal. What person wakes up and just eats and they know they're gonna go blind, they're gonna lose their kidneys. My son is a autistic child that has epilepsy and Lennox-Gastaut syndrome. I'm a single parent, he needs me. So my thing is, know your numbers. My number right now is 141. My A1C, when I came to Health People, was 11. My A1C is 6.1. I teach DSMP. I save lives every day. And this is important. We need funding. We've been asking City Council. I was here 6 years ago at the same place. You know how you all have Facebook, right? And you know how you get the memories? Well, my memory was me testifying 6 years ago and still nothing. This program saved my life. Please give us funding.
I appreciate everything that you said. Thank you very much. Thank you to this panel. Next panel is Jay Ayida, Ronnie Marks, Sharon Brown. Wait, I'm gonna skip one. Hold on. No. Robert Desrilo, if I'm pronouncing it correctly, from the Hepatitis Mentor Support Group. Robert Desiro or Desrilo? Derulo, I'm sorry. It's hard to read. I want to just remind everyone to please keep testimony to 2 minutes. You can submit testimony. The reason I'm saying that is because we have another 60 people in person to testify, and we have another at least 20 or 30 online. So we want to be able to get to everybody. Go.
Good afternoon, Chairperson Schulman and members of the committee. My name is Jai Ayida, and I'm a patient at Callan Lord Health Center. They provide gender-affirming health care to the LGBTQ and regardless of pay. For the last 3 years, Callan Lord has been a lifeline to me. It has allowed me to move from survival to living a life full of meaning and joy. With the support of organizations like Destination Tomorrow and Brooklyn Ghost Project, I was able to receive my health care through AmitaCare. With AmitaCare, I was able to obtain the health care that I need. I can now pursue my artistic passions, work, and live my authentic life. Everyone deserves access to care that allows them to thrive. However, recent policy changes and executive orders at the federal level present an existential threat to transgender individuals across this city, New York. One executive order seeks to limit access to gender-affirming care for youth under 19. This order threatens to strip away essential health care and jeopardizes the ability of providers to offer necessary services, especially for those reliant on Medicaid and Medicare. This cruel effort to dehumanize TGNC population of all ages exacerbates existing disparities and puts lives at risk. There are efforts to severely downsize and eliminate the division of HIV prevention at the Center for Disease Control and Prevention. Callan Lord remains dedicated to serving over 22,000 LGBT patients annually, including 8,000 transgender TGNC individuals like myself. We must protect and expand care. I urge New York City Council to, 1, increase the investment to the Trans Equity Fund to at least $10 million, and to continue to fund and support for persons involved in sex trades to sustain and expand gender-affirming services. 2, to increase funding for the HIV prevention and care. And 3, to support Callan Lord's request for increased funding to ensure access to medically necessary health care for TGNC patients. In summary, our bodies and our health care are private matter, and of all the forms of inequality, injustice in health care is one of the most shocking and inhumane. We exist, we have existed, and we will continue to exist. Thank you for your time and consideration.
Thank you very much. Next.
Hello, my name is Sharon Brown. Before I get started, remember the hostages, release the hostages, let Yahweh's people go, defend Israel. Okay, we cannot allow gender care. Boys and girls are the gender and sex, God made them, they remain the same. There is only male and female. We are a Jewish Christian nation, AKA a Judeo-Christian nation. This goes against the morals and the Bible standards. When I taught in church, no one attempted suicide. No one had a horrible time because they couldn't be homosexual. We dealt with the youth department, the children's church from ages 4 or 5 and younger, up all the way to the youth, up till 23 years old. And all the departments that I worked in, no one felt that they had to be homosexual. They had to change their sex. They weren't suicidal. They were thriving with biblical teaching. And that's the Old Testament or the Old and New Testament. There's no way that we can have this in our schools and in our healthcare. I've helped close many Planned Parenthoods, and I've gotten prayer in schools, Oklahoma, Texas, and many others, and we're trying to get people to deal with chaplains, Jewish and Christian, instead of the mental health system. The mental health system largely tells people that they can kill children in abortion, which is murder. They tell them that they can change their sex. These things are not allowable. We cannot take a baby and tear them apart. We're funding people being torn apart in the womb. We cannot do this. We are looking at trying to get people arrested if they allow abortion and sexual care. It's not care.
Got to wrap up. So let me just say, Lonnie, before you go, let me just say that the trans community is very important to us. I am a proud member of the LGBTQIA+ community. Ronnie, go ahead.
Oh, good afternoon. Excuse me. Good afternoon, Chair Shulman and Lee and members of the committee. I want to thank you for supporting the hepatitis community these past few years, but I'm here today more as a patient. a patient who has cured of hepatitis C. Through my organization, the Hepatitis C Mentor and Support Group, we provide education and supportive services for the most vulnerable communities on the ground. It is imperative that we increase the workforce to be able to get to the people so that we can eliminate this virus. It has a cure. It's the first one in 100 years that has a cure. There is a stigma attached to this, and it's heartbreaking to hear people say that they don't deserve a cure because they gave this to themselves. Everyone deserves to be cured. Please help us eliminate hepatitis C in New York City. Let's be the first city to do this. Thank you.
Thank you very much. Next.
Good afternoon, Chairperson Schulman and members of the Committee on Health. My name is Janine Garriga, and I serve as the patient navigator at Boom Health. We participate in the New York City Council Viral Hepatitis Prevention Initiative, which delivers some of the nation's most innovative and effective hepatitis B and C prevention, treatment, education, and linkage to care programs. Boom Health is a harm reduction center that provides a wide range of services, including syringe exchange, medication-assisted treatment, opioid overdose prevention training, as well as HIV and hepatitis C testing and linkages to care. An estimated 314,000 New York City residents are living with chronic hepatitis B and C. With infection rates this high, it is essential to sustain and expand the Viral Hepatitis Prevention Initiative to protect the health of hundreds of thousands of New Yorkers. Moreover, this initiative serves as a model and beacon of hope for similar efforts nationwide and globally. According to the most recent New York City Department of Health surveillance report, 6,947 individuals were newly reported with chronic hepatitis B and C in 2023. Additionally, 2,375 individuals were newly reported with chronic hepatitis C in New York City that same year. For comparison, there were 1,686 new HIV diagnoses in New York City in 2023. This stark contrast illustrates that not only did newly reported chronic hepatitis B cases sharply increase, but more than 4 times as many individuals were newly reported with hepatitis B compared to HIV. The high disease burden of hepatitis B and C in New York City, coupled with low investment in the city's viral hepatitis response, puts the health of New Yorkers at significant risk. I respectfully urge you to continue to support the Viral Hepatitis Prevention Initiative in the upcoming fiscal year. Okay, we are requesting an additional $2 million investment for a total of $4.24 million to enhance our hepatitis B and C services. This funding would enable us to hire more patient navigators, conduct more hepatitis B and C testing events, and strengthen our linkage to care and treatment for more New Yorkers. Sustaining and expanding this initiative will help reduce the long-term financial burden hepatitis B and C impose on our New York City healthcare system. Thank you.
Thank you very much. Can you just state your name again for the record?
Janine Garriga.
Did you fill out an appearance card? Yes, I did. Yes? Okay. We'll find it. Thanks. Next.
Thank you. More hepatitis C, if that's all right. Thank you for the opportunity to speak today. I want to thank the council members for supporting the hepatitis community in the past. My name is Robert Derulo, a representative of the Hepatitis C Mentor and Support Group. I have been working for over 10 years on the ground in underserved communities. I work closely with the founder and director, Ronnie Marks. Together we provide essential education and supportive patient mentoring services through partnerships with syringe service programs, overdose prevention centers, clinics, hospitals, and any other community-based organization in need of our services. The critical population we serve includes substance use disorder, people with substance use disorder, those co-infected with HIV, the LGBTQ community, youth, young adults, baby boomers, and anyone else affected by hepatitis C. So the issue is hepatitis C is an elusive disease. You can ask 10 friends or family members what hepatitis C is, and a handful of them are probably going to get it wrong, right? It's hiding in the shadows with little or no symptoms, growing within, destroying arguably the most function-heavy organ in the body, which is the liver. Often when people find out find out about it, it could be too late, as hepatitis C is also one of the leading causes for liver cancer. There are close to 100,000 people diagnosed with hep C in New York City currently, and thousands more undiagnosed, unaware, and uneducated about it. The irony is, hepatitis C has a cure, as you heard earlier. I had a patient once tell me that they were living with hepatitis C for years before they even learned about there being a cure, and they've been to their primary care within that time. So again, I say the scientists, the biologists, the virologists, they did their job. They found the cure. Curing people is now up to us. As an educator in the field and someone who has witnessed the lack of knowledge in communities, I can tell you firsthand what an impact this virus has on the lives of those affected. We need increased education and supportive services for hepatitis B and C, and increased funding for peer navigation, harm reduction, syringe service programs, and it's critical that we reduce missed opportunities to screen and diagnose patients who seek care in emergency rooms and hospitals, as well as educating providers and staff on the stigma faced by people affected with hepatitis C. I hope with your support, we can provide a model for the entire country, with New York City being the first city to eliminate hepatitis C. Thank you so much, Council.
Thank
Chair,
you
if
very much.
Oh,
Really,
sorry.
what?
Oh, can I just say one thing?
Yeah.
No, so I remember back in the day, they tried cutting Hep B and C funding, and at that time, Corey Johnson, who was the speaker, along with Councilmember Peter Koo and a bunch of others, fought, yes, and we all fought
remember.
that battle together. Yep, oh yeah. And we'll make sure that that is kept as well, and that we're gonna try to get more funding for that, because just because it's not a current or talked about public health issue doesn't mean it's non-existent. And so with that, along with diabetes
Correct.
and other things, we need to make sure we keep that funding. And I just want to say, Jaya, am I saying that correctly? Thank you so much for sharing your testimony. We love the work that Callan Lord does, and thank you for your bravery.
Thank you, Council.
Thank you very much to the panel. Thank you. All right, next panel is Charlotte de San Pedro, no, Charlie, sorry. Huh? De San Pedro Jr., yes? Yes, no? Yep. Okay. Suzanne Stout? Okay. Michael, it's hard to read it. From Lifelinks Clubhouse? Michael? Oh, he's coming. Okay, great. And Michael Petty? As the other two Michaels. Okay. 1, 2, 3, 4. Is there somebody missing that we didn't get? Michael Petty? You're Petty. Okay, so the other Michael. Is he here? Oh, he left. Okay. All right, go ahead. Make sure the microphone is on. You have to, Sergeant, just show him, please. Thank you.
Good afternoon, council members. My name is Michael Petty. I'm a 56-year-old retired chef and a member of Lifelinks Clubhouse, located in Elmhurst Hospital, Queens. On June 27, 2023, I attempted to take my own life due to serious depression, which is a result of growing up in an abusive household, as well as losing my career as a chef due to a developed back disability. I came to the clubhouse unaware of its actual existence. I immediately felt a safe family environment because mental illness is not easy to talk about, and being amongst members who are fighting similar battles makes that recovery so much easier. There is a misconception that mental illness means a person is either crazy or danger, when in fact mental illness is so much broader, as anyone else can experience it through trauma, abuse, loneliness, despair, especially in a city like New York that has experienced so much trauma over the years, including 9/11, in which I lost my wife, Hurricane Sandy, as well as the recent pandemic. And being in Elmhurst, that was ground zero for the pandemic, which makes clubhouses so valuable to recovery. Mental illness is not a one-size-fits-all solution, and the clubhouse models provide people's needs. I found a safe haven as well as a purpose again. I am able to use my cooking skills to serve and teach members. I also have learned endless computer and office skills from other fellow members as well. I ask you to please keep funding LifeLinks as well as all the other clubhouses. I fear members as well as myself will be left without the necessary treatment in our recovery, as members have been able to reintegrate back into a functional society. Thank you for listening to me.
Thank you. Next.
Would you like me to read Mike's?
No. You can? Yeah, you can.
Okay. All right, good afternoon, members, council. My name is Michael Mingozzi, a retired New York City government employee. I am honored to stand before you to share my journey and highlights of the transformative work of LifeLinks Clubhouse, a community that has changed my life and empowered so many others facing mental illness. In 2024, after my Parkinson's disease diagnosis, I deeply struggled with anxiety and depression. My therapist at Elmhurst Hospital suggested LifeLinks Clubhouse. I remember feeling hesitant as I walked in through the door for the first time. My mind was filled with doubt. Then staff members and members greeted me warmly. It was such a warm, small gesture, yet it gave me a glimmer of hope, and I have not felt in months. At LifeLinks Clubhouse, I found more than just services. I found a community that has empowered my life through facilitating workshops, special events, and shared meals. I regained a sense of purpose and a connection. LifeLinks became my lifeline, helping me to rediscover my strengths. Programs like LifeLinks Clubhouse don't just provide services, they provide transformative change, reducing emergency room visits, boosting productivity, and strengthening our society. Every dollar invested in mental health support is a cost-effective strategy that benefits us all. These programs empower individuals to overcome challenges, rejoin the workforce, and contribute to society, creating a ripple effect, stronger families, safer neighborhoods, and a more resilient city. Let us work together to ensure no one is left behind.
Thank you. Next.
Good afternoon, Chair Lee and committee members. My name is Suzanne Stout, and I am the director of Shelton Loft Clubhouse, which is in East Harlem. First, we are extremely grateful for the City Council's FY25 $2 million investment to save our clubhouses. This critical funding ensured that smaller, community-based clubhouses across the city continued to offer intimate, supportive environments where our members could thrive. These spaces are especially vital for individuals who would have found it challenging to engage in larger city-funded clubhouses. While no single model or program can fully support individuals with serious mental illness, community-based clubhouses serve as a uniquely effective complement to critical therapeutic interventions. They significantly enhance outcomes when integrated into a sustained psychiatric rehabilitation framework. By fostering social connection, skill building, and personal empowerment, clubhouses provide a structured yet flexible support system that reinforces clinical treatments. Aligned with a comprehensive mental health infrastructure, these spaces help individuals deepen their understanding of mental illness, develop skills for independent living, and receive encouragement and assistance in pursuing their individual self-determined goals. The impact of our clubhouses is clear. Programs where peers take on leadership roles reduce psychiatric hospitalizations by 40% compared to those without such support. Hospital stays, when needed, are 30% shorter for individuals engaged in community-based recovery programs. The cost of a psychiatric hospitalization in New York City is approximately $4,000 per day, while smaller psychosocial clubhouses provide long-term stability at a fraction of the cost. I want to stress how important it is for the Council to continue providing funding through the Mental Health Clubhouse Initiative. And to wrap this up, we respectfully ask that the council not only continue the initiative, but increase the funding so that our programs will receive the necessary resources to operate for the entirety of FY26. We further ask that the council consider baselining this important initiative to ensure that our members don't have to live with the fear every spring that their program may lose its funding. Thank you.
Thank you. Next.
Thank you, Thank you, Chair Lee. Turn the mic on. Sorry. Thank you, Chair Lee and committee members. Hello, my name is Charles D. San Pedro, and I have been a member of Top Clubhouse for 6 years. I am here testifying on behalf of Top Clubhouse because it means the world to me. It helps give structure to my days. It makes available fun activities and a chance to volunteer and feel needed. I love Top Clubhouse, and I hope it never closes, so I can keep enjoying it and others keep enjoying it too. Before coming to Top Clubhouse, I became a member of a larger clubhouse. This large clubhouse had lots of members and could overwhelm me. When I was told Top was accepting new members and that Top was a smaller clubhouse, I thought Top might be a great fit for me, and it definitely was. I knew from my first day that I was going to love it at Top. Top helped me find my job 2 years ago at the US Open, and Top has put me in touch with many people, many great people. Small clubhouses matter, just like big clubhouses do, and I hope you will give us the funding that we need. Thank you.
Thank you very much.
Everyone.
Okay, what?
Oh, no, I just want to say I love all you guys. This is my one of my favorite panels. Actually, everyone's my favorite panel, but I just want to say thank you all. And did I see Dice here? Dice Cooper. I just wanted to give you a special shout out who runs LifeLinks over at Elmhurst, and thank you all for the work you guys are doing.
Thank you.
Thank you.
We really appreciate it. Okay, the next panel is Claire Bigging, Eugene Massey, Chelsea Rose, and Veronica Smith. Oh, wait, and Jahoon Kim. Sorry. Is everybody here? Is somebody missing? Okay, who from the group is missing? Claire? Oh, okay. On behalf of Eugene, yes. But wait, hold on 1 second. All right, so 1, 2, 3, 4. Okay. So you speaking for yourself first?
Yes.
Okay. I want to thank everyone for keeping this to 2 minutes because we still have a lot of people that are testifying. So anyway, go ahead.
Thank you. Thank you, members of the committee, for hearing from us today. My name is Claire Bigging, and I am a DC 37 Local 3005 member and a city worker. I am here today to oppose any budget cuts that will further reduce the quantity and quality of the services we provide to elevate the health of all New Yorkers. I currently work on an online HIV home test giveaway program that has successfully distributed tens of thousands of at-home self-HIV tests since 2018. In the summer of 2024, we were set to distribute another allotted 10,000 home tests when, due to budget cuts, our online ads were disapproved. Without online advertisements, we struggled to get out less than 500 kits, down from 10,000. This year, our online ads were disapproved yet again. Without online advertising, we know it is impossible to run an online campaign. We knew our strategy and program worked. We engaged the community, and we regularly captured a significant amount of people who had never tested for HIV before. Instead of putting our energy into this project, we now have to scramble to give out these resources in an inefficient and less successful way. I work for the city because I love this city. I urge you to consider the valuable work of all of our city agencies all of the work that our city agencies do when deciding the budget. Without your support, we can't do the work to keep New Yorkers healthy and safe. Thank you.
Thank you. Next. Oh, did you want to read? Yes, I'm sorry.
Yes, thank you. Hello. My name is Eugene Massey, and I am a city worker at the city worker on the DOHMH Climate Health Team in the Division of Environmental Health. In my role, I focus on bringing community input into research, data analysis, and policy efforts through building relationships and with community-based organizations, also known as CBOs. One way I do this is through leading Climate Resilience Advisory Network, or CRAN, which is made up of 10 different community-based organizations. They receive $3,000 in exchange for their engagement. When Mayor Adams announced the budget cuts, I had to meet with each organization that had already agreed to participate in CRAN, some of whom had participated the prior year with the expectation of continuing to work into this year. To let them know that I didn't know if we would be able to pay them for the work that they did with us this year. This was especially frustrating to have these conversations and simultaneously watch Mayor Adams pridefully announce continued efforts to recruit thousands more NYPD officers. It's hard for me now to imagine how our government easily dispensing millions of dollars towards more NYPD will benefit the city more than giving a few $1,000s directly towards health efforts focused on strengthening community relationships and ensuring that we are able to integrate input from all New Yorkers. The budget cuts also impacted my colleagues who analyze air quality data when funding for several new air quality monitors was scrapped. These monitors were going to be used to help analyze the impact of congestion pricing on air quality. Council members have repeatedly asked my colleagues why we don't have more air monitoring happening throughout the city, and the budget cuts are one reason why. Finally, the budget cuts have impacted me on a personal level. I have worked for the city for over 2 years, and in that time, my role and skill set expanded. In an effort to ensure that my compensation and title matched this, my team put in a request for a title change. This title change took 6 months to be approved, was only approved after a grievance with the union, and I continued to provide high-quality work. Thank you.
Thank you, and I just want to let you know that there is somebody from DOHMH who's been taking notes and staying here for the whole time, so just know that your words are being heard. Next.
Good afternoon. My name is Chelsea Rose, and I am the Policy and Advocacy Manager at Care for the Homeless. I'd like to thank the members of the committee for the opportunity to testify today. Care for the Homeless has 40 years of experience providing medical and behavioral health services exclusively to people experiencing homelessness in New York City. We operate 23 federally qualified community health centers in all 5 boroughs, co-locating in places where individuals are already accessing services. We also operate 2 shelters for women, 2 shelters for men, 1 safe haven, with 1 more opening in the next few months. I'm here today to talk about the importance of supporting the City Council's health focus initiatives and to urge the Council to include $4.5 million for the Access Health NYC in the FY26 budget. At CFH, City Council's health focus initiatives allow us to reach people experiencing homelessness, to not only help them access primary medical and behavioral health services, but also to help establish a focus on ongoing preventative health care. Access Health enables community organizations across NYC to provide education, outreach, and assistance to all New Yorkers about how to access health care and coverage. Our consumers are burdened with navigating a complex healthcare system to address multiple co-occurring chronic health conditions while also experiencing the trauma of homelessness. Our goal is to reduce the barriers to accessing healthcare and supportive services that are integral to stabilizing the lives of those we serve. In the last full funding cycle, we engaged over 6,000 individuals in our outreach efforts, led by our outreach specialists, who are folks with lived understanding of the barriers that people experiencing homelessness often face. Connecting underserved communities to essential health services is essential in the fight to end homelessness. It is imperative that the FY26 budget continues to invest in the City Council's health focus initiatives and also enhance the Access Health initiative to $4.5 million. This increase is necessary to meet the growing demands that our organizations have faced in serving our communities. Thank you very much for your time.
Thank you. Next.
Can everyone hear me? Good afternoon, everybody. My name is Veronica Smith. I am the Senior Director of Health Policy and Government Affairs at Public Health Solutions, the largest public health nonprofit in New York City. For more than 65 years, PHS has improved health outcomes and helped communities thrive by providing services directly to underserved families, by supporting community-based organizations through our long-standing public-private partnerships, and bridging the gap between healthcare and community services. In 2024, we provided direct services to more than 135,000 New Yorkers by increasing access to nutritious food, improving access to healthcare, and promoting healthy living. I will go over a brief overview of the 3 discretionary funding or initiatives that we would like to respectfully request funding for. The first one, PHS is committed to removing silos between healthcare and community services and building the capacity of care providers to ensure that their patients are seamlessly connected to resources in the community. Fiscal year 26 City Council funding will support the Healthcare Community Partnerships Capacity Building Program in developing a capacity building initiative, a patient-centered contraceptive care in a challenging landscape, to improve the capacity of providers and clinic staff at up to 8 New York City-based healthcare facilities to provide sexual and reproductive justice-informed patient-centered contraception care. The proposed 12-month capacity building initiative aims to increase access to high-quality, patient-centered contraceptive services informed by an SRJ framework at healthcare clinics throughout New York City. We respectfully request that that Public Health Solutions respectfully requests $500,000 from the dedicated contraception fund to support this capacity building program. Next, maternal and child health. Our maternal and child health team supports thousands of pregnant and newly parenting New Yorkers to achieve healthy pregnancies and births. Over the 12-month period, the New York City Breastfeeding Warm Line was developed at the height of the COVID-19 pandemic to provide free virtual breastfeeding support, particularly to underserved families and families of color who experience systemic barriers to care, and is a unique service in New York City, filling an important gap to support new parents in troubleshooting early infant feeding challenges. We are asking for $225,000 for the New York City Breastfeeding Warm Line. And finally, if you'll let me finish, healthcare, SNAP, and cash assistance. The City Council's Benefits Bridge program, supported by Access Health and Support Our Seniors initiative, focuses on medically underserved areas. The Bridge program will amplify its project to ensure cultural competency of information and using benefits and services in the community, including migrants and asylum seekers, by providing one-on-one sessions to people who have just recently enrolled in a benefits program, i.e. SNAP, Medicaid, or WIC. For this year, for fiscal year 2026, we are asking the City Council to respectfully fund this program for $150,000 to continue serving linguistically diverse communities and providing them the one-on-one care that they need. Thank you.
Next.
Chair Lee, Chair Shulman, thank you for the opportunity to testify on the Mayor's preliminary budget. My name is Ji-Hoon Kim, and I'm the President and CEO of In Unity Alliance. It's an honor to be here today representing 200 addiction and mental health providers. Addiction and mental health conditions are not unlike other medical conditions. There are early signs, and without care, the symptoms get worse. While hospitals can provide short-term stabilization, for most, true recovery requires ongoing care. Without it, the cycle continues. I know this from personal experience. I was fortunate to receive care early, but not early enough to avoid multiple hospitalizations and long-term rehabilitation. I am a person in long-term recovery from a mental illness and a substance use disorder. I share this because the substance use disorder and mental health care system, despite its many challenges, saved my life. But severe lack of investment is undermining their ability to reach people like me. They are missing their second chance, routinely waiting months for their first appointment, only being prioritized when they are in crisis. Safeguarding access to these services is critical. Providers are confronted with mounting financial pressures, including the very real threats of federal funding reductions. In a recent survey of our members, 36 out of 60 organizations reported relying on federal grants to fund their services. Now more than ever, we urgently need to eliminate barriers to financial stability, preserving their already limited access to care. This includes addressing contract delays. In a survey of our members, the average current outstanding amount was $20 million, and an average unreimbursed interest due to the need to take out loans was $90,000. Impacts included hiring freezes or staff reductions, reduction in client services, not being able to pay landlords, and more. The timely and transparent distribution of opioid settlement funds will also help. You can also help ensure the Council's mental health services initiatives stay in reach by restoring previous year's cuts and providing a 3% increase to match the COLA initiative. By investing in these services, you are meeting the growing needs of New Yorkers and fostering opportunities that help tear down health inequities. I appreciate the committee's time and consideration of these requests. Thank you.
Thank you, everyone, and for all the work that you guys do, especially these organizations right here. I know how much work you do on the ground, so thank you so much. And Ji-hoon, I'm going to embarrass you for a little bit. So just in case you guys didn't know, when he was working under Governor Hochul, he's the one that really pushed the $1 billion investment in mental health services. So I just want to give him credit where credit is due. As my fellow Korean brother in government, there's not too many of us in government that understand this mental health piece, so I just want to say thank you.
Thank you, Chair Lee.
Oh, right, I'm doing this now, sorry. Okay, I got all excited. Okay, next we have, Jonathan Chung, Jordan Rosenthal. This is a good panel. Evelyn Graham Nayas, I'm sorry if I'm pronouncing that incorrectly. Ashley Santiago Conrad, and Ruth Lowenkron. Sure. Come on down. Sorry, I probably should have given you guys a heads up because you're coming from upstairs. My bad. Whenever you guys are ready. Should we start on this side to, I don't know, do you want, you could start. Yeah. Okay.
Hi, everyone. Are we at 2 minutes? Yes? No? Okay. Hi, I'm Jordan Rosenthal, she, her, Director of Advocacy at Community Access and lead organizer for Correct Crisis Intervention today. So, as per Chair Lee's request, I'm going to go off script and kind of talk about really the importance of investing into a peer workforce, especially as we see this rise of fascism. So, and the reason why I'm going to say this in such explicit terms is as situations become more dire on different levels of government, we're going to see more people reaching out for mental health supports. And mental health crises may happen at higher rates. And it's really essential to connect people to care with care that actually looks and understands what that person is experiencing. As a white Jewish social worker, I can say from my own experience, I know jack shit about being Black and poor and homeless and having a drug addiction on the corner of 34th Street. It is inappropriate for me to be the responder to someone in crisis who has that identity and that experience. This is why we're asking for $4.5 million for 60 staff lines to add to Be Heard to have peers being responders on these teams. Additionally, really quickly, we need $307 million to develop and preserve New York City's 1515, with $72.6 million for services and operating budgets for new and existing projects, $4.8 million for JISH, and then more money again for ACT and FACT and IMT teams. And just to talk about that earlier, there is a wait list for ACT, FACT, IMT, all of that stuff, and Community Access has actually done a longitudinal analysis of our homeless mobile treatment teams, and we found that over time, 41% have an improvement in housing, 70% have a decrease in systems contact, 20% increase in connection to outpatient care, and 32% increase in positive social supports. Peers work. Thank you.
Thank you.
Thank you, Chairs Lee and Schulman and other members of the committees for convening this preliminary budget hearing for fiscal year 2026. My name is Sheena Bennett. I am here today to testify in support of the FY26 budget request of Correct Crisis Intervention Today, NYC, CCIT, NYC. We need a FY26 budget that includes a baseline allocation of $4.5 million to ensure competitive compensation for peer specialists to staff the city's mental health crisis response teams. This funding will also support the expansion of peer responders within the Be Heard program, strengthening the city's capacity to provide effective community-centered crisis intervention. This funding request is essential because countless people have been traumatized by inappropriate responses to mental health crisis calls. In the past 10 years alone, 20 individuals have been killed by police officers while experiencing a mental health crisis in New York City, including my beloved cousin, Erd Pierre. He called 911. They fired 10 shots at him and killed him. After decades of advocacy by CCIT, NYC, and others, we appreciate New York City's attempts to shift crisis response to the Be Heard pilot, but the program is missing peers. Peers, people with lived mental health experience, need to be a mandatory element of Be Heard teams. Response teams that include people with lived experience will help to achieve the Be Heard pilot goals by shifting the model to a person-centered approach rooted in genuine connection and communal well-being. Peers have the skills and expertise to advocate for a connection to community-based care and avoid unwanted and unnecessary transports to hospitals. The $4.5 million is essential because peer work is serious work and we need to invest in a sustainable workforce. By investing in peers on Be Heard teams, the city will ultimately have a cost savings as there will be fewer unnecessary ambulance transports, fewer hospital stays, fewer arrests and other involvements with the criminal legal system, fewer injuries, and fewer deaths. We look forward to working with the chairs and the members of the committee to improve Be Heard, ensure that New Yorkers experiencing a mental health crisis response receive the response they deserve. Thank you. Peers, not police.
Thank you. Go ahead.
Good afternoon. Ruth Lowenkron, Disability Justice Program, New York Lawyers for the Public Interest, and also a proud member of Correct Crisis Intervention Today, New York City. So I'm going to say what they said, and I'm going to say a few other things. I think it's really important that we acknowledge today that yet another person has been killed at the hands of the police. Not in New York, while experiencing a mental health crisis, not in New York City, in upstate New York. But this is a constant thing, and we refuse to accept this. There is a way forward. Be Heard is a baby step in that direction, and I want to make that clear. Be Heard has issues. We have lots of ways to correct it. The main, first and foremost, is to get peers on for the reasons my colleagues said. It also must be open 24/7. It's got to improve its response time. It's got to have oversight by peers. It needs fixing, but let's go in that direction. And I'd also like to talk about what's getting all too much press, and that is, and something folks haven't spoken about today, and that is the push of our mayor to expand mental health commitments, both inpatient and outpatient. That is not the way. Take a look at the literature. That is not the way forward. It's very clear that at best you'll get de-escalation, but what do you do after the de-escalation? You have to build the system of mental health supports, you have to build the system of social services, and you have to build the kind of mental health crisis response that my colleagues are talking about. Now, not tomorrow. 4.5 billion is a drop in million, is a drop, billion be nice, is a drop in the bucket, and at least let's make sure we have that. I'd also like to say, earlier there was a talk about New York City public schools, and I just want to drop in there that my office has a report on the mental health of students being ignored in the special education context. I will send that in with my testimony, as I will send in the report about the racist response for what is known as assistive outpatient treatment or forced outpatient commitment. From the state's own numbers, you can tell it's a very racist response. Thank you so much.
Thank you, Ruth.
Good afternoon, Chairs Lee, Shulman, and members of the committee. My name is Jonathan Chung, and I'm testifying on behalf of the National Alliance on Mental Illness of New York City, the only nonprofit providing direct and extensive support to families caring for loved ones with serious mental illness. We are grateful that the City Council has prioritized mental health and sees the power of peers in the lives of individuals living with mental health challenges and the power of NAMI NYC to be part of real change. We still ask for your continued and dedicated support. the restoration of $250,000 in Youth Peer Support Initiative funding and $150,000 in Speaker Initiative funding for NAMI NYC will not only provide life-changing family support and peer services, promote recovery, and save lives, but it will also help remove the burden from city agencies to implement new programs with the same end goal as the programs NAMI NYC has already provided for over 4 decades. We also ask that you continue to hold the administration accountable for its mental health policy, funding commitments, and the matters raised in our extended version of our testimony. Despite the growing mental health crisis, the mayor's preliminary budget falls short of what is needed to thoroughly address this issue. We are particularly concerned about the lack of funding for family support services, cuts to youth mental health services, and the administration's failure to expand non-police mental health crisis response. Families are the first line of care, yet they often navigate the system alone. Academic research shows that when families are supported, hospitalizations decrease and recovery outcomes improve. With suicide being the second leading cause of death for individuals aged 10 to 24, it is unacceptable that critical base school services, such as the mental health continuum, were left out of the budget. This program, as everyone knows, provides crucial services for students and must be funded in the executive budget, not at adoption. Over 70% of mental health crisis calls in New York City are still handled by the police. We need a 24/7 citywide mental health crisis response program led by peers and mental health professionals, not law enforcement. $4.5 million is needed to staff Be Heard teams with these peer specialists. And additionally, Rikers remains New York City's largest mental health facility. This is a moral and policy failure. The city must commit to closing Rikers by 2027 and significantly invest in community-based mental health services. Thank you for the opportunity to testify, and please continue using us as a resource.
Nice, thank you.
Good afternoon, Chair Lee, Chair Shulman, and committee members. Thank you so much for allowing me to testify today. My name is Ashley Santiago. I'm a senior community organizer at Freedom Agenda and a member of the Campaign to Close Rikers. I'm also a native New Yorker. I'm from a low-income community in Queens, and I've seen for years how our city's budget continuously prioritizes systems of punishment, like Rikers Island, instead of systems of healing and true rehabilitation. My 23-year-old nephew, Michael, who has been diagnosed with autism and disruptive mood dysregulation disorder, was never able to access quality treatment, which led to many interactions with law enforcement, several psychiatric hospitalizations, and eventually 2.5 years on Rikers Island, where his mental health crisis was labeled as tantrums by correctional officers who responded to him with ridicule and abuse. His time in upstate prison afterward has created even more trauma, including extended periods in solitary confinement. At the cost of over $500,000 per person per year, New York has spent over $1 million to keep Michael at Rikers. Imagine if that money had been put in or invested in treatment to address the root causes of his behavior. Instead, my family and I will have to work even harder to help him heal from the trauma of incarceration when he does come home. In the written testimony I submit, I will include a detailed budget analysis from the Campaign to Close Rikers that outlines opportunities to shift resources from harmful, bloated agencies like the Department of Corrections to community-based care. Among those priorities, we are urging the council to allocate an additional $39.8 million to meet housing and mental health needs and fulfill commitments in the Close Rikers plan, including $4.8 million more in annual funding for justice-involved supportive housing, $22 million more to create more intensive mobile treatment teams, $7 million more to create more forensic assertive community treatment teams, $6 million more to open up 4 new crisis respite centers, and we also urge you to include the $4.5 million for 60 additional peer specialists to staff the city's multi-agency mental health and crisis response teams. And I'll just wrap up by saying the cost of these programs is basically nothing compared to the $150 million the administration plans to spend next year to hire 1,100 more correctional officers. When the Department of Corrections was asked why they would possibly need a staffing ratio that is 4 times higher than the national average, the commissioner replied that there are many people with serious mental health needs in their custody. Clearly, the priority should be on eliminating the shamefully long waiting list for people to access community-based care, not budgeting for more people to end up in Rikers. Thank you.
Thank you.
And the mayor's pushback of this mental health jail is disgusting and not a solution.
Yeah. Well, and also Rikers is third largest in the nation mental health institution, which is crazy. But I just want to say thank you to this panel always for your dedication, advocacy, and bringing the fire, especially Ruth. I love it. But yeah, no, I just want to say thank you to all of you, and having been part of many of your, and worked with a lot of your organizations, you really are doing the work. And I miss being on the board of NAMI. So hopefully I can come back after I'm done here. Thank you all.
Chair Lee, I would be remiss, I just wanted to mention when you were asking OMH about diversion courts, we do have diversion courts throughout the state, but we need to fund formerly known Treatment at Jail, or the Diversion Court Expansion Act. We have diversion courts throughout the state, only 150 participants, because we're still allowing judges and DAs to play gatekeepers, and also some charges just don't allow people into these programs.
And there needs to be more mental health professionals part of that too.
Exactly.
So I totally agree. So thank you all so much. Okay, next up, we have, I think, Rev Terry Troya? Okay, sorry, my bad. Allison Rosenthal, Anita Kwok, Faith Behum, and Anthony Feliciano. Oh, yeah. Okay. Is that everyone? Who are we missing? Oh, we'll eliminate as you guys introduce yourselves. Sorry. Okay. All right. Go ahead. Go ahead. You can start. Sorry. Oh, sorry.
Good afternoon. Anthony Feliciano. I'm Vice President for Advocacy at Housing Works. I won't take too much time because I have a very long testimony, but I will tell you that the work we do around ending the HIV/AIDS epidemic is more than ever under attack on the federal system here, and particularly our trans and our LGBT communities, but also Black and Latinx communities. One of the things that is that the local city can be the front line in protecting these communities. It's also about ending the epidemic initiative at $12.5 million. We're hoping that the F25 funding that was a little bit over $9 million by a total of $3.2 million to increase it to 12.5. This also includes the peer workforce initiative to increase effectiveness on the impact around our New York healthcare system, particularly around the stark disparities in terms of marginalized communities. I also want to bring up an important piece is the City Council enhanced the baseline funding for the Trans Equity Program initiative, supporting a range of services to help empower the transgender and gender non-conforming communities. And then I will add that we need to expand the baseline City Council viral hepatitis prevention initiative at 5.7. As obviously we have a cure, but we still have stark differences in terms of who gets the care from diagnosis to treatment. And then invest in our human service workforce. You heard this already around the COLA. And then I would add that the idea of the coercive subway suites, the involuntary removals, particularly we strongly oppose any effort to expand involuntary inpatient and outpatient commitment initiatives, and in particular any effort involuntary commit an individual based on determination of what has been called substantial inability of the person to meet his or her basic need for food, clothing, shelter, or medical care. We know that becomes code word for a bunch of other ways of marginalizing, criminalizing our communities. Thank you.
Thank you. I promise we'll look at it. And you weren't kidding. This is 13 pages, but I guarantee you there's a lot of good information in here. So thank you for providing this.
Hi. Thank you to the Health Committee Chair, Lynn Schulman, for holding today's budget hearing and for the opportunity to submit this testimony. My name is Allison Rosenthal. I'm a Chief Program Officer and Registered Dietitian at the Westside Campaign Against Hunger. We're an anti-hunger organization that for 46 years has been focused on providing access to healthy, fresh produce and direct benefit enrollments for New Yorkers in need. Last year alone, WISCA, or the West Side Campaign Against Hunger, provided over 5 million pounds of food to over 110,000 New York City customers, which included the distribution of over 3 million pounds of fresh produce, over 50% of all the food that we give out. Hunger continues to grow in our city, our state, and our country. This year, the USDA ERS report released that 1 in 8 New York households are experiencing food insecurity. This is an increase from 1 in 10 in the year prior. In conjunction with the dramatic 25% rise in food inflation from 2019, the pressure on direct providers to meet these needs is immense. Not only is it more expensive for families to shop for groceries at the store, but it's also more expensive for pantries like ours to stock our shelves with healthy and nutritious food. The need is growing, and we need more direct support to improve the nutrition security of our communities. Food insecurity is widely recognized as a social determinant of health and has an important impact on health outcomes and healthcare costs. This year, with the current federal policy environment, more families will become food and nutrition insecure. Health inequities will increase with communities that are already bearing a disproportionate burden of chronic disease, and they'll be forced to skip meals or consume lower-cost, nutritionally poor foods, further increasing the incidence of diet-related diseases like diabetes and heart disease. The Community Food Connection Program has been a significant source of food funding for WISCA. We ask that in this year's budget, that the city allocates $100 million for the Community Food Connections Program, and that be baselined into the budget. Thank you.
Thank you.
Hi, thank you council members for convening for today's preliminary budget hearing. My name is Anita Kwok, a policy analyst for United Neighborhood Houses. UNH is a policy and social change organization representing neighborhood settlement houses that reach over 800,000 New Yorkers from all walks of life. Our members provide a wide variety of mental health and substance abuse services to their communities, through which settlement houses have established themselves as critical partners in addressing the city's growing mental health needs. With communities continuing to experience increasing rates of anxiety, depression, isolation, and grief, it is more crucial than ever for the city to invest in mental health services. Today, I want to highlight 4 key priorities in the fiscal year 26 budget. 1, restore $32.26 million in the Council Community Behavioral Health Services. In FY26, UNH recommends the City Council restore all 12 of the previously funded DOH-MH mental health council initiatives, including Children Under 5, Geriatric Mental Health, and Trauma Recovery Centers. 19 UNH members provide services through the City Council mental health initiatives. To ensure these vital services can keep up with rising costs and quality services, we also urge the council to provide at least a 3% increase to match the citywide human services COLA. To create a $3 million restoration for the Youth Mental Health Initiative, this new initiative would provide flexible mental health services for youth programs run by CBOs such as Beacons and Cornerstones with the focus of out-of-school time. These funds could also offer supports for youth workers when dealing with mental health crises or creating proactive programming for mental health wellness. 3, invest $3.7 million to expand school-based mental health clinics so that each clinic can expand and maintain on-site mental health services for children during the school day, including psychiatric, family support, youth advocacy, and counseling. And 4, baseline $5 million in funding for the mental health continuum to fully implement and sustain the program. Please see my written testimony for more. Thank you.
Awesome timing. Go ahead. Go ahead.
Hi, good afternoon, and thank you, Councilmember Lee. My name is Terry Troy. I work for Project Hospitality in Staten Island, and for 40 years we've been serving street homeless people in the borough of Staten Island. I'm referring back to January 28th's Health Committee meeting, where Health and Hospitals gave testimony stating that, and I quote, $2.2 million from Attorney James' office via opioid settlement fund dollars had supported the mobile harm reduction teams known as the SHOW vans, Street Health Outreach Wellness, for health and hospitals. It said that there were 5 operational vans in the city of New York, and they quoted Bellevue, Lincoln, Woodhall, and Elmhurst. That's 4, not 5. The testimony says 5, but there's only 4 listed because the one from Staten Island that doesn't have a public health hospital was canceled on June 30th due to lack of funding. We were the 5th site. After 6 months of meetings with Deputy Mayor William Isom and with Health and Hospitals Dr. Ted Long and the Staten Island Borough President's Office trying to advocate to get this show van back instituted on Staten Island, we have gotten nowhere except an offer that they will give us a transport van so that we can take homeless people from Staten Island with addiction to Coney Island Hospital or Bellevue Hospital. It is not an acceptable offer. At that same January 28th Health Committee meeting, there was another $3 million that was allocated through opioid settlement money that would have sponsored additional services in Manhattan, the Bronx, and Queens, but not $1 to Staten Island through Health and Hospitals acquisition of the opioid money. I understand Staten Island is a challenge. We're the only borough in the city of New York without a Health and Hospitals hospital, and that makes the show van a challenge to run. However, it is unconscionable that Staten Island is penalized for not having a public hospital by not being able to get this additional service. We need it even more. The majority of homeless people on the streets of Staten Island with addiction issues are people without access to public health insurance. We lost 2 people in the 6 months that we have been advocating to get this service back. They could be alive today. Their lives mattered. Thank you.
Thank you so much. And actually, Staten Island does have one of the higher rates of opioid rates, if I'm not, incidences, if I'm not misunderstanding. And so that's why I totally agree. We will try to do as much as we can to advocate for that as well.
Thank you.
I know there's a lack of services there that we need to fill the gap for. So I appreciate all your work, and of course UNH, Housing Works, everyone. Just want to say thank you to this panel for all of your hard work. Thank you. I keep forgetting I'm doing this, sorry. Okay, so next we have Anna Krill, Laura Jean Hawkins, Maria Rodriguez, Gabriela Sandoval Rakina, and Eleanor Latouche. And we may need some translation services. Yeah. And thank you to our amazing translators for being here as well.
¿Vas a comenzar tú?
Sí.
Está bien. Vamos a hacer eso. Déjame leerlo bien detalladamente. Creo que no hay...
Whenever you guys are ready.
Sí,
But
está muy bien escrito. Vas a leerlo en español y yo lo voy a interpretar en inglés, ¿ok?
Ok.
Sí. Cualquier diferencia en nuestro español, tú me informas, por favor. Sé que soy de España, pero mi madre es latinoamericana también. Mi madre nació en Colombia.
Okay.
do you guys need more time, or should we start with sharing and caring? Yeah, let's do, okay. So you guys can start, we'll start on this end this time.
Oh, vamos a comenzar, está bien.
Good afternoon. My name is Laura Jean Hawkins. I am the Advisory Board Chair of Astoria Queens Sharing and Caring, Inc., DBA Sharing and Caring. I appear today as a woman who has been an ally of and advocate for the cancer community for over 2 decades. I'm also a woman who has had her own health journey with thyroid disease and endometrial hyperplasia, undergoing years of ultrasounds and biopsies. Fortunately, all of my tests through the years have come back negative. That is not the case, however, for many. There is currently a cancer epidemic in our state, our country, and throughout the world. Cancer is occurring in more adults considered healthy before their cancer diagnosis at younger ages, before they turn 40 or 50 or sometimes even younger. And in regard to breast cancer specifically, a recent study from Columbia University's Mailman School of Public Health has uncovered that the 5 states with the highest overall incidence of early onset breast cancer were Maryland, New Jersey, Hawaii, Connecticut, and New York. Why is this happening? No one knows, but researchers are on it. Until answers are found, however, the fact of the matter is that more and more people in our community are getting diagnosed with cancer, and more breast cancer and other cancer survivors are turning to sharing and caring for help. The increased demand for our services, which started during the pandemic, has stayed constant through 2024 and shows no sign of slowing down. Our council funding under the Cancer Services Initiative, however, has stayed flat for decades. My fellow board members and I are so grateful for the council's belief in our mission and longstanding support. The time for increased funding to the Cancer Service Initiative, however, is needed now to help groups like Sharing and Caring and others throughout the 5 boroughs. On behalf of my board and those served, thank you, and please support our funding request of $200,000. Thank you.
Thank you, Laura.
My name is Anna Krill, and I am a 2-time breast cancer survivor and founder and president of Astoria Queens Sharing and Caring, doing business as Sharing and Caring. I'm here today to urge the council to enhance funding to the Cancer Services Initiative and to fully support our request of $200,000. Sharing and Caring is a one-stop grassroots community-based organization which provides free bilingual supportive services to cancer survivors, their families, caregivers, and community members. We strive to reduce the fear and eliminate cultural barriers, to promote early detection and treatment, as well as to improve access to life-saving services. We reach approximately 4,000 individuals a year. We have served cancer survivors in and/or brought programming to 21 of the 51 council districts. The demand for our services, unfortunately, consistently since 2020 has risen, and there's no sign of slowing down. Our council funding, as Laura Jean mentioned, has remained the same. The fact that council discretionary contracts are not eligible for COLA increases, and the fact that New York State no longer provides matching funds to CBOs under the Cancer Services Initiatives, it is becoming increasingly challenging for us to continue to assist those living and coping with cancer. The time for increased council funding is now. I'd like to put a face to this early onset cancer. It is hitting younger and younger people. I want to share with you a current person that I'm working with right now. Next month, she will be reaching and celebrating her 33rd birthday. Her little son will also be celebrating his 2nd birthday next month. These are the young people that are coming to us, and they need a lot of support and help. I beseech you, please enhance our funding to the Cancer Services Initiative, and please fully support our request of $200,000. Thank you so much.
Thank you, Anna.
Good afternoon, Chair Lee, Chair Schulman, and Council Central staff. Thank you for holding this budget hearing and for the opportunity to testify on behalf of New Destiny Housing. My name is Gabriela Sandoval Requena, and I am the Director of Policy and Communications at New Destiny. We are submitting extended written testimony, so I'm just going to use this time to summarize the key takeaways. New Destiny is the only organization in New York that's 100% focused on permanent housing solutions for domestic violence survivors. We are the largest provider of supportive housing for survivors in New York State. We do this work because domestic violence is the #1 driver of family homelessness in New York City. It actually pushes double the amount of families into shelter than evictions. And access to safe and affordable homes often determines whether survivors leave their abuser and stay alive. Abuse has long-lasting detrimental effects on the physical and psychological well-being of survivors. Most people don't know this, but survivors can sustain traumatic brain injury more often than football players, yet they're rarely diagnosed. Supportive housing is one of the safest and most cost-effective housing solutions for survivors of domestic violence. As the federal government continues to threaten vital housing programs for survivors, this year more than ever, we need our city to step up and protect New Yorkers impacted by domestic violence. We're asking the city to invest in the NYC 1515 reallocation, as the Supportive Housing Network of New York proposes. By reallocating scattered units into the congregate, many organizations like New Destiny will be able to build more supportive housing for domestic violence survivors and more vulnerable New Yorkers. We're also asking the council to pass and properly fund Councilmember Farias Intro 26, which will require a training program for first responders and an awareness campaign regarding domestic violence-related traumatic brain injuries. Thank you, and I'm happy to answer your questions.
Buenas tardes. Gracias, concejales Lee y Schulman, por darme la oportunidad de testificar sobre el presupuesto anual de la ciudad.
Okay. Good afternoon. Thanks to all of you, Councilwoman Ms. Lee and Ms. Schulman, and thanks for giving me the opportunity to testify about the annual budget of New York City.
Mi nombre es María Rodríguez. Soy sobreviviente de violencia doméstica, integrante de Voces de Cambio, de New Destiny.
Continúa.
Inquilina de uno de los edificios de New Destiny.
Okay. My name is Maria Rodriguez. I'm a survivor of domestic violence here in New York. I'm a member of the organization Voces de Cambio, that means in English, changes in the voices of New Destiny. And also a tenant or a residence building that provide services to support the organization New Destiny.
Para mí y para mis hijos, el adquirir una vivienda digna significa tener un hogar seguro, confortable y en paz, donde podemos reconstruir nuestras vidas.
Okay. For me and my children to acquire or to get a new housing that's a deserted housing, a place that's decent to live. This means to have a home that's safe, comfortable, a home that we can live in peace, and a place where we can reconstruct our own lives.
New Destiny nos apoya a muchas familias como la nuestra con viviendas seguras, con todos los servicios esenciales.
The organization New Destiny gives support to all our families with very good housing, housing that is safe, and also these apartments and this special housing provide also with essential services as well.
Y nos brinda servicios de apoyo, trabajo social, psicología, consejero financiero y actividades recreativas para nuestros hijos.
And this organization offers support services, social working services, psychological services, financial advisor or financial advising services, and also recreation activities for the children, in this case, our own children.
Nuestras vidas dio un giro de 180 grados cuando nos mudamos a uno de los edificios de New Destiny, porque descubrimos que al tener un hogar en paz, nos está llevando a lograr nuestras metas y usar nuestros talentos.
Okay, our lives made a U-turn when we moved into the new building of New Destiny, because we find out that we can have a home where we can live in peace, and we can also, we will be able to achieve some of our goals, and also use our talents and also skills.
Es importante que la ciudad invierta en más viviendas para el sector vulnerable bajo programas NYC 1515.
It's very important that New York City invests in housing, especially for the vulnerable sector under the program NYC 1515. Councilwoman, I'm not sure maybe you know this program, NYC 1515.
Realmente somos personas que empezamos una nueva vida sin nada y hay muchos sobrevivientes con sus hijos en los albergues en espera de adquirir un hogar digno.
Yeah, honestly, we are people that will start a new life here, like any immigrant here in New York City, without nothing at all. And many of us, we are survivors with children who are living in basically shelters, and we are waiting to find a decent place to live and a place that is deserved for us to live in that decent housing.
Necesitamos que la ciudad asigne más unidades al programa NYC 1515 para organizaciones como New Destiny, que pueden construir más edificios como el mío. Muchas gracias.
Yeah, we really need that New York City assign new units, she means apartments, for the program NYC 1515 for organizations like New Destiny, so they can build new buildings like the buildings where we live. Thank you so much to listen to my speech, and Maria Rodriguez, and a survivor of domestic violence.
Thank you so much.
Thank you.
Oh, sorry, just to comment really quickly. So yes, I actually, when I was at KCS, there were a couple incidences that happened with breast cancer where the age was much, much younger. I think the woman was 18 actually. And so because of the insurance, it was very difficult to get her services. So I know work you guys are doing is important. And I just wanted to say to the New Destiny folks, thank you so much for sharing your personal story and for your bravery here today. And just so you know, a couple weeks ago, I introduced a bill at the city level where, and obviously there's a whole host of funding we need to pour into actual concrete programs, but we actually worked on a bill to introduce legislation that would require posters at nail salons, hair salons, to let folks know that for domestic violence and gender-based violence, these are the resources that you can go to, and so hopefully you guys are on that list. But we do want to bring that to the community and where women can go, just in case, in different languages especially, but in case they need help to learn where to go. So I just wanted to let you know that too.
Thank you so much for that, Council Member.
Thank you.
No, gracias.
Okay. She said thank you very much.
Thank you.
Next. Okay, next panel is Alice Buffkin, Tanasha Grant, Michelle Grier, Paula Magnus, and Arlene Cruz Escobar. So who's missing up here? Let's see. Alice Buffkin, okay. Tanasha Grant is not here, okay. Michelle Grier, not here. You're Paula? No, you're Paula, okay. And then Arlene, okay, got it. All right, go ahead.
Good afternoon. Thank you, Chair Lee, Chair Schulman, and committee members for holding today's hearing. My name is Alice Buffkin. I am the Associate Executive Director of Policy at Citizens Committee for Children. I'm going to focus my testimony today on issues that are critical for supporting the mental health and well-being of children and adolescents in New York. First, we are calling for the restoration of funding for the City Council's mental health initiatives. These initiatives have always been a backbone for community-based organizations. They provide a level of flexible but targeted supports that you really can't get from the state. But unfortunately, these initiatives experienced a cut of nearly $1 million in the fiscal year 24 budget, much of which was never restored. These initiatives include programs like Children Under 5, which funds mental health treatment for young children, and mental health services for vulnerable populations, as well as court-involved youth. We urge you not only to restore funding from previous years, but also to provide a 3% increase to match the citywide Human Services COLA initiative. I second want to thank the City Council for fighting to restore so many critical education programs in last year's budget. In Uplift, as you know, several mental health programs are once again facing cuts unless funding is restored. I'm grateful to Chair Lee for raising the mental health continuum, as several others on panels did today. That is obviously an incredibly important program. It has led to unprecedented collaboration between the three agencies running it and help support students with significant mental health needs. It's also going to be serving thousands of students through new mental health clinic partnerships. Unfortunately, the program will end in June if funding is not restored and baselined in the budget. I also want to draw attention to the importance of both community schools and restorative justice programs. Both are effective, proven models for addressing the social and emotional well-being of students while improving academic outcomes and reducing punitive practices, and both are at risk of reducing services without additional funding. And finally, I want to uplift the importance of school-based mental health clinics, which provide on-site mental health services to children. Again, thank you, Chair Lee, for raising this issue in some of your questioning. The current Medicaid reimbursement model is deeply insufficient. Medicaid doesn't cover services for children without a diagnosis, those without health coverage. Clinicians can't be paid to provide staff training or de-escalating. We are therefore urging city leaders to invest $3.7 million to enable up to 50 school-based mental health clinics to provide flexible, targeted interventions designed to complement the school-based mental health clinic model. Thank you.
Good afternoon and thank you. I'm Paula Magnus, Deputy Director of Northside Center for Child Development, a vital family mental health clinic and educational center serving an average of 4,000 at-risk children and their families a year in Harlem and throughout New York City. We know the stark reality. Thousands of New York City children are grappling with severe mental health challenges, as we heard a 56% increase earlier today. This is an under-recognized crisis that demands our immediate attention. A 2023 National Institute of Health study revealed alarming rates of clinical depression, anxiety, and profound loneliness among our young people, significantly impacting their daily lives and their potential. At our clinic, we witness these struggles firsthand every day. Since 2020, we have seen a dramatic surge in demand for our services. However, we face acute funding shortfalls across our programs. Increased funding is critical to provide at-risk children and families with high-quality mental health care they need, deserve, and we have been providing since 1946. Continued investment benefits not only the children and families we serve, but New York taxpayers, the Harlem community, and the broader economy by fostering a healthy, more productive population. We cannot continue these financial instabilities. We urge the city to recognize that investing in the mental health and well-being of our at-risk children is not just a priority, it is a fundamental responsibility. Specifically, Northside fiscal year 26 funding requests are to enhance our funding for our court-involved youth mental health, children under 5, and clinics in schools. It's essential. Thank you, council members.
Next, thank you.
Good afternoon, council members. My name is Arlene Cruz Escobar, and I'm the Director of Health Programs at Make the Road New York. On behalf of our 28,000 plus members and staff, I thank the committee for the opportunity to share our concerns. Make the Road New York firmly believes in safeguarding dignity and fairness across our society. Over the years, the council has done so much to ensure that New Yorkers continue to be a city that welcomes all. In the face of anti-immigrant attacks, budget cuts, and other assaults on working people, CBOs are working around the clock to meet the surge in need. Make the Road is scrambling to meet demands for services, including food access, connections to culturally competent medical care, benefit enrollment, and so much more. The city must, rather than undermine the critical services and funding for our diverse communities and protect New Yorkers of all immigration statuses. We ask the council to use every opportunity and tool to reverse the mayor's attack on immigrants and working class communities. The services that organizations like ours provide are essential. Amidst a historic housing, shelter, and cost of living crisis, we need to invest in communities, protect each other, and expand funding for critical services that people need to stay healthy. Failure to fund critical health initiatives would harm our community's health in moments when immigrant New Yorkers are most vulnerable. Many city council initiatives help the city meet urgent needs of immigrant New Yorkers by sustaining the services that Make the Road and other CBOs provide. We request the city council support for the following in fiscal year 26 initiatives and for Make the Road New York. including securing $300,000 under the Speaker's Initiative for wraparound legal, health, and educational services, plus $50,000 under the Speaker's Initiative for our trans immigrant projects for vital outreach to this extremely vulnerable community, and enhanced funding for Access Health Initiative, MACAP, Ending the Epidemic, Immigrant Health, and $50,000 for food pantries initiatives. Thank you again for standing up for these vital services that immigrant and working class New Yorkers depend on.
Thank you. Yes, Access Health MCAP, super, super important. And thank you for all the work that we know Make the Road New York does. And I wish y'all could see Alice's testimony, which is very colorful and nice, and I appreciate all the data every time. And of course, Paula, quick question: is that clinic that you're at Article 31? Is it an outpatient clinic? Okay, okay. Okay, perfect. No, so I just wanted to say I know and appreciate the hard work and challenges financially that clinics are facing in a time where we need more services. So thank you. Thank you all.
Thank you. Okay, the next panel is Fiona O'Grady, Mackenzie Aranda, Sheila Bennett, and Hank Oliver. No? Okay. Who do I have here? Sorry.
Fiona.
Bless you.
Fiona.
Oh,
Yeah.
okay. Well, no. Hold on. We're gonna get. Wait, it's filling in. Yes, no. Okay. We're gonna call up some people from the next panel so we can fill it in. So, give me a second. I'm sorry. You are. Okay. So fine. So we have the two of you. We don't have the others. Okay. So we're gonna call up Rohini Singh and Namer. Tahir or something like that. Not here? What? All right, so they want to testify together. It's fine, let's, okay, go ahead, you can start, sorry.
Good afternoon, Chair Lee, Chair Schulman. Thank you for the opportunity to testify. My name is Fiona O'Grady, and I serve as Director of Government Relations at the Samaritans of New York, the city's only community-based organization solely devoted to suicide. I'm also a proud member of the In Unity Alliance and echo Jihoon Kim's testimony. Every day, Samaritans is there for New Yorkers when they feel they have nowhere else to turn. Our free 24/7 suicide prevention hotline answers thousands of calls each month from people in every borough of every age and background, people who are overwhelmed, in despair, and often completely alone. The need for our services has never been greater. 1 in 3 New Yorkers experience symptoms of depression or anxiety. In 2023, over 41,500 suicide attempts were reported statewide. Suicide claims more lives in New York each year than car accidents, and our young people are in crisis, as was pointed out by Council Member Eric Botcher today. 14% of our New York City high school students reported attempting suicide in 2023, and that was, sorry, just having one moment. That is compared to 2021 and 2019, when it was 10%. Also, we're looking, which is a 56% increase and more than 50% higher than the national average. I'd also like to point out for students who are considering attempting suicide, we have an 18%, which again is higher than any other year since 2007, I believe. 1 in 4 African American females have seriously considered attempting suicide. 1 in 5 Asian, Hispanic, and white school children have considered attempting suicide, with 29% multiple race. I just want to say I echo all the words regarding increasing help for the mentally ill, and also that of our 7,000 Be Heard transports, that post-hospitalization suicide risk can soar up to 12 times, especially for those involuntarily admitted, maintaining this heightened risk for up to 5 years. And I wonder if they keep data on those who are voluntary versus involuntarily brought to the hospitals. Samaritans is doing the work for 40 years. We have a lean budget. Our volunteers contribute $800,000 of free labor, which then helps with your 312,000.
Can you summarize, please?
Yeah, that's it.
Oh, okay.
312,000 and a little bit of COLA for 3% since we're looking. Thank you.
Thank you. Next.
Good afternoon, and thank you for your time and for the opportunity to testify today. My name is Mackenzie Aranda, she, her, and I'm here on behalf of New York City Alliance Against Sexual Assault. The Alliance is a member of the Sexual Assault Initiative, a coalition of 5 sexual violence intervention programs that has built a citywide network of advocates, counselors, and providers serving thousands of survivors from under-resourced communities in New York City. Over the last 2 years, the Alliance completed a mapping project mapping the gaps in New York City's sexual violence response systems, revealing significant gaps in services and prevention programming for communities experiencing the highest rates of sexual violence. I'm here today to highlight those gaps and urge you to enhance the Sexual Assault Initiative at $5 million. Our mapping project informed us that more than 50% of survivors in New York City emergency rooms are not seen by a trained sexual assault forensic examiner, otherwise known as a SAFE. And this becomes increasingly true the further one goes from Manhattan. Many survivors are turned away from hospitals due to lack of trained examiners, and rape crisis programs struggle to maintain 24/7 advocate response services due to high staff turnover and insufficient funding. We also have reports from rape crisis programs with month-long wait lists for short-term counseling services, especially for survivors seeking services in languages other than English. The New York State Sexual Assault Survivors Bill of Rights mandates these services, yet gaps persist. We have survivor stories of high wait times up to 6 hours for SAFE examiners, survivors being transferred to multiple hospitals, and insufficient hospital staff training resulting in survivors dropping out of services altogether, or rape crisis advocates having to guide medical practitioners. With pediatric survivors being among the most impacted, these gaps have deeply traumatizing and far-reaching effects on survivors. The presence of SAFE examiners and advocates during medical and legal proceedings significantly improves outcomes for sexual assault survivors, reducing secondary trauma, psychological distress, and self-blame while increasing access to essential services. To build on these efforts and further strengthen survivor-centered responses, targeted investments in training, program expansion, and community-based interventions are essential. The SAI is currently funded at $2,075,000, and we ask for an enhancement to $5 million to ensure every survivor in New York City has access to comprehensive, trauma-informed care. Thank you for your time and for your commitment to this issue.
Thank you very much. Okay, Nick, go ahead.
Thank you for the opportunity to testify today. My name is Rohini Singh, and I'm director of the School Justice Project at Advocates for Children of New York. Each year, AFC works with students who have significant mental health challenges and who have been unable to access mental health services they need to be successful in the classroom. Many of our clients need additional mental health support, access to clinical mental health services, or school-wide behavior supports. And it is essential for our city to prioritize investments in programs and practices that support students. To this end, we urge the city to include the following investments in the budget: extend and baseline funding for the mental health continuum at $5 million, and add funding to enhance services at school-based mental health clinics at $3.75 million. Thank you to Chair Lee for highlighting both of these important investments today at today's hearing. The mental health continuum is a cross-agency partnership between New York City Public Schools, New York City Health and Hospitals, and the DOHMH. This innovative model is supported with $5 million in one-year city funding that was left out of the mayor's budget and is set to expire in June 2025. The mental health continuum supports over 20,000 students at 50 schools in the Bronx and Brooklyn, and for these services to continue, the funding must be continued in fiscal year 26 and baseline to ensure continuity of care. We urge the council to work with the administration to ensure that the budget includes and baselines $5 million for the mental health continuum. We are also asking the council to add funding to enhance services at school-based mental health clinics. School-based mental health clinics provide on-site mental health services to children during the school day, but most funding for these clinics comes from Medicaid, which does not adequately cover the range of services and supports that students and school communities need. Supplemental funding is needed to provide critical additional services. The city must invest and baseline at least $3.75 million to provide the additional resources that these school-based mental health clinics need. Thank you.
Thank you very much. Thank you to this panel. Thank you for coming to testify today. So, Nahima Dahir, Amy Zuchitai, Mohammed Razvi, and Kendra Hall. Thank you. Sorry, we still have a ton of people to testify, so please keep it to 2 minutes. Thank you. Go ahead.
Thank you, Chair Schulman and Chair Lee and the committee for the opportunity to testify. I'm Amber Song from the Asian American Federation, representing over 70 nonprofits serving 1.5 million Asian New Yorkers. I'm speaking today alongside our Asian American Mental Health Roundtable partners. Asian Americans continue to face rising challenges due to anti-immigrant policies and ongoing waves of anti-Asian hate. These stressors have exacerbated mental health needs and increased pressure on community-based organizations, or CBOs. Without culturally competent CBOs, Asian New Yorkers would face even greater vulnerability and isolation. AAF's expertise in this area is rooted in years of mental health-focused work. Our highlights from fiscal year 25 include that we published 2 major research reports and 3 research briefs on Asian mental health, poverty, hate crimes, and civic engagement, served over 2,000 low-income Asian New Yorkers through education, resource sharing, and roundtable convenings, testified at over 15 city and state hearings advocating for Asian community social services and mental health access, as well as supported the city's Asian American mental health investment initiatives, such as DOHMH's recent investment in expanding mental health care access to the New York City Asian American community through its RFI in September 2024. AF, along with our roundtable partners, submitted recs to ensure the needs of Asian-led, Asian-serving CBOs and that they are prioritized. In fiscal year 26, we plan to expand our mental health work by partnering with 6 Asian-led CBOs to expand clinical and non-clinical mental health services for diverse Asian subgroups, enhancing online resources by growing our online mental health resources hubs, social media campaigns to ensure these tools reach the community, rehosting the Asian American Mental Health Roundtable with 15 organizations to strengthen policy advocacy and resource sharing, and develop education programs to decrease stigma around mental health, upskill nonprofit staff in mental health care, and advocate for greater public and elected official investment in Asian mental health. We specifically request funding to sustain this work, $200,000 for the hate crime prevention through community-based solutions, $100,000 for the Immigrant Mental Health Initiative, and $150,000 for culturally and linguistically relevant mental health services for vulnerable Asian populations. Thank you so much for the opportunity to testify today.
Thank you. Next.
Thank you. Thank you for the committee. Thank you, Chairwoman Schulman. My name is Mohammed Razvi. I am the Executive Director and founder of Council of People's Organization. I run the largest Muslim Arab South Asian organization in Brooklyn. We serve about 45,000 clients annually. During COVID, we were servicing over 30,000 clients weekly. The reason I'm here is because I'm here to support this initiative because we are one of the few who actually have a mental health counselor on site, but we don't have enough resources. We are barely doing it, and most importantly, it's just we have a waiting list over hundreds and hundreds of kids also and domestic violence victims who actually need the counseling. It is more and more difficult to provide those services as we are moving forward in this time, especially with all this rhetoric that's happening with immigrants and all these individuals who are being, I guess, scapegoated. The most important thing is the people who we are servicing, especially the people who are on our food pantry line, we have seen a decrease only because people are so afraid. And their friends are actually coming on the line and saying, can we pick up this grocery bag for my friend? She didn't come this week because she's afraid. We actually have an emergency go bag, which actually has information where a person, a family member, has to have a guardianship to a friend just in case they get picked up. These are the things that the people are going through and the kids. We desperately need you to support this. Thank you so much.
Thank you. Appreciate it. Next.
Hi, good afternoon, Chair Lee, Chair Sherman, and the whole committee councils. My name is Suchi Amy Tai, and I serve as the co-deputy director at Garden of Hope, a linguistically and culturally competent services to the Asian community, with a primary focus on the Chinese immigrants and Chinese Americans in New York. While we are widely recognized for our work with survivors of domestic violence, human trafficking, hate violence, and other traumas, we also provide mental health services to the broader community. I'm here today as a member of AAF Asian American Mental Health Roundtable to speak to the urgent mental health needs of New York Pan-Asian community. It's one of the organizations in the roundtable where 50% of those served are Chinese. Garden of Hope plays a key role in reaching this population through trauma-informed mental health care. According to AF 2024 Mental Health Support, language access is the most significant barrier to care, 83%, and 67% identified cultural stigma as a major obstacle. And many Asian community members trust CBOs like us for mental health services due to the cultural understanding and safety we provide. At Garden Hope, we have seen how culturally specific language accessible mental health care can change lives. In 2023 alone, we provide trauma recovery services to 1,071 adults and 317 children and youth, with 94% of our adult clients having limited English proficiency. And with a team of 18 bilingual staff, and most of us are licensed mental health counselor and social worker, we deliver culturally relevant care. And now we just urge the city to increase funding for Asian-led community-based organization to expand mental health services. Thank you.
Thank you. Next.
Good afternoon, Councilmember Schulman, Councilmember Lee, and members of the committee. My name is Naima Dahir, and I'm here on the behalf of the Arab American Family Support Center. We provide trauma-informed, culturally competent social services to the growing Arab, Middle Eastern, North African, Muslim, South Asian communities across New York City. Last year alone, we served over 20,000 individuals, offering support in more than 30 languages. As members of the Asian American Mental Health Roundtable, we are here today to highlight the urgent mental health needs of New York's Pan-Asian and immigrant communities. This year, the Roundtable is advocating for increased funding for community-based organizations to expand and sustain their mental health services. These resources are critical in addressing disparities in mental health awareness, service accessibility, and the availability of culturally competent providers. At AAFSC, we ensure low-income individuals receive therapy in culturally competent settings where clinicians understand their backgrounds and speak their languages, removing one of the biggest barriers to care. Beyond mental health, the Arab American Family Support Center provides wraparound services including domestic violence case management, housing navigation, legal services, and food distribution, ensuring that community members receive holistic support. However, just as demand is surging, federal funding freezes and delays have created unprecedented uncertainties for our mental health and our domestic violence programs. The Arab American Family Support Center alone faces potential 1.1 million shortfalls amongst the 80% increase in referrals to our mental health programs. At the same time, escalating federal immigration enforcement has left many of our community members living in fear, afraid to access critical social services or even leave their homes. We have expanded our mental health, legal, and outreach services in response, but we urge the Council to continue to support organizations like ours as we do this really critical work. We highlighted some of our budget requests in our testimony, but thank you so much.
Thank you. Next.
Thank you. Thank you for your courtesy, and thank you to the chairs. I really appreciate you staying with us through this long day. My name is Sarah Fajardo. I am the Senior Director of Community Engagement and Advocacy for the Korean American Family Service Center. KAFSC is part of the Asian American Mental Health Roundtable, and we work to empower immigrant survivors of gender-based violence with a focus on culturally and linguistically competent services. Our clients face barriers to accessing the support they need due to language, culture, and stigma, particularly in times of mental health crises. I want to express KFSC's strong support of dedicated, specific, targeted funding to expand mental health services capacities for organizations like ours and other members of the Roundtable. Mental health crises must be met with care, compassion, language access, and cultural understanding, and programs like ours require additional support. For Korean Americans and other Asian immigrant populations, the success of mental health programs requires significant investments in cultural competence and language. KFSC offers clinical and non-clinical modalities. For example, we include a haebak, or meaning revival in Korean, program that includes art, education, and body movement workshops to help process racial and gender trauma. Participants build community, embark on personal healing journeys, and create public art displays. This initiative aims to foster renewal and reemergence for those affected by anti-Asian hate and misogyny and welcomes survivors of gender-based violence. You've heard a lot of testimony today, so I want to thank quickly DOHMH for their efforts to expand mental health care for NYC's AAPI community, including the September 2024 RFI. We hope to see the city invest further in these life-saving services through dedicated funding and partner with organizations like ours to create a more inclusive, responsive mental health care system. Thank you.
Thank you. Are you testifying? Okay.
Good evening, everyone. My name is Kendra Hall, and I'm a social work intern with the Ali Forney Center. We provide housing and related services to LGBTQ+ youth who live in New York City. Our agency provides mental health care to over 1,800 young people per year. With the current onslaught of chaos from the Trump administration, it's a really scary time to be queer, trans, or unhoused. Our clients are living in constant uncertainty, and it's really taking a toll on their mental health. We would like your financial support in expanding our residential treatment model to reduce barriers to mental health care for our clients who are currently living in Ali Forney Center housing. Through the residential treatment model, social workers and mental health therapists work out of housing sites so that clients can receive therapy in their own home and so that mental health professionals can be on site should any crises occur. We introduced the residential treatment model to AFC Housing in 2021, and we've had success in staffing social workers part-time at housing sites. We would like your support in making this available at all AFC housing sites 24/7. We all know that crises rarely happen in 9 to 5 hours, and having on-call mental health professionals on site, especially during our overnight shifts, will protect clients, prevent burnout among Ali Forney Center staff, and will reduce the need for police and EMS engagement calls. This support is needed now more than ever, especially since we're facing funding cuts from other sources, and we appreciate your support to make this possible. Thank you.
Thank you. Before you leave, hold on. Mohammed, a question for you. Who's your council member? Is it Brannon?
My council member is Farrah Lewis.
Oh, Farrah Lewis. Is she helpful to you guys?
She's extremely helpful.
Okay. Do you do work with the New York Immigration Coalition also?
I sit on the board, yes.
Okay. I didn't realize that.
Yes.
No, because I work
Yeah.
closely with them too.
Oh,
Murad
great.
is a good friend, yes.
Oh, that is wonderful.
And I also wanted to mention to you that even in my district, I have a principal who told me that she had parents coming to her with their citizenship papers to prove that they belong here, which is not a good thing. And she said, you don't have to show me anything, but that's where we are. So one of the things that I'm looking to do is to work with, actually, I'm going to be working with the Hispanic Federation. I'm going to call the principals in my district to see if we can do a Know Your Rights for them, so.
That is so great.
Yeah.
Thank you.
So I just want to let you know.
Yeah, definitely. Great.
And just wanted to say, I know, I will be very brief because Chair Schulman's going to cut my head off, but because I keep delaying it. But I just want to say I miss being in the trenches with you guys. I love all your organizations. Amber and the Federation in leading the charge with a lot of these organizations. So thank you for all of your hard work and offering the culturally competent, linguistically competent services, which we so desperately need. And are you a social work intern for your master's degree? Okay, please stay in the field. We need more social workers. Please don't leave. We need more social workers, so don't go anywhere. But I just want to thank Mo, all of you guys. Like you guys are doing the tremendous work, and we love you guys. And so one thing I want to say for the record, though, is that this happened the last time in 2016 and I know this is your former ED, Joanne Yu's point that she makes, which is that a lot of our immigrant communities, because they were fearful of getting deported, because when that whole public charge incident happened, they got off food stamp benefits and a lot of other public assistance, and they still have not been able to get back on through HRA. And so that's another issue I just wanted to highlight that I know you guys are working on with the Federation as well as your organizations, and that's something we need to keep paying attention to, so thank you.
Thank you. Thank you to this panel. Okay, next panel, Martha Neighbors, Michael Schnall. Michael's still here. Evie? Is Evie here? Hansopoulos. No, I know Evie. Angel Hernandez. Sergeant, can you just move, because, okay, so who, all right, so,
Sure.
Okay.
Hi, I'm Mike Schnall. I'm with Brooklyn Botanic Garden. I'm here with my Botanic Garden colleagues. They'll introduce themselves. I'm the Director of Government and Community Affairs at Brooklyn Botanic Garden, and thank you for the opportunity to testify today. Nowhere in the city's ResOC document is there a dedicated baseline source of funding for accessibility. For the first time ever, Brooklyn Botanic Garden is joining New York Botanical Garden, Queens Botanical Garden, and Snug Harbor Cultural Center and Botanical Garden in seeking fiscal year 2026 support for our work to create accessible spaces, programming and events, signage and digital accessibility, training for staff, and vital resources to maintain and improve accessibility for all. Our botanical gardens are essential, and they contribute uniquely to the city's ecosystem, culture, and community, and serve as vital and educational cultural hubs that enrich the urban experience. Since there's no current single citywide initiative in the New York City budget that addresses the city's commitment to accessible botanical gardens, we're here today to present the Rooted in Accessibility Initiative, a new citywide initiative that would fund the gardens for $1 million, $250,000 each, to support the city's botanical gardens. If this funding were given to us, it would provide funding to increase the number of dedicated staff, increased dedicated programming, increased hosted events for children and seniors, improve and increase professional development for garden staff, and allow us to redesign and improve signage and wayfinding beyond the standard ADA compliance. So we're here today to ask for your support, thanking you for the opportunity to testify, and we'd be happy to take any questions. I'll pass it off to my colleagues.
Good afternoon, Chair Lee, Chair Schulman, and members of the committee. I am Angel Hernandez, Director of Government Relations for the New York Botanical Garden. Thank you for granting us this platform and for your ongoing support for accessibility programming at our institutions. As stewards of some of our city's natural green spaces, NYBG stands with its fellow coalition partners today to advocate for the creation of a new citywide initiative called Rooted in Accessibility. This important initiative will be a special funding opportunity in fiscal year 2026 to enhance and expand accessible programming at each of our botanical gardens. Since 1891, NYBG has been revered as one of the last vanishing oases of tranquility amidst a growing metropolis. Yet, as populations grew over the years, so has the demand to meet the needs for citizens with an array of disabilities. And it presents challenges for the garden to maintain sufficient resources to ensure adequate attention for this special demographic. This is why NYBG, with our coalition partners, seek an allocation of $250,000 each from the $1 million total funding for the Rooted in Accessibility Initiative. New funding provides the following potentials for expansion and enhancements for expanding our ASL tours, more memory care sensory tours, also the same for touch tours, working with groups with neurodivergence, intellectual and developmental disabilities, more early morning sensory events, and more multi-sensory tables for new exhibitions and annual staple events like our Holiday Train Show and Orchid Show. In addition, new funding through the Rooted in Accessibility Initiative would provide necessary training, whether it be led in-house or by outside consultants, for both staff and volunteers. Also, our partners with our borough's District 75 schools, senior centers, and local VA hospital, for example, will benefit them for this newly funded initiative. Therefore, we ask for your support in creating the Rooted in Accessibility new initiative to allow us resource and ability in this remarkable endeavor. Thank you.
Thank you. Next.
Hi, good afternoon. My name is Evie Hanzopoulos. I'm the Executive Director for Queens Botanical Garden. Thank you, Chair Schulman and Chair Lee, for providing us this opportunity to discuss our work and our desire to make all of New York City's botanical gardens as inclusive as possible. I'm here also to provide testimony in support of Rooted in Accessibility, a proposed new speaker initiative, which will enhance the ability of cities' botanical gardens to provide access to disabled populations and support positive public health outcomes. So Queens Botanical Garden is located on 39 acres of city-owned land in downtown Flushing and is the place where people, plants, and cultures meet. We serve approximately 300,000 visitors each year, including a significant number of older adults, as well as children, youth, and adults with disabilities of all kinds. I believe we all can agree that New York City prides itself on being an inclusive city. And when we speak of inclusivity, it's critical that we think not only of categories such as race, ethnicity, religion, gender identity, etc., but also inclusivity in terms of abilities, age, and mental health. Too often, accessibility is an afterthought or only considered when there are legal mandates, even though 11% of New Yorkers have a disability. So I'm here today with my colleagues from New York Botanical Garden, Brooklyn Botanic Garden, and Snug Harbor to advocate for inclusion in the FY26 budget for Rooted in Accessibility. We are requesting a total of $1 million or $250,000 per garden, which will allow us to increase the number of dedicated staff leading accessibility initiatives, event for families and seniors, programming for those with autism, developmental disabilities, Alzheimer's and dementia, and more. I'm just going to speed ahead just for the sake of time, but we know that nature is healing, and we know that there are positive public health outcomes when people have access to green space and gardens, whether they be physical outcomes, mental health outcomes, developmental, or cognitive outcomes. So we thank you so much for consideration of our collective request. Thank you.
Thank you, Evie. Have you testified yet today?
I did testify earlier on Martha Neighbors with Snug
You
Cultural
can't
Center.
testify twice.
Just
Oh, you're here for support.
Here for
Got it,
support.
got it, got it. Abby, thank you. I screwed up your name before. I'm sorry.
She actually waited too.
Okay, no, that's great. Thank you.
Thank you.
very much. Thank you.
All right, next. Schlemit, Levy, Katie Mui, and, oh, Sarah already, oh wait, she testified today. All right, let me see from, is Sheng Chen here? No? Going once, twice? Huh? Sheng Chen? Nope, okay.
Coalition for Asian American Children.
Coalition for Asian American Children. Okay, so come up to this panel. Emily L., Korean Community Services Society. Emily Lee, sorry. Okay. So, all right.
Chair Schulman, sorry. Alex Park is the next on the list, and he's from the same.
All right, Alex Park, you want to come up? So then we have all of you. Okay, great. Okay. You may start.
Thank you, Chair Lee, Chair Schulman, and committee members for hosting this hearing. My name is Sherry Chen, and I'm the Health Policy Coordinator at the Coalition for Asian American Children and Families, or CACF. We're the nation's only Pan-Asian organization advocating for Asian American Pacific Islander children and families, and our coalition consists of over 90 members and partner organizations across the state. We also lead the Access Health NYC initiative, which is a community-based organization-driven program that tackles the AAPI community's barriers to healthcare access. On behalf of CACF, I urge the Council to include increasing funding for Access Health to $4.5 million in the fiscal year 2026 budget in order to better support community-based organizations outreaching to harder-to-reach AAPI New Yorkers to ensure that they can access the care that they need, and to fund the crucial public health pieces from the People's Budget, the first being allocating $55.1 million out of the $61 million for the Fund from Crisis to Care for the expansion of mental health services. This includes expanding intensive mobile treatment teams at $22 million and funding the Mayor's Office to End Domestic and Gender-Based Violence at $6.3 million to support microgrants and specialized support for survivors. I want to highlight that these services are crucial as individuals with mental health conditions are 16 times more likely to be killed by law enforcement officers. And in 2024 alone, police killed 8 Asian Americans and Pacific Islanders, and 5 of these individuals were in need of mental health support at the time of their deaths. Secondly, we support expanding safe havens with a $100 million annual allocation in order to open 4,000 beds over 5 years, providing medically appropriate housing for unsheltered New Yorkers in a safe and supportive environment, and supporting a 166-bed mental health and substance use housing plot. These crucial public health investments and the Access Health NYC initiative are essential for building a healthier, safer, and more compassionate New York City. And because of this, I urge you to fully fund these priorities. Thank you for your time and consideration.
Next, thank you.
Good evening. My name is Emily Lee, and I'm a project coordinator at Korean Community Services. First, thank you for the opportunity to share our story. Since 2014, KCS has been part of the Hepatitis-Free New York City Coalition and dedicated itself to prevent hepatitis B through widespread free testing, education, and providing culturally competent patient navigation services. In the past 11 years, we screened over 4,250 people and identified over 200 positive Hep B patients. The vast majority of the community members we serve are Asian Americans of immigrant backgrounds, low income status, limited English proficiency, and uninsured or underinsured. Over 314,000 New York City residents are currently infected with chronic hepatitis B and C. Given this statistic, it is crucial to sustain and grow the viral hepatitis prevention initiative to address this largely overlooked health crisis. I kindly ask the Council to provide $4.24 million to the Viral Hepatitis Prevention Initiative in FY26 to expand the capacity of Hep B and C organizations to continue providing free screenings and streamlining medical care access. Increased funding is necessary for us to achieve New York City's viral hepatitis elimination goal by 2030 to prevent liver cancer and disease. Secondly, KCS is seeking $85,000 for the Immigrant Health Initiative. Despite declining New York City smoking rates, Asian Americans still face higher smoking rates compared to other ethnicities, and smoking remains a leading cause of death. For the current fiscal year, KCS referred 12 smokers to quit lines and provided free nicotine patches and lozenge to 30 clients. I want to thank the Council's commitment to health equity for all New Yorkers and ask for their continued support in reducing various health disparities among New York City's immigrant communities. CBOs like KCS have long-standing ties with the community and are well positioned to deliver essential services to them. Thank you.
Thank you. Next.
Good evening, Chair Lee, Chair Schulman, and the committee. My name is Katie Moy, social work student and policy intern with Supportive Housing Network of New York. We are a membership organization representing over 100 nonprofits operating more than 40,000 units of supportive housing in New York City. Thank you for the opportunity to testify today. We'd like to thank the Council for its support of our New York City 1515 reallocation proposal, and we ask that you work with us to codify and fund the proposal in fiscal year 26 and beyond. The city has exceeded its 7,500 unit target for congregate supportive housing, but Scattersite has fewer than 1,500 units awarded, leaving over 6,000 units left. Our proposal calls for reallocating the majority of these units to develop and preserve congregate supportive housing. Again, thank you for the $115 million for New York City 1515 in the City of Yes. This is a critical step. We're asking for an additional $307 million in capital to develop and preserve about 950 units, $45 million to cover the cost of essential service and operating for new development, and $27 million to align the operating subsidy for all existing New York City 1515 units with current HPT standards. We are also here today to show support for Councilmember Brannon's Intro 514, which require interest to be paid on late payments under city contracts with nonprofit organizations. Currently, 5 of the largest supportive housing nonprofits in New York City are collectively owed over $318 million by the city, with $150 million stemming from prior fiscal years. Providers across the human services sector are experiencing similar situations, putting supportive housing units at risk of closure and re-entry into the private market. Finally, we ask that the Council to continue supporting these critical mental health programs. The JISH program, with an additional $4.8 million in funding, Be Heard crisis response teams with $4.5 million to ensure well-paid peer responders and peer specialists, the intensive mobile treatments team with $22 million to provide care to clear the wait list of people seeking vital mental health support. Thank you for your time and leadership.
Thank you. Next.
Good evening, Chairs Lee and Schulman, and esteemed members of the Committees on Mental Health, Disabilities, and Addiction and Health. My name is Shlomit Levy, and I serve as the Project Director for the Center for Justice Innovation's Brooklyn Felony Diversion Programs, which include Brooklyn Mental Health Court and Brooklyn Felony Alternatives to Incarceration. The Center for Justice Innovation works to provide responses to harm that give individuals the tools they need to thrive in community. Access to mental health treatment for all, whether in the courtroom or in the community, is absolutely critical. Our approach to mental wellness focuses on identifying the needs of the person and addressing underlying issues with evidence-based, trauma-informed practice. We work alongside communities to foster healthy responses to stress, trauma, and exposure to violence. Approximately half of people in the city jails have some kind of mental health diagnosis, and at least 1 in 5 individuals are dealing with a serious mental illness, making the criminal legal system the de facto provider of treatment, despite being ill-equipped for this role. Brooklyn Mental Health Court is New York City's first mental health court and addresses both program participation treatment needs and community public safety concerns, and is presided over by our dedicated judge, Judge Demick. Through 2024, over 1,400 participants have received treatment, satisfied program requirements, and graduated, and success is evidenced by a reduction in rearrests and convictions. Recent council investments have allowed us to hire a dedicated youth engagement social worker who leads our youth programming and fosters close relationship with our participants. Renewed funding will enable us to strengthen our youth-focused programs, provide meaningful activities to our participants, and continue essential training for staff. Thank you for the opportunity to testify today. A very long day. We look forward to continuing our partnership with Council and to make a meaningful difference in New Yorkers' lives.
Good evening. My name is Alex Park, and I'm a project coordinator at Korean Community Services. First, I want to thank the council members of the Health Committee for their commitment to ensuring the health of New Yorkers and giving us the opportunity to speak on behalf of our community. Access Health New York City is a citywide initiative that allows CBOs like KCS to help individuals access quality health care. Through this initiative, we are able to provide education, outreach, and assistance regarding health care and coverage. With the support of Access Health New York City, we have also expanded health fairs, enhanced outreach efforts, and conducted more healthcare-related presentations. During our current fiscal year, we have successfully assisted 313 senior individuals with access to health care and continue to fill in the gaps of our strained healthcare systems. As a project coordinator, I assist senior individuals with Medicaid, Medicare, and other state-funded assistance program needs. Working directly with these individuals, I witnessed firsthand the fear and uncertainty they face under the current administration's changing policies. With Medicaid, Medicare, and other essential programs at risk, so too is the health and well-being of those who rely on them. This uncertainty extends beyond their physical health. It impacts their mental health as well. When people are forced to live in fear and doubt about their access to health care, it hinders our ability as a CBO to foster an inclusive and supportive community. This challenge is even greater for senior residents who face language barriers, which leave them isolated and neglected. Access Health is essential for educating and assisting marginalized New Yorkers on how to access health care and coverage. The federal proposal to cut health care funding is expected to affect access to care for 8.6 million New Yorkers. Not only is this concerning for the community residents who rely on these programs, it is also putting operational stability of hospitals, clinics, community health centers, and long-term care facilities at risk. Therefore, it is critical that we advocate and protect the city's healthcare funding. We kindly ask the City Council to include $4.5 million for Access Health New York City in the FY 2026 budget to continue to support and fund our organization so that we can do our job in assisting low-income individuals have access to healthcare. Thank you.
If I may, I just wanted to say shout out to KCS, my former nonprofit that I led for 12 years. I miss you guys. Shlomit, thank you for the work you're doing because it's super, super critical and important. And I think we need more folks advocating in that area for sure. And of course, awesome CACF for leading all these organizations. And Katie, same advice, please don't leave the field, okay? You gotta stay. Thank you.
Thank you.
Thank you to all of you. Okay, next panel, Lawrence Norman. Ann Casper, Amy Eng. Is Amy Eng here? No? No? Okay. Marcus Jackson. Is Marcus Jackson here? No. Okay. So it's you two guys.
Right.
All right. Lawrence, go ahead.
There this thing don't move. Good now evening, committee. My name is Lawrence Norman. I'm the program manager for Bedford-Stuyvesant Family Health Center Wellness Department. Oversee the programs of viral hepatitis, Access Health, and ETE programs. And everything that they've said all day was true. We do need a lot of funding because not only am I program managing these types of programs, I'm also assistant program manager for the disease prevention grant as well. It goes to show we're tiny but mighty crew, but we do need more funding to be able to meet the competitive nature of this field with getting people that are educated to enter inside of our arena as well. It's not just about outreach, it's about community. And a part of that community is having them educate people throughout this process. And for me, if I educate a person, because I'm also the educator of the clinic too, I educate people on HIV testing, outreach, all the different strategies, and I also educate the directors, the supervisors. It doesn't matter who it is. That's one of the many hats in which we have been forced to wear because of the many years of not having the exponential growth in our funding and a competitive salary for people to be able to train. It takes about 6 months to actually train a health educator. And if we don't get more people to educate the folks, the ones in which we have, I do believe, actually may have to go away because the cost of living is a bit too high. And I advocate for those people because all day my people have been advocating for people that need services. Well, the people that actually do the services need the service as well. And with that, Tom, I thank you. And I would like to say one thing too. Thank y'all for staying so long. I loved it. I loved the whole thing. This was so nice. I love this. This was the best one.
Chair Schulman and Chair Lee, thank you very much. And you saved the best for last, so very good. I'm Ann Casper. I am a failed mental health patient in New York City. I came in last year, a year and a half ago, on Medicare. I've been on Medicare since 2008. I didn't have health insurance for 20 years. As adjunct faculty, my health insurance was a pre-existing condition, so I'm used to living without much. But I came to New York City and I couldn't figure out your system. I spent 7 months looking for Medicare plans and calling, and I thought Fountain House would help. So I went to Fountain House, became a Clubhouse member. 7 months didn't help me. I would like to ask for a Clubhouse Accountability Act. I think we need clubhouses, wonderful. I helped start in Portland, Oregon 18 years ago. But we need some accountability here. So I would ask for a citywide ombudsman. If you're going to spend millions on clubhouses, we need somebody to call to keep those clubhouses accountable, and outside of the clubhouse would be better. Staff actually don't understand. They hire a lot of young people who don't know the traumas we've been through, because those of us who have been in mental health systems for years and years, been through a lot of traumas. I've been in it since the 80s. They need to be trained on what traumas we have. They need training in trauma-informed care. And also they have to understand the mental health microaggressions that they do unknowingly to us because they don't understand. If they're writing notes and they have no mental health training, where are those notes going? Also for teen space, I think about it, the health information technology. If the teenager goes to Teen Space today, gets something written up, and Teen Space gets, Talkspace, the parent company gets sold to somebody else, 30, 40 years, what's going to happen to those notes? I have a lot more to say, but as a failed mental health patient, I don't know, I've got to go on to a different role. Thank you.
No, you are not a failed mental health patient.
Anyway, I did want to say, too, in Portland, Oregon, we started the ECIT, Enhanced Crisis Intervention Training, and I think that could work in New York City. It's a group of police who actually choose to work with people with mental health issues. We should do Be Heard with peer support. Actually, CCIT came into Portland to help me get peers hired on Portland Street Response. I thank New York City for helping out with that. We need peers there, but also until then, gradual change is best. And it's going to take time to change over to non-police response. I want to thank the New York Public Police Department for what they do every day. 50%, at least 50% of their calls are mental health, and they're doing well every day. We need to look at the positive as well. And they didn't go to that job to become social workers. They want to get the quote-unquote bad people. So let's let them do what they do, and we do the best. And thank you for listening, and have a good dinner.
Thank you very much.
Yes.
Okay, the next group is Tesoro Estrella. Nope. You're here. Okay, great. Rebecca Zahn? The Armory Foundation? Okay. Yanis, rather. Can't read. Coho? Yes, no? Yes. Oh, you're here. Okay. Alexis Archer? And I can't read the first name. The last name is BAH, I think, or the Armory College Prep. Oh, you're here. Okay, great. Okay. Go ahead.
Hello? Oh, perfect. Good evening, Chair Lee and Chair Schulman, and esteemed committee members. My name is Tesoro Estrella, and I am the Outreach Assistant for Every Voice Choirs. I want to take a moment to share my testimony about Voiceability, a choir program created by Every Voice Choirs that caters to the needs of children ages 7 through 17 who have disabilities. I have witnessed transformative impact of this program on its participants and have heard families of its singers say over and over again that Voiceability provides a truly unique opportunity for children with disabilities to engage in performing arts. Voiceability offers a creative and nurturing environment for children to explore their musical talents while building connections with their peers. The program is led by experts in music education, music therapy, speech-language pathology, and ensuring that all the children develop their musical skills and social abilities in a supportive setting. Participants are not only take place in EVC's formal concerts and venues like Merkin Hall, but they also have their own dedicated recitals that feature each individual child. One of the most compelling aspects of Voiceability is its commitment to addressing a critical gap in our community. Many traditional choir programs do not accommodate children with disabilities, leaving them underserved. Voiceability fills the void with expert teachers who utilize adaptive techniques, ensuring that every child can thrive in a welcoming atmosphere. And our program serves students across 15 council districts. The impact of our program is documented in annual evaluations that outline each student's development in multiple areas. Witnessing the growth of these children musically, functionally, socially, emotionally, serves as a powerful reminder of the program's effectiveness. Many students remain with Voiceability for several years, and some go to join other choirs in our EVC family. Voiceability is not just a choir. It is a life-changing program that empowers children with disabilities and cultivates personal growth and fosters community. I hope you recognize the importance of the program, and I ask that you look to support our proposal for citywide funding. Thank you.
Thank you. Next.
Is this on? Oh, okay. Chair Lee, Chair Schulman, and esteemed committee council. Good evening. My name is Ruliatu Ba. I use she, her pronouns, and I am a high school senior attending the Bronx Collegiate Academy that's proud and more than honored to serve as a voice for our community. On the topic of community, as we all have come to acknowledge, the city is known for being diverse and full of a plethora of ideas, yet with so many bustling voices, not everyone has a platform to be heard. Throughout the first bouts of my high school journey, I didn't really understand where I belonged or even if I belonged somewhere to begin with. There was nothing presented to me besides my studies, and while I could try to find the threads of my identity within the narratives of my English class or find my true values with the problem sets of my algebra homework, nothing brought me content. This can take a toll on a teenager's mental health, especially during one of the most transformative periods of their life, and is very significant. Luckily, in my case, I found the Armory College Prep program and STAR CGI, where I had a chance at both higher opportunities and a platform to learn from my closest peers, no matter what we wanted to share with one another. This experience has shown me vital importance of investing in mental health through nonprofit organizations, where they create spaces where every voice can be heard and valued. No matter if you're 58 years young or like me, 17 years old, you can agree that by funding such nonprofits, we're not just investing in mental health services, we're investing in the future of our communities. We're giving people, especially young people, the tools and support they need to thrive, contribute, and become active members of our society. I urge this council to prioritize funding for mental health nonprofits. It's an investment that will yield returns in healthier, more engaged citizens and stronger communities. With all I shared, I hope that both the committee and audience remember that teenage minds aren't blind. Instead, they are kind to change, to hope, and to the safety provided by nonprofits. Sure, we may live in the Big Apple, but are you, the committee, going to support teens in bearing and expressing the fruits of our knowledge? Thank you for your time.
Thank you. Next.
Okay. Hello, my name is Rebecca Ja, and I am a student at the Army Foundation. Thank you for the opportunity to speak today about the critical role nonprofit plays in supporting mental health and why additional funding is essential for our communities. I have personally experienced and seen the impact of nonprofits everywhere I go. My siblings and I went to an after school called Kips Bay Boys and Girls Club from elementary to middle school. It was a place for us to hang out after school and learn new and many things. This is a place where my sister picked up her love of basketball and got to practice these skills in the open gym. It's a place where I found my love of dancing. All these things are something you don't get to see and practice at school for more than 45 minutes. And having a place where you can practice for as long as you want with support and someone to teach you how to get better is very fundamental for us and the community. Keeping kids off the streets after school and giving them a place to freely express themselves. I urge you to consider increasing funding for youth-serving nonprofits like Kips Bay Boys and Girls Club, D4 for students in K through 12, the Army Foundation that helps track stars through high school and college, and Star CGI for girls and females to learn more about the world and the power we hold to change it and upgrade it. Investing in mental health support through nonprofits is an investment in well-being and future of our communities. Thank you for your time and commitment to supporting young people. In closing, mental health support is not a luxury, it is a necessity. Nonprofits like Kips Bay Boys and Girls Club, Star CGI, DFOI all play a vital role in ensuring young people have access to the care and support they need. With additional funding, we can continue to provide safe spaces, mentorship, and critical resources that truly change lives. I appreciate the opportunity to share my experience and advocate for increased support. Thank you.
Thank you. Next.
Okay. Hi, everyone. My name is Alexis Archer, and I'm here representing the Armory Foundation. And I just wanted to take some time to speak on mental health and how the Armory has helped me improve myself as a person. I first had joined the Armory College Prep program in 9th grade, a little freshman. I didn't know much at first. From the outside, it seemed like a very serious program. They're talking about helping you through SATs, college, any homeworks that you have, just really talking about your future path. So you would think it's something very serious, very strict, very, let me sit down and really focus. But really going through that program, I realized it was something different. It was more of a community and a very warm space versus of what I had expected. For example, last year, I'm not gonna lie, I had a really hard time. I was very depressed. I was walking around just sad, not smiling. That's not me at all. And going to the Armory, I thought it was just a program, like it's just something where let me go here, let me finish, let me do my work, and then go home. But really, the people there, they're very warming and helping. They're not just, they don't see you as just a number or someone who needs to be here to improve attendance percentages. They see you as a real person, and they're really there for you to help you. And I see that with a lot of after-school programs. People are really quick to say negative things about after school. Oh, I want to go home after school. I don't want to do that. But really, it'll give you a sense of a second home almost, because you're at school for so much time anyway. So going to these after-school programs, like, they'll really give you a sense of home and warmth and love. They know your name. They're curious about your life. How was your day? Is everything okay? Things like that. And I really appreciate that. And I think that the Armory itself and other after-school programs should be recognized for that. And I'll forever be appreciative. Thank you.
Thank you very much.
Good evening, Chairman Lee and Chairman Shulman and the committee members. My name is Yanis Cotto. I use they, them pronouns, and I'm the program coordinator for partnerships and Star CGI at Power Play NYC. I'm also a born and raised New Yorker that struggled with mental health issues throughout my entire teenage years. So I am walking testimonial of the impact of programs like these because I'm still here. As a program coordinator at Power Play NYC, as well as a former community center assistant director and classroom teacher, I have seen firsthand how our youth are showing up with increasing mental health needs. They're navigating trauma, isolation, and anxiety in a world that often is, and are often seeking support and having their struggles and the severity of those struggles overlooked. Through our work, we provide not only community and social emotional support, but also mentorship and civic engagement opportunities that allow them to heal, find direction, and thrive. However, our work is at risk. Nearly 50% of our funding comes from federal sources, now threatened by shifts in national DEI priorities. This year alone, we lost a $25,000 foundation grant intended for Black girls, pulled abruptly due to these changes. We cannot rely on unstable funding while the need for action to help answer the call of our youth's needs. PowerPlay empowers over 1,000 youth, specifically young women, specifically Black women, across all 5 boroughs with sports mentorship, leadership development, and also we serve as a lead agency for STAR CGI, a coalition of 10 nonprofits like PowerPlay and the Armory Foundation, which reaches more than 6,000 youth annually. Together, we create a safe, affirming space where young people, especially girls of color, can build confidence, tenacity, and community, as you see before you. We urge you to fully restore and enhance STAR CGI funding to $2 million, PowerPlay's portion being $600,000, and this would ensure we can continue to serve, save lives, and hopefully expand our reach to communities like District 16, where the need is the greatest. In this moment, we have the power to change how youth is supported in this city. When we invest in youth during a time of rising fascism, we're investing in the possibility of a brighter future of the city that we all dream of. So thank you for your time and continued support. And I'm very proud of my students. So
We're very proud of them too. Have you spoken to the Women's Caucus chairs?
I believe PowerPlay is kind of in the beginning processes of that, yes.
Yeah, because that's Julie Menon is a co-chair and Carmen De La Rosa. So if you have any problems reaching out to them or anything else, please contact the committee staff and we'll help. And we want to help you guys with whatever we can to be supportive of you. Okay.
Thank you so much. We really appreciate that.
And I just wanted to give a special shout out to you, Yanis, for bringing these amazing young women here today to testify. Because I have to say, oftentimes it's the youth's voices that are not part of the conversation. So I just want to commend you all for being here and being part of this process. Because Lord knows, when I was in high school, I was not doing this stuff and coming and testifying. And Alexis, your smile made me smile, so thank you for that earlier.
Thank you.
But no, I just want to commend you for bringing them here and also for you ladies testifying. It was really encouraging to hear that. And of course, arts, music, therapy, huge fan of that. So we need more of that too. So I just want to thank you all.
Thank you.
Scott, you get your solo panel.
Wow, and then there was one. Good evening, Chair Schulman, Chair Lee. Thank you very much for giving me the opportunity to testify here today. My name is Scott Daly, and I'm the Senior Director of the New York Junior Tennis and Learning, NYJTL. For the past 50 years and more, we've developed the character of young people through tennis. We thank the City Council for their partnership throughout this time. In the last 55 hours, I've listened to everything from breast cancer, autism, developmental disabilities, PPG and Y, hepatitis, everything. And all the presenters were top shelf. And these were all worthy and admirable causes. NYJTL is no less admirable or worthy. We provide health benefits, physical, mental, social. The population that we serve is in the city, over 10,000 kids each and every year. 75% are 10 years of age and younger. We give them a safe haven, 75% of these youth are Black, African American, Latino, or Asian. 80% of the families that we serve are low income, according to the AMI statistics of New York City. This year we are seeking $1 million from the council in its physical education and fitness initiative. This is an increase of $200,000. If allocated, it would be the first increase in 17 years. Over 17 years, minimum wage has more than doubled. Permit fees have tripled. Our cost for equipment is over 250% more. Bus transportation is up. We don't get any COLA increases either. It's been a long day, and I want to thank you all. I just want you to know that we need your continued support. NYJTL and the city and the kids that we serve. We couldn't do it without you. It's been a long day, and I want to thank you all.
Thank you very
for your
much.
time and your patience. Thank you. Good seeing you.
Thank you.
Bye-bye.
Good. Christopher, you're the last one.
Oh, no.
Yeah.
Oh.
Judge, I ran here, so I gotta go back.
Good night, guys. Thank you again.
Good night.
Ready?
Yeah.
Hello, Chairs Lee and Shulman. My name is Christopher Leon Johnson for the record. I am calling on the City Council to preserve funding for all clubhouses. I used to go to Rainbow Heights, Rainbow Hill Club. I used to see a therapist in that same location. I think it was on Flatbush Extension. Now it's on Elm Street. Please correct me, anybody here. They need to keep their funding. All these clubhouses need to keep their funding. It keeps a lot of people out of trouble. It keeps a lot of people out of trouble, guys. I know that for sure. I didn't have the luxury of going to Rainbow Heights to deal with all the stuff over there because my insurance never covered that. But I think that's kind of federal insurance. But the city council need to make sure that the insurance are able to cover if you see a shrink for serious psychiatric disorders, to be able to use this. If the club, let's say, let me see, if I see a therapist inside the same place where the clubhouse is at, I should be able to use the same club. I should be able to use the service clubhouses are able to be utilized too. I was able to use that. I was able to utilize my insurance was able to cover it. Only advantage I ever had was the seed was inside those clubhouses. Only advantage I ever had. But they need to make that change within the insurance policy because a lot of people like me can only use it via insurance, and that's the situation. But yeah, the clubhouse need to be saved. All clubhouses need to be saved. There shouldn't be a debate. This is one of the instances in mental health outreach that needed to be preserved in the city council budget, even in the executive budget. So thank you, chairs Lee and Shulman, for fighting for the people that go serve in clubhouses in the city of New York. But like I said, I don't know how long that's going to take, but they need to fix that. I don't know if it's a state issue or a federal issue, but if I see a shrink inside of a clubhouse, I'm not a member of that clubhouse, but I should be able to use the same services that are able to use because I gotta go do the same thing, check with security, all type of stuff like that. But yeah, at the end of the day, this need to be reserved in the budget. So shout out to everybody that was fighting to keep their clubhouses open. Because without this money within the budget, it's not going to work. So I know you got to go, but thank you so much. Thank you.
We
Cannot agree with you more.
Yeah, thank you.
And Anna, I like your idea about
All right, so
accountability.
we will now move to Zoom testimony. Please wait for your name to be called to testify, and please select unmute when prompted.
Daniel, do you have the panels?
Andrea Arcilla.
Starting time.
John.
Madam Chairs and members of the committee, I'm here today to ask that you prioritize New York Edge's fiscal year 2026 citywide funding requests. We are seeking $250,000 under the Council's social and emotional supports for students initiative. SEL is integrated into every element of our programming. We are, as identified by Mosaic by ACT, the largest after-school provider in the national in the nation offering SEL supports. This funding will enable us to support our current SEL programming, providing high-quality, evidence-based social and emotional learning assessments, curriculum, and resources for all of our partner schools, our students, and their families. We are also seeking $1.2 million under the Council's After-School Enrichment Initiative, an increase of $200,000 over last year. This would be our first increase in 16 years. New York Edge is the largest provider of school-based after-school and summer programming in New York City, serving 33,000 students in over 100 schools throughout the 5 boroughs. Our mission is to help bridge the opportunity gap among students and underinvested communities. Core components of our program include STEM education, social emotional learning and leadership, visual and performing arts, sports, health and wellness, academics, and college and career readiness and summer programs. Council citywide funding has enabled us to enrich and expand our school year and summer program and has allowed us to develop and implement new, unique, and engaging programs such as our award-winning student-led podcast formative, our public publishing program, our Heart for Art program, our partnership with the Van Gogh Museum in Amsterdam, and Read Across New York Edge program. New York Edge, its students and families are extremely grateful for the Council's 33 years of support. Together, we are guiding students so that they grow up healthy, happy, and empowered. Together, we are creating the next generation of active and productive community members and problem solvers. Together, we are creating New York City's next
Your
generation
time's
of
expired. Thank you.
You have to just summarize your end. Hello?
Yes.
Just summarize the ending, because we have a lot more people to testify, so we're keeping it 2 minutes.
Thank you. The time has come, however, where increased funding is vitally needed. Our city council funding has remained at $1 million for the past 15 years, despite the fact that we have tripled in size and have significantly increased the number of children served.
Okay.
We are now looking to meet the needs of the next generation of people by supporting our fiscal year 2026 funding requests.
Okay.
Thank you so much.
Thank you. Danielle Gerard.
Starting time.
Can you all hear me?
Yes.
Thank you. My name is Danielle Gerard. I'm a senior staff attorney at Children's Rights. Thank you very much for the opportunity to testify, Chairs Lee and Schulman. We're a national organization that advocates on behalf of youth in state systems here in the city on behalf of young adults on Rikers. We know mental health is an issue near and dear to Chair Lee. In June 2024, we submitted a public comment to the Board of Correction regarding the law banning solitary confinement, which includes a great deal of research regarding youth brain development and the criminalization of mental health. We would like to highlight one of the points we make in that comment and some of the accompanying data. Mental health is integral to overall health and well-being, especially for adolescents, shaping their development and influencing their responses to stress and social interactions and supporting healthy decision-making. The lack of investment in community mental health services results in police and agents of other punitive systems responding to children and youth experiencing psychiatric distress rather than trained behavioral health personnel. As a result, youth with mental health conditions are more likely to be arrested and incarcerated than those without mental health conditions. Nationwide data show that 70% of incarcerated young people present with a diagnosed mental health condition compared to 18 to 22% of all children once involved in the child welfare or juvenile legal systems. Youth who are Black or brown, LGBTQ+ and or living with a disability disproportionately face the most profound mental health challenges. Young people themselves describe the child welfare and juvenile legal systems as traumatic, and youth who experience these systems often have poor mental health outcomes. The criminalization of mental health is a direct result of the lack of investment in community mental health services. We urge the Council to stand firm in supporting our communities, especially when it comes to the health and well-being of all our children and youth, incarcerated or not. We refer you to our written testimony for ways to reallocate the mayor's proposed budget for Rikers Island to work toward achieving this goal. Thank you for this opportunity to testify.
Thank you very much. Edmund Loy.
Starting time.
Good evening, Chair Shulman and Chair Lee, members of this joint committee. My name is Edmund Loy, and I'm testifying on behalf of the Charles B. Wong Community Health Center. We are a federally qualified health center with locations in Manhattan and Queens. In 2023, we served approximately 59,000 patients, 79% of whom were limited English proficient, and 90% of whom had household incomes at or below 200% of the federal poverty guideline level. Our health center remained open throughout the COVID-19 pandemic, and we worked hard to maintain many of our health and outreach programs. This was only possible in part because of support from City Council discretionary funding, and I'm testifying today to ask for continued support of several initiatives so that we can continue to serve vulnerable New Yorkers. The Check Hep B program under the Viral Hepatitis Initiative provides culturally and linguistically competent health education, patient navigation, and care management services for New York City residents with chronic hepatitis B. In New York City alone, an estimated 254,992 people were living with the disease in 2023. At our health center, 1 in 8 adult patients have chronic hepatitis B. If left unmonitored and untreated, hepatitis B can severely damage the liver, potentially causing liver failure or liver cancer. The Check Hep B program has a strong record of success, with around 97% of participants completing a hepatitis B medical evaluation through this program. Additionally, through the Access Health and Immigrant Health initiatives, we provide education to the Asian American community about health insurance coverage, aiming to increase vulnerable New Yorkers' access to healthcare services. Lastly, through the Cancer Services Initiative, we increase awareness of risk factors, symptoms, and treatment options for breast and colorectal cancers. The City Council's continued support will ensure cancer screening access through patient navigation for several hundred members of the Chinese American community, many of whom are uninsured and face numerous barriers to healthcare. Just want to close off by saying that with continued funding and resources, our initiatives can continue to address the health disparities and inequities experienced by the
Your
communities
time's
that we serve.
expired. Thank you.
Just give a summary of your end. Go ahead.
I'm just about done. Just thank you for your time and thank you for the opportunity to testify.
Sure. Thank you very much for testifying. Jane Nee.
Starting time.
Hello, good evening, everyone. My name is Jane Nee. I'm the Assistant Director of Policy at the Community Healthcare Association, New York State. We are New York's primary care association, representing more than 80 federally qualified health centers, including Charles V. Wong and Callan Lord, and Housing Works, also known as Community Health Centers, serving 1 in 8 New Yorkers across the state. On behalf of Jaquanis and New York City's health centers, I thank the New York City Council for convening this vital preliminary budget hearing on health. So in New York City, community health centers serve more than 1.3 million patients at 490 sites across the city. We are nonprofit, community-driven clinics providing essential primary preventive care, regardless of someone's insurance status or ability to pay, making community health centers a cornerstone of New York City's healthcare safety net. And as the primary care safety net for New York City, health centers are essential to improving health outcomes for communities throughout New York City. And so increasing investment in health centers and primary care will help New York City meet its potential in preventing disease, catching health issues early, etc. It also means prioritizing prevention efforts so that we can reduce the number of emergency room visits on an already overburdened system. And an increased investment, like everyone else has mentioned, cannot come at a more significant time. In the past 2 decades, health centers have expanded their services to include supports like addressing social needs. But despite this expanded role, rising costs from operation to workforce are far outpacing health center reimbursement rates that were set more than 20 years ago. An analysis by Urban Institute showed that health center costs are on average 44% higher than the maximum allowable Medicaid reimbursement rate. And this ever-growing challenge has already led to site closures and layoffs at health centers across the city. And more difficulties may perhaps lay ahead for our health centers. And so we request the council to protect and support our health centers' role as a primary care safety net by prioritizing funding and workforce
Your
initiatives.
time's expired. Thank you.
Just, you can summarize the end. Go ahead.
Thank you. That lift up health centers, including supportive legislative priorities at the state level. So our patients count on us. Can we count on you? Thank you.
Thank you very much. Jason Cianciato.
Starting time.
Hello, Chair Shulman and Lee. It's good to see you again. Thank you for the opportunity to testify. I'm submitting written testimony that includes a lot of detail, including program metrics, keeping ourselves accountable to the incredible work that the City Council enables GMHC to do through discretionary initiative funding. I do want to draw your attention to one of those initiatives and one of our funding requests, the Trans Equity Initiative. There's been a very important community dialogue over Which organizations should receive TEI funding, what their leadership structure should look like in terms of trans representation, and how to go about divvying up those funds. As a cis white gay guy, it's not my place to be a part of those determinations for that community. What I can share is that 5% of GMHC's clients in 2024 were transgendered and non-conforming, non-binary, or questioning. That's a much higher percentage relative to their representation in the New York City population overall, which ranges between around 0.5 and 2%, depending on who you ask. Many organizations who receive TEI funds are using them to hire trans-identified staff, including GMHC, the case managers in GMHC's TGNC&B hub, which the TEI funds are also transgender. And loss of funds would mean loss of services that may not be available to clients until new services ramp up. I also want to briefly discuss the impacts that we're seeing of the federal actions against immigrants, TGNC&B people, and others targeted. We are seeing folks who are disappearing from our housing, folks who are immigrants, folks who are not turning up at their HIV medical appointments because they're afraid of being deported.
Your time's expired. Thank you.
Just give a summary, Jason.
Thank you very much for your continued focus on these populations affected, including the new initiative that you created to provide support to folks affected by these immigration actions. I think that we could have some dialogue about what New York City and New York State could do should these cuts come down the pike, and I'd love to be a part of it with you. Thanks again, and have a wonderful evening.
Thank you. Okay, Justine Tedder?
Starting time.
Good evening, Chair Lee, Chair Schulman, and esteemed members of the Committee on Mental Health, Disabilities, and Addiction, and also the Committee on Health. My name is Justine Tedder. I'm the Director of Policy and Advocacy at Lennoxville Neighborhood House. The Neighborhood House offers several mental health programs targeted at addressing a full range of mental health symptoms in those living with various disorders, including a women's mental health shelter, supportive housing residents, a social adult day program, a caregiver program, and mental health services as part of our Early Childhood Center's family services. And as a licensed mental health counselor and an advocate for improved mental health treatment, I urgently request that you increase investments in mental health services for our community. City agencies like DOHMH and DFTA have successfully implemented clinic-based services for individuals who seek mental health treatment, as well as psychoeducation on disorders and intervention. The Neighborhood House's implementation of mental health support is not a typical clinical setting. Our work provides mental health services to all age groups and maintains a person-centered model. This work has shown us that mental health treatment for your constituents can be based on community centers, older adult centers, after-school programs, support groups, and churches. And these spaces foster socialization and can reduce long-term suffering among vulnerable populations. Additional investment in mental health services in the community can in turn assist with decreasing overall costs of emergency care, add additional support for vulnerable populations like New Yorkers experiencing homelessness, displacement, or impacted by co-occurring physical health conditions, and highlight the need for continued support from city agencies and other corners of community care. And we hope that the committee members consider prioritizing sustainable funding for this method of community mental health treatment citywide, as the Neighborhood House actively strives to be proactive in our response to mental health crises. Thank you.
Thank you very much. Lily Shapiro?
You may begin.
Thank you. Good evening, Chairs Lee and Schulman and members of the committee. If there are any left, I can't see from this far away. My name is Lily Shapiro, and I'm Policy Counsel in the Fortune Society's David Rothenberg Center for Public Policy. Thank you for the opportunity to testify about the need for greater investments in and access to supportive housing through increased funding for the Justice Involved Supportive Housing Program and the passage of Intro 1100. We all know that supportive housing is a proven solution to homelessness, mental health challenges, and repeated incarceration, but we must fully invest in it and expand access. First, we need to ensure that the city fulfills its commitment to bring online 380 more units of JISH with increased adequate service rate funding, because 33% of people entering our jails are unhoused at the time of admission. 21% have a serious mental health diagnosis and remain on Rikers twice as long as the overall average length of stay. And we know that supportive housing like JISH works. A 10-year follow-up study of the FUSE program, which was the JISH precursor, showed that 63% of participants had 0 additional encounters with jail or shelter after an initial stabilization period, which is a remarkable success rate for people who had been cycling in and out of jail, the streets, shelters, and hospitals. Over 5 years, the city saved $45,000 per person in publicly funded jail and shelter costs. And if everyone who had been eligible could have been enrolled, the city would have saved $45 million. So besides being a huge win for individual well-being and community safety, it is clearly the fiscally wise choice, especially since now housing one person on Rikers now costs over $500,000 annually. In FY25, the City Council provided $6.4 million in discretionary funds to increase service rates for the 120 operational JISH units, for which Fortune is very grateful as we operate half of them, but that did not solve the problem of expanding the program as intended to a full 500 units, which is why we are asking for an additional $4.8 million annually as a line item in the DOH&H budget to increase the service rates for the remaining 380
Your time's
units.
expired. Thank you.
So I would
You can
refer
finish, but just finish
Thanks.
up quickly.
Yep, will do. Refer you to my written testimony about the related need to pass Intro 1100, which would expand eligibility for city-funded supportive housing programs. And I would thank you so much for the opportunity to testify today and for your leadership on these issues. Thank you.
Thank you.
Thanks, Lily. It's Linda.
Maral Abis.
Starting time.
Hello, everyone. My name is Maral. I'm the Health Partnerships Coordinator at the Coalition for Asian American Children and Families, or CACF. And I'm here today to urge the Council to increase funding to $4.5 million for Access Health in the coming budget. With this addition, Access Health can increase its critical health education and outreach to New York's most hard-to-reach communities. And this is critical, especially now that those who are immigrant, undocumented, limited English proficient, and struggling with poverty are increasingly disconnected from and fearful of the approaching public health system. Access Health is a citywide initiative that supports 37 community-based organizations, and it's led by 4 key agencies, one of which is CACF. Access Health supports community organizations whose critical health services are being threatened by the federal administration. A CACF study done in partnership with DOH&H in 2019 found that over 80% of organizations reported that they had clients who opted out of multiple government benefits during the first Trump administration, as immigrants are worried that utilizing health benefits could disqualify them from a family member. Our organizations challenge these chilling effects by providing language-accessible, culturally responsive, and accurate information. Access Health also allows our organizations to pivot their funding. For example, our orgs were critical during the COVID-19 pandemic, and at a time when there were no funding increases, our organizations shifted their limited resources to vital health outreach programs around COVID. Our orgs are vastly underfunded for the important work that they do. Our organizations also hire local community members who uniquely recognize and respond to their community's needs and strengths. And through their deep-rooted presence in the communities, our organizations possess insight into their population's needs and strengths, which therefore increases their engagement and service utilization, making them effective. Therefore, I'd like to add that an enhancement to $4.5 million can ensure that the city can better target challenging health needs through trusted community-based support. I've also mentioned multiple statistics to kind of provide some background to Access Health that we're submitting in a written testimony. But thank you.
Thank you. Nadia Chait.
Starting time.
Good evening, Chair Schulman and Chair Lee. I'm Nadia Chait, the Senior Director of Policy and Advocacy at CASES. We serve over 12,000 people annually across a range of programs, including being the largest provider of mobile mental health treatment teams in New York City, with 7 intensive mobile treatment teams and 9 assertive community treatment teams, including several that focus on serving folks with legal system involvement. I'm here today to support the Crisis to Care investment, specifically the $22 million for IMT. I think many of us have seen what many of our clients experience on their worst days. So I want to share what happens when folks actually get access to service and care. And so I want to talk about a recent client, DG. He's been with one of our IMT teams for about 8 months now, and he was referred to us due to repeated episodes of aggression, a long history of mood disorders starting when he was quite young, and repeated challenges with engaging in mental health treatment. In the 8 months in our care, we've been able to connect him to supportive housing. He's enrolled in college classes at Berkeley College. and is working toward his goal of having his own clothing brand. He's been able to build community connections, particularly important for him as he has a strained relationship with his family. We've linked him to job training, and he's continued to meet with us and engage in mental health treatment services for the longest stretch for which he's engaged in mental health care in a very long time. I also want to share a little bit about Nicholas, another client of ours in an IMT team. Nicholas just started classes at the Borough of Manhattan Community College in January of 2025. We have another client who is just one math test away from finishing their high school equivalency exam. This is the result. This is what can happen when we support people and when we engage them in services that are actually meeting their needs and working with them every day. This is what works. It's not the involuntary.
Your time's
removals on the
expired.
subway.
Thank you.
Just give a summary of your closing.
That's Fund IMT, Fund Act. Thank you.
Thank you. Okay. Jennifer Parrish.
Starting time.
Good evening. My name is Jennifer Parrish.
okay.
I'm the Director of Criminal Justice Advocacy at the Urban Justice Center Mental Health Project. Currently, about 57% of the jail population has been assessed as needing mental health treatment. That includes about 1,400 people diagnosed with serious mental illness. With adequate community resources, we could significantly reduce that number. And I want to highlight a couple of investments that we need. One of those is justice-involved supportive housing. It's critical to ensuring that people with serious mental illness and criminal legal system involvement can obtain that housing. Last year, the council supported it, and we urged the city to invest and appropriate $4.8 million in annual funding. This would allow the city to fulfill its commitment to expand JISH to 500 units. We also need additional funding for intensive mobile treatment and forensic assertive community treatment teams. Earlier in this hearing, DOHMH was asked about the waiting list for that. They did not provide the information, but we know that people wait for months and months to receive these services. People who are incarcerated but qualify for these teams would be so much better served in the community. But DOHMH has not prioritized connecting incarcerated people with these teams during incarceration. Doing so would not only provide for continuity of care when the person's released, but it could also reduce the amount of time people with serious mental illness are incarcerated. We asked the council to allocate $22 million to create 15 more IMT teams and $7 million to create more forensic assertive community treatment teams. Finally, New York City needs a crisis response that does not include police. We support CACIT NYC in calling for a baseline allocation of $4.5 million to ensure competitive compensation for peer specialists to staff the city's mental health crisis response teams. By reallocating just a fraction of the Department of Corrections' $2.87 billion budget, we can easily fund these services. Simply by eliminating the department's uniform vacancies, the city would save 149.
Your time's expired. Thank you.
You can summarize.
Thank you. We can and will close Rikers Island, but we need to make community investments to do so. Thank you very much. Thank you for your time.
Thank you very much. Juan Pinzon.
Starting time.
Good evening, Chairs Shulman and Lee. I'm Juan Pinzon. I'm the Director of Government Relations at the Community Service Society, and today I'm testifying in support of funding for the Managed Care Consumer Assistance Program and Access Health NYC in the FY26 budget. In my written testimony, I also talk about the restoration of Article 6, the enactment of the Fair Pricing Act, and I want to thank you, Councilmember Shulman, for your advocacy on these two issues. I know that you mentioned that you're planning to introduce a resolution in support of the Fair Pricing Act, which is great. New Yorkers are angry and frustrated with our healthcare system, as you know. In addition to navigating a dysfunctional healthcare system, they're also seeing how their premiums and out-of-pocket expenses keep rising, which forces many to postpone preventive care. And we recently conducted a statewide healthcare affordability survey that found that 60% of New Yorkers experience at least one healthcare affordability burden in the past year. In 2019, we did a similar survey, and that number was 59%, so it's getting worse. And the survey also found that 80% of responders worry about affording healthcare in the future. So this is why we need programs like MACAP to help our most vulnerable populations across the city navigate our healthcare system, including resolving claim denials and medical billing issues. Since 2020, MACAP has assisted over 17,000 clients to secure coverage and medically necessary care, saving them nearly $1 million in healthcare-related costs. Our current network of 12 CBOs is not enough to cover the entire city. We're leaving many residents who are not able to access services on the ground, particularly in Brooklyn and the Bronx. So increasing funding for MACAP is critical to ensure that New Yorkers have a place to turn when dealing with a claim denial, with a medical bill, or any other issue accessing coverage and care.
Your time's expired. Thank you.
Just summarize, Juan.
Thank you. And today's political realities also make the need for MACAP all the more pressing, as you know. So we urge the City Council to consider increasing funding for MACAP to $2.3 million and also increase Access Health NYC's allocation to $4.5 million. Thank you so much.
Thank you very much. Okay, thank you. I want to thank everyone who has testified. If there's anyone present in the room or on Zoom that has not had the opportunity to testify, please raise your hand. Is anybody raising their hand online? No, you have to look. Okay. Faith Bahum, Tanisha Grant, Michelle Greer, Shania Banat, Hank Oliver, Kendra Hardy, Amy Eng, Marcus Jackson, Janine Guariga, Natcha Kubash, Irina Kurashiva. Okay. Seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. With that, I want to thank Shirley. Do you want to say anything in closing? Or are you good?
No, just thank you, everyone.
Okay. I want to thank everyone who testified today. It was a very long hearing. I want to thank Chair Lee for hanging in there and the staff as well. And with that, I will now close the preliminary budget hearing for Department of Health, OCME. What was it? What? Sorry. No, I said DOH, yeah. So anyway, I want to, sorry, it's late. DOHMH, right. I want to thank everyone for the testimony today, and with that, the hearing is now closed.